A través de una resolución o decreto. Otro aspecto importante es que más del 50% de las secretarías técnicas de estos mecanismos son las autoridades de planificación. Tienen el gran desafío de coordinar a los sectores, de convocar a los actores, de definir las estrategias y alianzas para el logro de los ODS y prepararse para los procesos de rendición de cuentas. Ello posiciona a la planificación como un medio de implementación de la Agenda 2030 y plantea grandes desafíos tanto para los funcionarios como para las prácticas de la administración pública. La Agenda 2030 nos desafía a planificar con una visión integrada y de largo plazo. El nuevo escenario global en tiempos de la pandemia provocada por el COVID-19 hace imperativo tomar medidas urgentes y evaluar los impactos de estas acciones. Para apoyar el seguimiento y monitoreo de avances a mediano y largo plazo, la CEPAL ha puesto en marcha el Observatorio COVID-19, un esfuerzo coordinado por la Comisión Regional con el apoyo de los coordinadores residentes de las Naciones Unidas, que presenta información actualizada sobre los anuncios de política de cada país y otros materiales de interés. El observatorio recopila y pone a disposición tanto las políticas públicas que los 33 países de la región latinoamericana y caribeña están tomando para limitar el impacto de la pandemia, como el análisis de los efectos económicos y sociales que éstas tendrán a nivel nacional y sectorial. En un mapa interactivo, los interesados podrán visualizar de manera clara las acciones realizadas por cada país. Estas están divididas en 5 grupos: medidas de contención, de salud, empleo, economía y educación. Visita el Observatorio COVID-19 de la CEPAL y accede a información actualizada de las medidas de política para enfrentar la crisis en la región. El Observatorio del Principio 10 en América Latina y el Caribe es una iniciativa de la Comisión Económica para América Latina y el Caribe, CEPAL, por contribuir a un mejor conocimiento, difusión e implementación de los derechos de acceso.
Señor Macaya, buenos días.
Participación pública y el acceso a la justicia en asuntos ambientales consagrados en el Principio 10 de la Declaración de Río sobre Medio Ambiente y Desarrollo. El observatorio ofrece referencias destacadas de los derechos de acceso en leyes, políticas, jurisprudencia y tratados relativos a los 33 países de América Latina y el Caribe. Además, proporciona acceso a publicaciones, datos, mapas y recursos relacionados y cuenta con temáticas como biodiversidad, cambio climático, género, educación ambiental, minería, pueblos indígenas o defensores ambientales. Como centro de intercambio de información, el observatorio busca hacer un aporte a la implementación del Acuerdo Regional sobre el acceso a la información, la participación pública y el acceso a la justicia en asuntos ambientales en América Latina y el Caribe, Acuerdo de Escazú. El Observatorio de Igualdad de Género de América Latina y el Caribe tiene como propósito contribuir al fortalecimiento de los mecanismos nacionales para el adelanto de las mujeres, poner a disposición pública información oficial de los gobiernos de la región y facilitar el seguimiento de los acuerdos internacionales de derechos de las mujeres. A través de este observatorio se da seguimiento a la situación de las mujeres en la región, en particular los avances relacionados con su autonomía física, económica y en la toma de decisiones y sus interrelaciones. ¿Qué información se puede encontrar en esta herramienta? Indicadores, informes y estudios, repositorio de leyes, análisis de políticas para la igualdad de género y recursos de difusión. El Observatorio de Desarrollo Social en América Latina y el Caribe es una herramienta regional de conocimiento de la CEPAL. Su creación responde a un mandato de la segunda reunión de la Conferencia Regional sobre Desarrollo Social de América Latina y el Caribe, cuando los Estados miembros le solicitaron a la CEPAL la conformación de un observatorio de desarrollo social que acompañe el diseño y la implementación de las políticas públicas y permita monitorear sus tendencias. De esta forma, el observatorio promueve el desarrollo integral de América Latina y el Caribe con enfoque de derechos y de igualdad a través del análisis de la situación social de la región, de las políticas públicas y de la asistencia técnica a los países que lo soliciten. El observatorio también integra un conjunto de plataformas digitales. Se destacan las bases de datos sobre inversión social, programas de protección social no contributiva, institucionalidad social en América Latina y el Caribe, juventud e inclusión social y de compromisos regionales y subregionales en materia de desarrollo social. A través de su división de desarrollo social, la CEPAL publica, actualiza y amplía estas bases que están a disposición de los gobiernos y del público en general.
Y la vemos también.
Buenos días a todos.
Un placer.
Igualmente. Ahora sí. Mi lente no llegó.
Dr. Etienne?
Sí.
Good morning.
Muy buenos días.
Buenos días. Can you hear us well?
Very well, thank you. And can you
Oh, yes, perfect. We see you and we hear you. Thank you very much.
so much?
Sí, estoy en. Muy buenos días a todos.
Good morning, ladies and gentlemen. Good morning, good afternoon. On behalf of the Chair, Presidency of Costa Rica, we are pleased to welcome you to the second day of the Forum of the Countries of Latin America and the Caribbean on Sustainable Development. Today, we have two sessions, two panels, and I am pleased to be moderating the first panel called Health and Economy, a False Dichotomy. And I would like to begin by giving the floor to Alberto Arenas de Mesa, the Chief of the Social Development Division of LAC. He will be our moderator today for this first panel. So Alberto, the floor is yours. Thank you. Good morning, ladies and gentlemen. Greetings to those of you who are joining us virtually, presided over by Adriana Murillo, the Ambassador of Costa Rica, Ms. Alicia Bárcena, the Executive Secretary of ECLAC, Mario Cimoli, the Deputy Executive Secretary of ECLAC, and Luis Yañez, the head of the Social Division. So we are beginning panel 1, Health and the Economy, a false dichotomy. Now, this panel will address a key issue, health and the economy. A false dichotomy, perhaps? Now, this is an essential debate that we need to have today regarding the health crisis and context we are facing today. Latin America and the Caribbean have been considered the center of the COVID-19 pandemic, and the countries have a high level of informal economy, inequality, poverty as well. These economies are fragmented, fragile, and have partial coverage. Social protection systems have been developing recently in past decades. Nonetheless, there are still significant coverage gaps, insufficient services, and problems related to financial sustainability. This is very complex, and we know that prior to the crisis, there was low growth. We saw that there was unemployment rate and issues regarding poverty. Now, these challenges are further exacerbated by the vulnerabilities of the health and protection systems. And as a result, the overall population is more vulnerable to the impact of the pandemic. Now, in order to compensate the income of households and to compensate the deficit in social protection mechanisms, the states have implemented numerous emergency social protection mechanisms. These have been essential to maintain a baseline level. And in addition to that, there are other monetary social systems that have been brought online. Nonetheless, there is still insufficient partial coverage, insufficient in order to address the needs of the vulnerable population in this crisis. Health is a central issue that we will be addressing during this panel, and human rights as well. These are two key public goods that should be guaranteed by the states. Now, the country's health systems face significant weaknesses. Some of them are sub-funded. Some have access gaps in terms of access. Now, these deficient resources that are available are deficient in terms of technological infrastructure, human resources. In 2019, 40% of the people in the region did not have sufficient health coverage. Also, the population has faced different diseases, not just COVID-19. And so the pandemic has made it quite clear that full access to health care systems with equality is essential for inclusive and sustainable socioeconomic growth. If we are able to protect health, well, that's first of all ethic imperative in terms of human rights, but it's also practical imperative, because when we protect human lives and their well-being, we at the same time will be strengthening the productive capacity of a society. Now, we have also seen interesting public policies proposed to reinforce the health service sector. And obviously, there are some issues regarding these and concerns in terms of economic equality. Let's not forget the disparate coverage in terms of vaccination. Now, today we know that we would like vaccination to be a public asset, public goods. And this calls for special healthcare institutions to ensure that all of the population receives a vaccination. Now we will hear some opening remarks by Carissa Etienne, the director of the Pan American Health Organization. Thanks to her leadership, we have seen that the countries have been receiving support during the pandemic She has also created better capacity in terms of surveillance, medical services, controlling and preventing infections in at-risk populations. Moreover, this organization has provided key support for the countries in terms of preparing and rolling out the vaccination campaigns, sufficient logistic support in order for the public health mechanisms to be in place for vaccination and other aspects. Welcome, Madam Etienne. You have the floor.
Thank you very much. Honorable Ministers, distinguished delegates of the Fourth Forum of Latin America and the Caribbean on Sustainable Development, regional directors and staff of United Nations agencies, members of the Regional Collaborative Platform, distinguished panelists, colleagues, Alicia, a very good morning to you. And thank you for inviting me to participate in this important panel. I am truly pleased to be with you this morning and to provide brief opening remarks at this high-level panel and also to listen to the subsequent interventions from countries. Your reflections this morning on this important topic will be of the highest relevance for the future health and development of all peoples in Latin America and the Caribbean. I take this opportunity to congratulate Alicia Bassina and her team at ECLAC for the excellent report, Building Forward Better, Action to Strengthen the 2030 Agenda for Sustainable Development, a report that was launched yesterday. But for the seminal role that ECLAC has played over the years, and particularly during this pandemic, we are very pleased to collaborate with ECLAC. The COVID-19 pandemic has been the greatest health crisis that this region, and indeed the world, has faced in over 100 years. We have seen how countries rapidly invested and scaled up responses in the face of the pandemic, strengthening their capacities of health systems and services to save lives in the face of COVID-19. And we have witnessed the rapid expansion of social protection programs throughout the Americas to mitigate increased levels of impoverishment and to protect vulnerable populations who have been disproportionately impacted by COVID-19. Women, the elderly, Afro-descendants, and indigenous populations, among others. The countries in this region have highlighted the challenge of sustained and collective action in the face of this pandemic, which has already cost the lives of some 1.27 million persons in Latin America and the Caribbean, and has impacted every single person in this region. There is no doubt that the pandemic has wreaked havoc on economies, on jobs, lives, and livelihoods. And yet, in the responses mounted by countries, we heard of policy, social, and technological innovation that has accelerated through our societies, supporting critical health and social sectors, sustaining action against the epidemic, while adapting and facilitating operations within other sectors, including education, labor, and the economy. It is 1 year and 1 week since WHO formally declared a pandemic. The journey we have traveled collectively has been challenging for all peoples and countries, and for Latin America and the Caribbean as a region. Our health, social, and economic systems have been stretched to the limit. They have worked hand in glove, adjusting measures in every sector as the pandemic has ebbed and flowed. And even as new diagnostics and life-saving vaccines are deployed, a number of countries are now facing a new surge in COVID-19 cases. The evidence that we have accumulated over the past 12 months is clear. Nothing can substitute for effective leadership and science-based public health measures as the means to control this pandemic to save lives and to support economic activity. And so as we look forward into 2021 and beyond, I want to call your attention to 4 critical actions that I believe that we must prioritize to bring to an end this pandemic and to accelerate towards an inclusive and sustainable recovery towards the achievement of the SDGs in this region. Firstly, massive, sustained, and continued intervention by countries is required in the immediate and foreseeable future to suppress COVID-19, to protect health gains, and to tackle increased poverty levels and the health and social inequities that are worsening throughout the region. We cannot relax our efforts even as vaccine deployment advances. We must continue to implement public health measures and to make every effort to ensure the provision of essential health services to address priority health needs. From a human rights perspective, health protection is an ethical imperative, given that when life is protected, society's productive capacity is strengthened. We are reminded that life, health, and well-being constitute prerequisites for economic and sustainable recovery in the context of COVID-19. Secondly, the reduction of inequalities constitutes a central linchpin for action during the pandemic, as well as during the economic recovery. Action is required now to protect vulnerable populations that are impacted through higher COVID-19 infection rates, worse COVID-19 severity, lack of access to treatment, and higher COVID-19 mortality rates. And sustaining and expanding social protection is critical, not just to tackle the pandemic, but to improve pandemic preparedness in the future. A more profound, structural, and cross-sectoral approach to social protection, including social protection in health, will support improved health and the future development in the Americas. Thirdly, it is now time to address the structural deficiencies we have witnessed in the health sector during this pandemic that are a consequence of years of inadequate public investment. The current social and economic crisis has been generated by a health crisis. Future strategies and policies for inclusive, sustainable, and accelerated recovery to COVID-19 must be built on addressing weaknesses in health systems. Our future health systems must be resilient, responsive, and adaptive. They must be based on the principle of the guarantee of rights, protection, and access to health. And they must be built on the vision of universal access to health and universal health coverage, and the foundational structure of primary health care. They must be inclusive and integrated with well-developed and comprehensive social protection mechanisms. Prioritizing health and strengthening health systems based on the primary healthcare approach and the essential public health functions constitute the foundation for the control of the pandemic, the recuperation of lost public health gains, and accelerated recovery in the future. And finally, our health and economies are dependent on the production, availability, and equitable access to pharmaceutical products, vaccines, medical supplies, and diagnostics. And frankly speaking, Latin America and the Caribbean has been found wanting in this respect. It is clear that we need to address the lack of productive capacity in this region to be better prepared for the next pandemic. Few countries produce vaccines with little private sector participation in the region. Policies in science, technology, and innovation have not targeted the health technology sector, and there has been little investment, public and private, in the development of the health technology institutions and health technology development with the participation of academia and the industry. And this is true for vaccines, for medicines, for diagnostics, and personal protective equipment. PAHO is working with its partners, including ECLAC, on this issue right now to support the health, science, and technology and the industrial sectors to create the necessary conditions for increased manufacturing capacity in this region in the future. And the future is now. In addition, I am convening ministers of health on this issue as part of our governing bodies meetings this year, so that their voices can be heard in discussion with finance, science, and technology and industry, and so that we can ensure that we do have the necessary medical supplies to address our health needs for the future in both normal and pandemic times. So, distinguished colleagues, while we continue to tackle COVID-19, and while we look forward to a future post-pandemic, we must remain committed to strive for the realization of our vision for the Americas, health for all. We need to renew our social contract and strengthen the interaction and agreements between government, civil society, and the private sector. We will need to implement structural and transformative action across health, social, and the economic sectors. And most importantly, we will need strong political leadership and the willingness to effect change. The pandemic has impacted us all. Together, collectively, we must act. We must act to work towards more inclusive, sustainable, resilient, and inclusive societies that will allow future generations in Latin America and the Caribbean to survive and thrive. Thank you again for this opportunity.
Thank you very much, Ms. Etienne, for your inspiring words. Que plantean tan claramente la realidad.
You are clearly referring to the reality that the countries in the region are facing and the main challenges pending. From within ECLAC, we have been working very closely and based on teamwork on these matters, and we plan on continuing this path forward and collaborative work in the region.
We now welcome our panel members whose presidency and participation we thank. We greet Mrs. Joyce St. John, Executive Director of the Public Agency of the Caribbean, Mr. Alejandro Verne, Director of the Western Hemisphere Department of the IMF, Mrs. Blanca Margarita Velarde Duarte, National Senator of Paraguay and President of PARL Americas, Mrs. Monica Hassis, focal point of the Group on Migration and Persons Displaced by Disasters or Conflicts of the Mechanism for Civil Society Participation in the Sustainable Development Agenda and the Forum of the Countries of Latin America and the Caribbean Sustainable Development, Mr. Roman Macaya, Chair of the Board of the Costa Rican Social Security Institute of Costa Rica, Mr. Daniel Ineneirati, Director of the Institute of Democratic Governance of Spain, and Mrs. Marta Delgado Peralta, the Secretary for Multilateral Affairs and Human Rights of the Secretariat of Foreign Affairs of Mexico. On the topics mentioned, aimed to open up the discussion, I would like to ask the members of the panel to make a presentation that will basically be of 8 minutes. I'll let you know when you have just 1 minute to go to end your first interventions. At the end of the first round of interventions, we will go to the questions from the countries and delegates who will have 3 minutes each. And we ask them to raise your hand here at Zoom or through the chat in order to appropriately give you the floor. After the interventions of the delegations of the countries, I will once again give the floor to the members of the panel so that in 2 minutes they may share some final words. Those panelists that have a PowerPoint will have the possibility of sharing their screens directly. Any problem that you may have, we can provide help. That way, we will start the interventions with Mrs. Joyce and John, who directs the Public Agency Organization of the Caribbean, agency that has been an important partner of the Caribbean countries throughout the pandemic, jointly with emphasizing the relevance of the health safety at the worldwide level and highlighting the importance of communication of risks. This agency has supported several countries of the sub-region for the acquisition of vaccines, particularly through COVAX, and strengthening of their capacities for the vaccination process. Likewise, the Public Agency of Health Agency of the Caribbean has been central in having confidence of the population in the vaccines to make it successful. Ms. Joan, you have the floor.
Thank you very much for that kind introduction. And to put me up first after Director Etienne is not fair to me, especially after such a wonderful speech. So what I have decided to do in my 8 minutes is to look at the 3 goals of this panel and to also use the theme, the winds of change. And because we can't draw wind, we're drawing clouds. So with the first goal, what we have been doing in the CARICOM region with the mandates from the heads of government, there has been a very strong governance sector, a very strong governance of this entire response to the COVID-19 pandemic. And this has been executed through the support of the CARICOM Secretariat, which has convened not only many heads of government meetings, but also many meetings with sectors. So the heads of government have mandated a whole of society approach, and CARFA was given specific mandates. And what we have tried to do is to interpret the global guidelines and the regional guidelines coming from PAHO into the Caribbean context and reality. Because first of all, this is a small region, small economies, heavily dependent on tourism, which has taken a massive hit during the COVID-19 pandemic. As well, we have small health systems. And so a lot of our activities have been heavily supported by international development partners, especially through funding. And here I would like to recognize the support of PAHO, recognize the support of the European Union. And we have also ensured that we have built on the foundation of functional cooperation in health. You are aware that CARICOM has the 4th iteration of the Caribbean Cooperation in Health. And so building on that foundation, we have worked very heavily with the chief medical officers to ensure that there's a commonality of understanding, a commonality of support, and also a commonality of response as much as possible. And this has been greatly supported by the leadership of the heads of government who have focused on the public health mandates. We have been doing all of this to ensure there's a balance between saving lives and livelihoods. So for goal 2, this whole idea of balance comes out even more. And again, I've got my winds of change represented by my clouds, but the balance between the virus and what it is doing to our systems and our socio-economic status and what is good for it. So I would have mentioned already the political directorate supported strong leadership. As well, by supporting the foundation that we had before. The chief medical officers, the ministers of health, and the prime ministers have shared best practices and lessons learned and applied through close technical collaboration, not only with the health sector, but there has been a lot of discussion with all sectors. And so in trying to balance lives and livelihoods, CARFA has sought to produce protocols and guidance which will allow the safe return to work, play, and governance, because we have had several elections during this short year, and most of the heads of government have been returned. We've also ensured that we had sessions not only with PAHO, but many of the public health entities that either exist in the region of the Americas or have member states within the region of the Americas. And here I speak of the Regional Coordinating Mechanism for Health Security. We had 4 meetings, and they were attended by PAHO, Centers for Disease Control, Public Health England, Public Health Agency of Canada, the Agence Publique de Santé of France, because we have French overseas territories, and also RIVM because they're Dutch overseas territories. So there were joint sessions in that formal setting, and we've also had sessions with Centers for Disease Control to try to resolve the information needs of CDC so that we could adjust some travel advisories. Throughout all of this, in having balance, we must have equity. And so the support that we have got from many IDPs and also from many countries, the humanitarian support, CARFA came up with an application of a formula to ensure equity. And the formula was heavily based on the profile, the age profile of the country, and also the disease burden, not only of chronic non-communicable disease, but the risk factors, the prevalence of obesity, cigarette smoking, for example. And there has been regional solidarity shown in the sharing of vaccines. There were donations of vaccines to some, and they were shared so that when most of the countries started receiving the donations, there was sharing with all. And here, I have to also signal the role of the security cluster of CARICOM, of which CARFA, the Caribbean Public Health Agency, is a part. And the Regional Security System Air Wing delivered a lot of these humanitarian supplies and also distributed the vaccines that were donated to some but shared with all. So this regional solidarity continues. And finally, with goal 3, the winds of change continue. And this looks like a tornado. But what we're talking about, and here I show you the letters of the CDEMA, one of our partners in the security cluster, the Regional Health Coordination Mechanism, and also the Regional Health Communicators Network. Because what we found when we started to procure the vaccines and to distribute them is that a lot of communication was needed to counteract social media communication, which was pushing vaccine hesitancy. So to get past the vaccine hesitancy, we're currently conducting a survey among the member states to find out what are the things that give them pause so that we can tailor-make our communications on vaccines and variants. We've also been able to do testing on variants to advise the member states of what is circulating and if there are any needs for enhancing the public health measures. We were lucky to be supported by the European Union, and therefore we were able to support, it is now 10 member states actually, but some went ahead with their down payments. We supported 9 with down payments, another one we're supporting with purchase, and the pooled procurement paradigm has served our small economies well. We have access to COVAX, and we have to thank PAHO again for the support of the revolving fund. And we also have access to the African Medical Supplies Platform. And of course, to ensure that the winds of change do not blow bogus vaccines into the CARICOM region, we are using the Caribbean regulatory system to ensure there is quality in the vaccines, and we are trying to ensure that there are approved vaccines being used as well. So we're trying to ensure quality vaccines enter the CARICOM market, all towards the benefit of the member states. So we are hoping that the winds in the Americas allow us to get a firm footing so we can go forward in achieving the sustainable development goals, even as we battle the COVID pandemic. Thank you.
Thank you very much, Ms. St. John, por compartir con nosotros.
Thank you so much for sharing the important role in health and public health of the region of the Health Organization of the Caribbean. Mr. Alejandro Werner. Alejandro can help us go deeper into the close links between health and economic recovery, how this relationship is challenged in the context of very unequal economies and with the challenge of expanding its fiscal space, as well as the close relationship that exists between financial sustainability and social protection and health, and with fiscal sustainability. Alejandro, welcome. You have the floor. Thank you so much, Alberto. It's my pleasure to be with you, and I want to thank ECLAC for the invitation and for sharing some information about our macroeconomic forecast for the region and the challenges in public policies faced by Latin America and the Caribbean during this stage of virus, and that we return to economic normality. As you all know, 2020 was one of the worst years in terms of economic performance for Latin America. The forecast that will be published in a couple of weeks during our spring meetings will basically say that we estimate, because this still must get some information from some of the countries, a contraction for the region between 6.8 and 7.2% by 2020. For 2021, we are expecting a recovery in the range of 4 to 5% of growth for the year. With this, obviously, Latin America as a whole at the end of 2021 will still be below the activity level it had for 2019. Some countries may have surpassed it, but when we see the per capita GDP, it's solidly below where we were in 2019. When we see the indices of poverty, inequality, unemployment of all the population, and particularly of the most vulnerable segments such as youth, women, etc., then we will have a social gap which is very significant, even though when the economy in 2022 may recover the levels of 2019, and per capita terms in 2023, we will recover levels of per capita income. And 24, some of the countries, the social gaps will have been expanded in a very considerable way, and the challenge for the region will be very large.
With regard to economic aspects, what factors have enabled the region to begin economic recovery? Well, I would have to say, first, the positive impact of the economic recovery of the advanced economies, China and others, that has had a widespread impact on the region. We have seen how exports have quickly bounced back during the second half of 2020. We also saw how remittances, which is a factor that we thought was going to be a recessive leverage in the region because that was occurring in the main developed agencies. But in the end, the remittances ended up being a positive leveraging action. And we have seen that this clearly represents a impact as a sound basis for helping out families. But in Latin America and the Caribbean, we saw that the remittances underwent a significant growth period beginning in May, June. Now capital flows also, following the financial and monetary stimuli that were implemented in Europe, US, and Japan, did have a positive impact on the governments and the companies so that they were able to access financing in the international capital markets. And then finally, the exchange rates bounced back significantly with regard to raw materials in the second half of last year. It's also important to underscore the economic policy response that we saw throughout the region in 2020. With regard to monetary aspects, interest rates were reduced, liquidity was boosted, and there were special programs for supporting the financial sector. And with regard to fiscal aspects, let me emphasize this here, we saw that there was average support of 4.5%, 4.5 points of the GDP, and the fiscal support came through guarantees, warranties, credit from development banks, etc. And essentially, this constituted more of an impulse, more support than we expected. Now, this fiscal, it was greater than what we expected for the countries in the region. And I think it's greater than what some of the governments were expecting. Now, a drop in international interest rates obviously helps out. And we have not seen debt issues that we saw in the past. And with regard to a drop in investments and increased savings of the families has also led to more opportunity to fund the deficit. So we are thinking that in 2021, if we are to be prudent and if we are to strengthen the mid-term government coffers, we believe this will send out a positive message. Once, of course, we get back to a normal economic situation, and then we will have the necessary adjustments to stabilize debt scenarios. And this should also lead to short-term opportunities that will allow us to continue to support the most affected families. And let me also emphasize how that we have this hypotheses that GDP will bounce back, and if so, the employment rate should also be improved. And as a result, the most needy families should be able to receive support. So in 2021, we will see that the need to continue supporting the most needy affected families will continue. As SMEs will also require additional support. And also, I believe that quickly we will begin to see in the region an effort that will have to have some financial support, but also support in terms of policy design to allow us to recover the losses we experienced in 2020. So the deteriorated quantity and quality of school time in the region will have a key impact in the midterm. And if we are not able to implement quick measures to remedy this, the impact will remain. Allow me to now refer to some aspects, financial support activities in 2020 and 2021. In 2020, a significant portion of the countries were able to fund the expansion of fiscal deficit through multilateral credit from the Multilateral Bank, from CAF, from the IDB, from the Caribbean Development Bank, and the IMF. We, from the IMF, supported more than 20 countries for roughly $60 billion in support through the emergency lines of credit and contingency lines of credit for countries such as Chile, Peru, Colombia. and also traditional programs. In 2021, we are obviously willing to continue to support these countries, and the international community is reaching consensus with regard to special withdrawal rights, but just let it be known that we are working on programs within the IMF, and given this is in keeping with this vision that I'm talking about, in that the fiscal space is greater than what some of the authorities thought it would be. The deficit in some cases is not as bad as the authorities thought it would be. This and we do know that still we need to support the most vulnerable sectors, and it's essential to dig in our heels and ensure that the public institutions have solid financial standing and use this anchor, this digging in to provide support to families, households, companies, obviously the health sector, as well as the education sector. And with this, I would like to conclude my opening remarks and once again thank ECLAC, Alicia Bárcena, and Alberto Arenas for inviting me to speak at this panel on health and the economy. Thank you very much, Alejandro, for your interesting remarks. Here, we have confirmed the economic forecasts with regard to 2021 in terms of GDP and per capita GDP, that these will be under the 2019 levels, and we have to wait a few more years if we are to reach those past levels. Also, you refer to the importance of what ECLAC has been underscoring and the importance of continuing to provide support to families, to vulnerable groups, to social protection, through monetary transfers throughout 2021. This emergency, this health emergency and pandemic continues to affect us. So now let me move on with the next individuals on the panel. Blanca Margarita Ovelarde Duarte is the next to speak. She is the National Senator of Paraguay and President of PARL Americas. She will refer to the disproportionate situation affecting women, disabled, indigenous individuals, Afro-descendants, and other vulnerable groups. We have seen how the countries of the region have implemented a variety of different emergency programs and social protection mechanisms. And this is in part due to the effort put forth by many senators. Now, Ms. Ovelarde Duarte will refer to what she has seen, and she's a national senator, and she will refer to her situation and from her country, as well as her experience as president of PARL Americas. Blanca, you have the floor. Thank you for joining us. Thank you so much. Good day. It's quite a pleasure to be here with you today at this forum, and I would like to thank ECLAC for having invited me to share my experience with you, the experience of my country and the experience of PARL Americas from the parliamentary perspective. Now, on behalf of this panel, Health and Economy, a false dichotomy, I would have to say it's not a false dilemma. It's a real dilemma dichotomy. Now, we know that this pandemic has significantly impacted all, and the impact has been unprecedented around the globe and has practically paralyzed and brought the economy and trade to a halt. It has had a profound impact on individuals' lives. Many individuals have lost their jobs, those who were in the formal market. Many of them have simply been let go, and many who have worked in the informal economy have not been able to leave their homes. They have not been able to pull together one or two jobs on the side, and obviously the pandemic has significantly affected relationships. Now, we have been paying close attention to this. The public agenda is focusing on the health response, and the health sector clearly has risen to the occasion, but clearly today the economic policy issues are more relevant than they have ever been in the past. So this is not a false dichotomy. Health and the economy have been significantly hit hard. Unprecedented impact is what we have seen. And we believe that this has been a turning point in the history of humanity. Experts, economists, physicians, politicians, sociologists, teachers, engineers, all of us need to expand our imagination and find the best way to resolve this going forward. Let's find the best way to have a globe, a world, an economy that's more environmentally friendly, and figure out how we can use technology for the benefit of our lives and for life in general. Now, obviously, we have to focus on a new sense of humanity today with a different approach to empathy, more social justice, more compassion and care for others' pain. So Parl Americas is an institution that fosters dialogue and diplomacy at the parliamentary level between the 36 parliaments in Latin America and the Caribbean. Now, we have a specific focus on open parliament, gender equality, and climate change, all in order to provide support for meeting the Sustainable Development Agenda 2030 goals. Now, our role as parliamentarians from the very beginning of the pandemic has been quite complex and challenging. As a region, we believe we have, or as an institution, we have adopted a dynamic role, and we believe we have provided support to many of our member organizations. We have come up with a variety of different tools to assist the parliamentary role. For example, there's a compendium of legislative and executive actions taken in Latin America and the Caribbean as a response to COVID-19. This was conducted in collaboration with the National Assembly of Ecuador, and this provided us with a glimpse of the various measures adopted throughout our region. It is also a tool for dialogue for future situations. Likewise, we have worked closely with legislation, with legislative authorities, and we have published 2 documents aiming to strengthen the role of Congresses within the context of COVID-19. Now, the first is from the open parliament perspective, and the second addresses gender equality. Finally, our guidelines, we have issued guidelines to support a green economy post-COVID-19, and this provides support to the parliaments to do a better job, and by making reference to resources, tools, international frameworks, for example, such as the 2030 Agenda, providing these guidelines to all the various member institutions so that they may identify sustainable investment opportunities in other aspects. So that is just quickly a sample of what the parliament has been able to do and encourage and foster in this extremely difficult moment that we've all had to adapt to and make concessions. So with regard to emergency protection programs and their sustainability within a limited fiscal space in all of our regions. So we know the region and all the countries are facing increased debt, which is inevitable given this. Now, with regard to all this, I would like to point out, first of all, that the parliaments play a key role, a crucial role to exercise political control over the response to the COVID-19 situation. Also, their role is to assess and adopt, approve, pass laws, emergency laws, for example, national funds to meet our population's emerging needs, the populations that we represent, our constituents. We also have the responsibility of ensuring transparency with regard to government actions. Now, this, of course, is more important today than it has ever been in the past. Now, we have seen in various countries there have been announcements, individuals reporting a lack of transparency, a lack of accountability, and this has resulted in a lack of trust by societies in their authorities. And this is extremely painful because we are all going through a difficult situation. It's key to ensure that our citizens continue to trust us and the government with regard to our actions related to the pandemic. Also, it's essential to ensure that citizens are duly informed, that they have the information they need. Now, there are several examples of measures in the Caribbean and in And in Latin America, for example, measures taken to reinforce healthcare systems, new programs for social protection, emergency protections, boosting national funding to reinforce the public health system, boosting access to telemedicine, implementing policies to ensure the arrival of medication, vaccination, protecting public healthcare workers, and other support for the economy to bolster, to buoy up the employment sector, and make sure that the side effects of the situations are taken care of, such as domestic violence or child abuse, etc. Now, policies are key. That is the essential role of parliaments. Parliaments have implemented institutional mechanisms to reinforce their role as a political guardians and policy guardians. This is what we do. Parliaments from the hemisphere have transitioned toward a different layer. We have created commissions to follow up on the health situation and the fiscal context. We have conducted analyses on policies rolled out and how the funds earmarked by various ministries have been rolled out. We are maintaining dialogue with public authorities, and we have ensured that the accountability mechanisms are in place. This has resulted in a new publication in Latin America with regard to policy and public control during the pandemic. Now, Paraguay, my country, is taking part of this commission, and this commission in my country is managed by the public policy authorities that oppose the government, and they are they're scrutinizing all of the actions of the executive authority. It's also important to bear in mind environmental aspects and environmental health. Now, all decisions made by governments today will have an impact on future generations. It is extremely key for the governments to recognize the ties between human health and the environment, and the high levels of production and consumption that we are accustomed to, climate change, climate degradation. These are situations that we simply cannot sustain going forward. If we focus on green solutions, we will be able to address the unfair impacts of what we have seen, and not just as unfair impact from debt, but environmental degradation and the legacy, the negative legacy that future generations will receive. It's necessary to address the barriers to growth. And Ms. Blanca, you have 1 minute. Green recovery is key. Let me emphasize now green recovery and the role the parliaments play here. I think the power of the legislative branch is essential in this regard. It is essential to include the green component so that we can have policies that are evidence-based and that they actually recognize the people's needs. Now, it's essential that it's clear that the way forward is green. Also, we need to work on approving budgets so that we can ensure economic recovery packages and investing in green jobs to promote green economies to address the climate emergency, climate crisis. And finally, with regard to the acquisition and delivery of vaccinations, I believe that legislators play a key role in terms of adopting budgets and continuing to provide information to the population to ensure transparency with regard to vaccination campaigns and scheduling, and make sure that the vaccination process is efficient and effective. In this regard, I would like to emphasize the negative aspect of hoarding by certain economies that have acquired 4 to 5 times what their populations require, their inhabitants require. It's essential for humanity across the board to adopt a unified position so that we can all move forward and leave behind this unfortunate pandemic. Thank you, Ms. Ovelar de Duarte. Thank you for your remarks. I would like to mention that each panelist will have 2 minutes at the end to reflect on these aspects. Now, the sanitary crisis obviously is unprecedented, and we have seen that it has exacerbated the inequality in the region, and policies should lead to new fiscal social compacts that are required to face the pandemic. Now, I would like to invite Monica Yasis. We know that the pandemic has had a significant impact, a worse impact on certain population groups. Prior to the pandemic, these individuals are also facing a wealth of a great deal of inequality in terms of access to health and basic services. I'm referring to migrants, immigrants, others who were facing and continue to face a humanitarian crisis. We know that many of these individuals have been left without a network, and the floor has been pulled out from underneath them. And Monica Jasis will provide us with some specific information relative to this. We have the floor.
Thank you so much on behalf of the mechanism for civil society participation, sustainable development agenda. We thank you for this opportunity and for including us in this dialogue. We thank ECLAC for the opportunity. The fundamental question is whether health and economy are a false dilemma. We believe it should not be a false dilemma. And the countries that are outside of the region, such as Taiwan, South Korea, and Vietnam, knew it so well. They have the least amount of contagion, and their economies were not so hurt because they adopt complementary measures to prevent contagion. Under the fundamental principle that a strong economy demands healthy population, the measures that worked in the countries where they had a lower contraction and lower amount of contagion were to expedite, act fast, have sufficient health personnel, the tracking of positive cases, massive testing that was recommended by WHO, measures of social distancing, and masks on a mandatory basis, as well as the use of ICTs to support efforts. Outside of Latin America, the citizens have been confident on a short pandemic with a short economic contraction and to resume life as soon as possible. In our region, we have more than 50 million persons infected. The pandemic by SARS-CoV-2 finds Latin America with a series of social inequalities, as was previously mentioned, and gender inequality with high rates of unemployment and underemployment, with health infrastructure that are deteriorated, insufficient, social differences in access, and chronic diseases. And some governments took containment measures that were lax, with ambiguous information and an erratic use of the media, which ended up in a little confidence from the citizens, and the pandemic ended up by being more extended. The political response of the government was not sufficient, except in a few countries, as well as the budget for the implementation of healthcare policies. From the start of the crisis by coronavirus, the commitment of the non-governmental organizations of society have proven that we are needed the most. In the current scenario of economic contraction, the NGOs, particularly those of women and the feminists, have played a crucial role. Not in spite of their meager resources, we have supported social groups in more vulnerable conditions, especially those who live in situations of poverty, discrimination, exclusion, such as migrants, indigenous persons of African descent, the elderly, disabled, and persons living with HIV/AIDS. It is indispensable that the countries develop affirmative health policies that will permit the communities living in conditions of greater social vulnerability to access health infrastructure, including free access to vaccines and prevention. Pandemic in Latin America showed great structural problems, which are conditioning and determinants of health, which intersect with social variables and sharpened the lack of conditions for the exercise of human rights. So we consider it must be necessary to make health seen in a systemic way as is, and its importance in world health. Overcoming these existential measures that have been mentioned that do not facilitate the resiliency of our people. Pandemic found us in situations of debt, of significance and dismantling of the healthcare systems, showing multiple forms of corruption in several countries of the region, which conditioned the crisis and the establishment of this possible dilemma. At a healthcare level in the region, there's a disbalance between the health risk factors and protective factors. And the risk our societies suffer from diverse epidemics that date long back, that have not been able to contain or have not been wanted to be contained given the great social and economic and gender inequality prevailing. As, for example, the epidemics suffered by Mexico in terms of obesity, which is the second country at the worldwide level in terms of obesity, or, for example, infectious diseases such as malaria that affect Central America and the Caribbean, HIV/AIDS in Chile, Bolivia, Brazil, and Costa Rica. Informal workers, another topic that in Latin America and the Caribbean represent 140 million persons, were those most affected due to the necessary restrictions in circulation, which prevented the economic way of making a living, and lack of water even though some countries had some compensation measures and some were only available for the formal employees, which made the most needy families more poor, particularly, as was mentioned before, youth and women who work in the services sector and which do not have regular employment. Same thing with the migrant with irregular jobs because of lack of documentation. Education was depreciated because it fell on the shoulders of the families, particularly women. And also there is an epidemic in all our countries of domestic family and violence against women. Gender inequality also led to unpaid care work, and it was 24.4% as compared to 7% in men. The lack of digital connectivity and the cost of the ISPs increase the digital divide and the obstacles of access to educational resources, which are central for education and health during the contingency. Now, we have seen some opportunities that arose that I'd like to mention, which are important. Most of the states already had, to a greater or lesser degree, different public policies already regulated. Then we saw remote work more intensely, but most of the countries in this case need to regulate it. It's a good thing that in Argentina there's a law for remote work. Computers, connectivity, and digital competencies are very useful and necessary for education of the population in health. Radio once again appeared as a mass communication media that is very important during contingencies, particularly for the most disenfranchised persons. We also saw independent journalism once again appearing in our countries that have generated trust, and they help to inform and strengthen the communities. We have other examples apart from all the ones that you already saw. Uruguay showed good results in containment of the pandemic, particularly if there's been a health system that's functional and regulated. Costa Rica continued with the services of the national network of child care so that women could continue to have state-provided care. Cuba, Costa Rica, Uruguay, Antigua, and Barbuda maintained access to nutrition programs during the pandemic. El Salvador distributed food kits, and very specifically for women, emergency feminine kits, even women who were deprived of freedom. And Mexico legislated about the national system of care during the pandemic. Insofar as the vaccines, what we can say is that the rich countries moved ahead and they purchased large amounts of vaccines, which led to inequality with the least developed countries, and the wealthy have 3/4 of the vaccines produced so far. What we applaud is Mexico's initiative was claimed at the Security Council of the United Nations for the guarantee to fair and equitable timely access to vaccines, as well as its distribution for all the countries. And of course, that we support this initiative mentioned by ECLAC, by Alicia yesterday, that we need now a regional COVAX initiative. What we would like to mention is that there's very few private companies that have made a commitment with a joint initiatives to accelerate the processes of research, production, and distribution. And of course, we need an allocation of vaccines that is fair and sufficient at a global level. Vaccines, of course, must be free of cost for the middle and low-income countries. We need agreements with the financial global funds that are accessible and that may be served without choking the local economies. We need investments from the private sector of each country for the development of vaccines, as was mentioned by previous colleagues, and we need the use of human resources and technical and civilian resources contributing to the design of efficient distribution systems. The most specific recommendations will be left for the final 2 minutes. Thank you. Thank you so much, Mrs. Yasis, for your intervention. The pandemic increases inequality, income, gender, and access to health gaps, situation that must be faced with total resolve by the region. We will now listen to Mr. Roman Macaya with his broad experience in health issues and even more so the direct responsibility of directing the Costa Rica Social Security Institute in terms of social security. Mr. Macaya can give us very important elements from the perspective of one of the most advanced healthcare systems of the region, sharing the challenges that they have faced by the pandemic and making compatible health and economy and effective access to vaccine. Mr. Ramon Macaya, you are welcome. Thank you very much, Alberto, and I want to thank ECLAC and Mrs. Alicia Bárcenas for the invitation to this panel. I start by the title, Health and Economy, a False Dilemma. I would say to start that without health, there is no economy. Even more so, if health is aggravated at the point where we have seen in certain waves of the pandemic, there's not even society left. So, in the short term, there can be conflicts between restrictive measures geared to improving the healthcare indicators or opening to help the economy. But we don't even have to go to the long term. In the midterm, the interests coincide, because if the cases increase too much and health is deteriorated, as we have seen, economy closes itself on its own. So we need to think that in the future, we need to create redundancies for the continuity of business, and business speaking in the broadest term of companies, institutions, governments, the country, and the world. I'm talking of all the supply and logistics in terms of equipment, of personal protection equipment, and everything needed to cater to an emergency such as this, but at a worldwide level. Education as well, that education, production, and government can continue in the midst of a pandemic as this one. If we see what has happened in the last 20 years, we have had 3 coronaviruses that have lived to humans, SARS-1 in 2002, MERS 2012, and this one, SARS-CoV-2 last year. And we can also add H1N1 of 2009. So it's 4 viruses with a pandemic potential in 20 years, 1 every 5 years. So we need to foresee that these emergencies do not necessarily come every 100 years. They can potentially come every 5 years. Thus, the need for redundancy and capacities. I will talk about the challenges that we face in Costa Rica with the pandemic. It had an impact in the informal work. We depend on formality for the funding of Social Security through installments paid by the worker and the employer. Employment was lost, particularly the formal employment, so there was a reduction of revenue. There was a deterioration in the waiting time for the pathologies, procedures, and surgeries that were non-COVID. A limited capacity to serve the pandemic and greater expenditure that was necessary to provide the care. Nevertheless, from the very start, we recognized that we had a very important strength, which is that all our system for public health care falls under a single administration, the Costa Rican Social Security Institute. All the hospitals, the clinics, the purchase of supplies, everything is under one administration, which allowed us to flexibly and timely way redistribute income. Our fast redistribution of hospitals, centralized purchasing, allowed us to operate in integrated healthcare networks, both for the diagnostic test as well as for patient care. We have a single digital healthcare file, what we call EDOS, that allowed us to open the medical records of every person that we need to care, regardless of where they may be in the country, and could get immediate local care, and a specialized coordination for the transport of COVID-19 patients when we needed to search for available hospital beds, particularly intensive care beds. The response of the Institute was very coordinated with other institutions, so the Ministry of Health, the National Emergency Commission, the Foreign Ministry, the air surveillance system for the transfer of patients, Ministry of Finance for the budget. There was a fast response of the installed capacity in the different centers that we converted into centers dedicated to COVID patients. We also generated a medical unit of more than 50 family doctors who worked every day, full day, calling the patients, giving them follow-up, responding to the questions, and providing distant monitoring to see when we needed to intervene in the transfer of a patient who was at home and to bring that patient to the hospital. 96% of the deaths for COVID in Costa Rica have been within the hospitals. That is, the people who need to get to the hospital, they get there. And that has been quite an achievement. Then we had the supply of medications at home, remote consultation to protect the patients while they receive their care, and also to protect the healthcare personnel, and other campaigns, for example, of vaccination against influenza. In the midst of the pandemic, we vaccinated 25% of the most vulnerable population against influenza to eliminate the morbidity burden due to influenza in the midst of the pandemic. We also had a series of measures that were implemented to protect the users and to protect the incomes or the revenues of the Institute. One was the expanded coverage of the workers' insurance with suspended contracts with furlough. Usually they have 6 months of continuous insurance after the furlough starts. At the end of this month, we will have 1 year of that extended coverage. We generated arrangements of flexible payments for those who had debts with Social Security, that they could finance those debts, that they had more flexibility and in a friendlier way, so that to keep them being formal and keep the links with the Social Security. We temporarily reduced for 6 months the minimum contribution rate so that the companies would not lay off their staff, but that they could reduce the working hours and reduce the contribution to the Institute. We also expanded the definition of disability that generates an income or subsidy for persons who were suspect of suffering from COVID and who had and were insured, or a postponement of mortgage payments with our pensions system that provides these mortgage loans. Also, for the persons who had pensions, practically 100% are in the banking system. So 90% of the bank deposits were done electronically, and a bonus from the central government to generate income for the persons who were struggling. I end up by saying that something good brought about by the pandemic was innovation. We generated new applications in the digital file that can be downloaded to the cell phone to evaluate the risk of COVID contagion. We generated new studies, we implemented studies, an international one that will have worldwide relevance, which is designed to measure the characteristics of the immunity for patients who have recovered from COVID. We have been developing equine antibodies from horses against COVID-19 that right now are in their second clinical protocol for the optimization of the dose. We analyze convalescent plasma and different therapies in different clinical research trials. And also we published and developed a new biomedical research regulation for Social Security. And as a country, we designed and there was a local production of ventilators.
All of that makes us understand that once we come back to the new normality, we should try to maintain all those positive impacts. That is telemedicine, data analysis that will allow us to leverage the information that we have generated during the past year and a half. And we also need to come up with new regulations. It's not just the new normality, but the new regulations. Now, during the pandemic, there are many aspects that we were unable to tackle, not because we didn't have the capacity, but rather because the regulations and legislation was not clear. So once this finally comes to an end, we will need to work within our legislative bodies and within our institutions to define new rules, a new roadmap, rules of the game before a new pandemic hits us yet again. Thank you for that, Mr. Macaya. Your presentation was very clear and concise and precise. If we see that infection rates continue and we do not have access to vaccines, economic recovery will not be possible. Now we will hear from Daniel Inerarity. He published a book called Pan Democracia, and this is a philosophy with regard to the crisis. And he has spoken with regard to a variety of different topics, referring to the interdependence and interactions and in ties within our societies. These have been underscored as a result of the pandemic. He refers to risks that bring about new gaps, exacerbate existing gaps, and bring about new gaps. So, Mr. Inerarity, welcome to this panel. Thank you to ECLAC for allowing me to join you at this magnificent forum and to share some ideas with you, some ideas regarding the philosophy, the political and economic philosophy that I have been developing with regard to the pandemic and the democracies that that are in existence today. Now, I will have a challenging time to speak after the fabulous speakers preceding me. So I would like to focus specifically on one aspect that I think is essential for this discussion. For example, if the democracies today, democratic societies, are they actually prepared to manage the crises that are in the fore and the future, such as the one we have been dealing with? Now, in order to answer this question, let me refer to certain aspects. We know that we are we are accustomed to dealing with crises. For example, Chernobyl rather, the financial economic crisis of 2008 and many other. There have been an onslaught of crises that we have had to deal with, and our systems need to be well prepared to identify these, to address these, to share analyses, to conduct assessments, reasonable assessments of the situation, to be a few steps ahead. Now, I think we're all quite aware of the fact that we are not well prepared to manage these crises, primarily because our political systems continue to just close their eyes. Our policies close their eyes to the latent or incipient issues. And we have systems that are quite short-sighted and that only respond to that which is most urgent and immediate. Systems that are treating the symptoms and not the disease. And the cost will be, future generations will have to bear this cost, unfortunately. And the problems are not being resolved and they're just being shelved for the future. We collectively are incapable of addressing these latent issues. And I think this is one of the major difficulties that our current political systems face today. Now, as societies, we are not well prepared either to have a governance system that is able to be a few steps ahead. We have seen that we have faced a constant barrage of issues and crises, and this has left us weakened. We know that we are often surprised by the crises, and once they have occurred and passed, we are not always in agreement with regard to how to interpret these and what lessons can be drawn from the past crises. That's why my proposal, and this is my premise and something I've been working on for many years, that's why we need to strategically address the crises and have a system that will strategically address situations for the future. Now we have this concept of financial capitalism, we have the climate crisis, we have an aging population. These are just a few examples of the crises, pandemics, conflicts, and sustaining our public pension systems, etc. These are just a few examples of the crises that we have faced and will continue to face. And all we need to do is to figure out when these will occur and to what extent. And how can we address these? Once we try to have some conjecture with regard to this, if we adopt a more strategic approach to this, we would be able to identify these trends. In other words, we would be able to act when it's no longer too late. Obviously, in the past, with this specific crisis and with all the others, perhaps we have acted simply too late. Now, if we are to be more strategic at the policy and political level, then I believe we would be able to better address the crises, because these crises call for better and more robust information with regard to the long-term impact of the decisions we're taking today. It's important to understand the alternatives out there. What types of risks will we be facing, or what type of risks do we actually produce? It's important to have a systemic or holistic approach to the crises at the same time, and not just at the domestic national level, but globally as well, because these crises have an impact globally. I also believe that if we do that, policy approach will no longer focus on repairing a situation, but being a step ahead. Now, in the contemporary planning approach, we need to introduce the element of future. Otherwise, we will be constantly surprised. And in order to be a few steps ahead of these dynamic scourges, we need to adopt best practices, the best practices of the past, as well as based on experience. But it's more than that. If we are to be strategic, we need to imagine the future. And since we have no reason to think that the future crisis will be similar to the past ones, we know that our past experience just will not suffice. Global financial crises, environmental crises, health crises, etc. We see that our policy decisions are arriving too late. Prophylactic decisions may be helpful. We will only be better prepared when the capacity of our policy bodies will be more robust, and that we know that even our regulatory bodies may become obsolete or ineffective. So if we are to better manage crises instead of focusing on the events causing the crises, let's do more. These challenges are not resolved with the task force for the crisis, an emergency task force. Those are only helpful for remediating the impact. What we need is for the governments to think strategically, because this world is changing radically. Therefore, if we act before, during, and after the crisis, well, we know that's difficult because often the changes that I'm referring to occur in very complex systems, the financial system, the global health system. They're complex systems. And we know that the causes are not simple, they're not basic. And the impacts are wide and widespread and interrelated. The complex world we live in today calls for complex solutions. And we need to have systems that do not face the bureaucratic restrictions. Sometimes we may have what seems to be a stable solution, but that may lead to other problems that we will have to solve as well. So it seems that our governance systems are just adapting. The modern democracy is facing this challenge, and we have a segmented system. We need to be prepared to govern in a world where the crises will not be viewed as something emergent, but something constant. So our policies need to be able to meet the needs of the interactions that occur, the interdependence of our societies, policies that are able to constantly reinvent themselves, not static, but rather dynamic and constantly changing and adapting. Now, a new way of making policies that are more appropriate to a constantly ever-changing society that is increasingly unpredictable. So let's grasp these opportunities to be more democratic. I would like to conclude with the following comment. If we have not been able to predict or be a few steps ahead of these crises, at least we need to be able to learn from them. Now, it would seem that the economic crisis of 2008 was not fully leveraged. We did not take full advantage of this to come up with a more stable system with appropriate, robust institutions. So we could, for example, with regard to reforming public systems, are we really doing what is necessary to have the best possible reform? This panel, for example, has referred to the necessary reforms that would allow us to not just face the current crisis, but to face the next crises with a better positioning and better preparation. Technology, institutions, they need to be more robust. And if we are not capable of taking advantage of the crisis today to bring about the necessary reforms, our future governments will not be well prepared. And for those who are expecting better times ahead, we have to let them know that that our societies will not have resolved their problems. So thank you.
Gracias por su intervención, señor Inerarity.
Thank you for your remarks, Mr. Inariti. That you provided us with a very interesting perspective regarding the pandemic and that's affected our region and the world. Prior to moving on with the next speaker, I would just like to remind the delegates that they can request the floor to speak after the last panelist, who is Marta Delgado Peralta. As mentioned at the third regional meeting for social development in Latin America and the Caribbean, which was actually held in Mexico in October 2019, the Undersecretariat was very direct in terms of her commitment to having a more equal society and the need for individuals to be viewed as subjects of rights. Now, we know that the pandemic has forced us to adopt that approach and to focus on multilateral affairs. And when we refer to universal benefits such as vaccination, this is key as well. We have to make sure that everyone has access to health. And Ms. Delgado has a great deal of experience in this realm, so her contribution will be very valuable. You have the floor. Thank you, Alberto. Greetings to all of you. Joyce, John, Alejandro Werner, Blanca, Monica, Roman Macaya, Daniel Inerati, and of course, Carissa Etienne, Director of PAHO, and my dear friend Alicia Barcena. Good morning, ladies and gentlemen, and thank you for inviting me to take part in this panel. I think this panel is a fabulous opportunity to reflect upon these measures and the responses that we have rolled out to address the health crisis. And our social protection programs clearly have been one of the areas that we have focused on, and we know that they can be further reinforced. So in any event, apart from all the health and human and emotional crises, for example, the confinement, all of this that has resulted from this pandemic, obviously are key aspects. And we know that moving forward, we expect to have economic recovery. And this obviously will be yet another major challenge for our region. It has been mentioned, but I would like to reiterate that this is one of the worst crises in recent human history, and some of our governments were prepared for natural disasters, but most of us were not prepared to tackle a pandemic of this scope and magnitude. And this is not just a health crisis. We have realized that it has brought about a crisis in terms of human rights, security, and obviously it's a socioeconomic crisis as well. So accordingly, as all crises do, we have been provided with some opportunities to be innovative and to learn from the lessons that we have been dealt. Now, for Mexico, this is a key opportunity for us to reaffirm the importance of multilateral coordination between the states and the private sector, civil society, and other key stakeholders. We are strongly committed to global actions, and we are, of course, very excited to provide our population and others the benefits of the global agreements that some may think are quite abstract, but in this context, I believe they have a great deal of practical potential. Now, the 2030 agenda, for example, the decade of SDG actions, these obviously need to be centered around sustainable recovery. And Dr. Barcena always refers to how perhaps, yes, okay, we may have backslipped 10 years in terms of stability and our economies in the region. So as a result of this, it's essential for us to not lose sight of this when we make the next upcoming decisions. Now, human health and the economies are closely interrelated, and obviously, we must not forget biodiversity and fighting climate change. These are interrelated with the same two issues as well. And it's essential to understand how a loss of biodiversity has an impact on climate change and how global climate change is also affecting the spread of these global pandemics, and how protecting our ecosystems and the policies related to urban resilience, how all of these will assist us in being better prepared to face epidemics. Now, in Mexico, we have promoted throughout the year in many different fora these concepts, and today I, with my team, have been we have all been fighting COVID-19 for a year now. And a year ago, we were requested to begin negotiating the delivery of personal protection equipment and vaccines. We thought the situation was going to be temporary, and we just thought it was going to be a few months long. But now, looking backward, it's amazing to see that we have been working on this for an entire year, and so many other individuals have been working side by side. And of course, there are more opportunities with regard to the multilateral realm. Mexico has redoubled its efforts in this area. We are trying to ensure that there's fair treatment and with regard to diagnoses and vaccinations. That's why in April of 2020, we adopted a specific posture with the G20, and we are in all the various multilateral activities, we have been present. Mexico, as pro tempore president of LAC, we have been trying to leverage a variety of different opportunities, gaining access to these tools to face the pandemic. Now, there's a key message here. I would like to echo a message from the Secretary General of the UN, who has said that the pandemic, the negative impacts will force us to rebuild, but at the same time, there's an opportunity here to build better and to create economic and social systems that are more resilient and more sustainable, fair and more inclusive at the same time. And the reality seems to being shaped as something quite different. Now, the World Bank has shown how some higher income countries clearly have reached agreements and resulted in the hoarding of vaccines, 3 to 10 times more vaccines than they actually require. The lower income countries have acquired different doses, and they will begin distributing these next year. Now, today, the middle income countries such as Mexico face another key challenge, but at the same time, an opportunity to be more unified. In Mexico, the AstraZeneca vaccine will be distributed, and at the same time as it's being produced, it will be distributed so that this will be equitable distribution to the population. We, in our country, I believe that this is a unified approach that is also helpful because it is something we need to reinforce at the multilateral level. I think it's clear that if we all need to be safe for the world to be safe. We have at-risk groups, and we don't want the contagion to reach those and spread. And the most vulnerable countries are key here. Now, in addition to these concerns, there are a variety of different reflections that we need to focus on. Now, let me mention that Mexico is very excited and enthusiastic to see that the World Health Organization has been made more robust and has received support, and PAHO regionally. These are the bodies that need to be sound, robust, and reliable, and must not be questioned because their value for humanity has been made quite clear.
Today, we also have an authority in WHO, which is the one that must dictate restrictions, the treatments, the vaccine. We need to assign them credibility, and the countries need to act confidently with the conviction that the decisions adopted by their expert bodies are the ones that they recommend, such as with very high ethics and scientific codes. So I believe that this is a very important dialogue, and I thank you so much for your attention. I believe it is relevant for us to analyze our common positions that may get in the way that we approach these topics, and everything related to the acquisition, distribution, and application of the vaccines, including the treatment on pandemics and the regional action plan that's being designed. We hope that equity will prevail, as well as regional ethics and global solidarity. Thank you.
Muchas gracias, señora Delgado.
Thank you so much, Mrs. Delgado. We share that one of the central challenges in 2021 will have to make effective and comprehensive, equitable access of the vaccines through public policies that will help us face the pandemic in the region. I want to thank all the members of the panel for these interesting and illuminating interventions. And before going to the country interventions, I see that Dr. Carissa Etienne kindly stayed with us throughout this debate, this interesting debate between health and the economy. Dr. Carissa Etienne, I would like to give you 2 or 3 minutes for some final thoughts before going to the country interventions and returning to the panelists. Dr. Etienne, you have the floor.
Thank you so much, Alberto. This has been really, for me, a very interesting panelists, judging from the range of topics that were discussed, but approaches. And I would like to echo the fact that we cannot afford only to react to a current pandemic. This struck a chord within me. We need to anticipate. We need to be planning well into the future so that we are better prepared for the next pandemic. And in being better prepared for the next pandemic, we will at the same time achieve a certain level of sustainability. We would strengthen our health systems based on the many policies that that member states have agreed on. We will ensure better investments for health. We will ensure also social protection for our people, all leading us to the point of sustainable development where people are at the center, where we are better placed to pull people out of poverty, where we are a better place to ensure that everyone has an equal opportunity to thrive and that no one will be left behind. Thank you so much for this opportunity. I've certainly enjoyed and taken much out of what the panelists have shared this morning. Thank you so much for the opportunity again.
Muchas gracias, doctora Etienne.
Thank you so much, Dr. Etienne. And yes, anticipating and planning, how important that is, as you said, for the next pandemic. We hope it never comes, but that also allows us to face this pandemic with equity and public policies that are centered on health, to precisely be able to advance and face the emergency that the region is suffering. Very well. Among the country presentations, I have Mr. Jose Avendaño here, Vice Minister of Economic Planning from Venezuela. You have the floor, sir, for 3 minutes. Thank you. Thank you, everyone. We thank the opportunity to briefly comment some aspects in this working session. To start, health as a human right and not merely as a commercial activity, as a product. The pandemic allowed us to unveil that. And as a world, in our world, there were things that were not well. The care for the pandemic demanded health coverage that's sufficient, broad, and territorialized. The experience in our country proved its efficiency thanks to the public healthcare system and the comprehensive community areas and health services that we have more than 560 in the country. Through them, we gave free of cost access to 100% of the medications, hospitalization, and care to 100% of the persons with contagion that as of today have achieved a recovery rate of 95%. Another important aspect to mention is the support of the Cuban medical team that helped us to have the territorial division in the healthcare systems in the country. Among the measures that were adopted at an economic level, we had an agro-food financing plan to take food to the households, what we call the class, which are the supply centers for food. We have labor immobility in our country. No one can be laid off to protect all the workers, public and private. We forbade the persons who rent to be evicted. We gave special bonds for bonuses for the workers of the private sector, public and informal sector. We suspended increasing the credit for persons who are dead. For this reason, in the midst of all these actions developed, Venezuela was sanctioned and they blocked the funds of our country in accounts abroad, which are necessary to supply 100% of the vaccines to our population as required. For that reason, we emphasize the support of the United Nations system to access the unlocking of those funds and to be able to have access to 100% of the vaccines and to get post-COVID recovery in our country. In terms of vaccine, we mentioned what has already been commented today, the method of auction that the access of vaccines against COVID turned out to be. We have to highlight and insist on the need of constituting from within the United Nations system a fund for the access to said vaccine, as well as for the process of recovery, to get a fund to access the commercial flows of food and supplies in a region that will allow within the recovery period to leave no one behind, which is a great motto as a region. Thank you very much. Thank you very much for the intervention of the delegate of Venezuela. We will now give the floor to the delegate from Cuba, Suzette Rosales, Director of the Ministry of Economy and Planning. 3 minutes, you have the floor. I'm sorry, no microphone. Good afternoon, everyone. To face the pandemic, we need an economic system that will help us resume the agenda to sustainable development, and the health of the population and economy must go hand in hand with dialogue, cooperation, integration, and complementarity in all public policies. I'm sorry, I can barely hear her. There's echo. The 2030 agenda, we must deal with the universal access to health, the production of medications, access and quality of education, social protection, amongst others, as allowed reducing the severe impact and the prevalence and mortality of this disease with an agile and effective response centered on the 2030 agenda of leaving no one behind. The first priority is the health and life of the population. Even before the first cases were reported in Cuba, we implemented a strategy led by the Ministry of Public Health and the system of civil defense as the objective of containing the risk of introduction and propagation of the pandemic in the Cuban population. The plan of prevention control to approach COVID-19 design involved a multidimensional coordination of the 2030 agenda proposes to all the agencies of the state, the companies, non-governmental organizations, and the population who obtained more than 480 measures aiming to defend human life. At the same time, was a temporary national program directed by the President of the Republic and the Prime Minister dividing the country in territories with the defense councils to implement everything that was needed to face the pandemic. The Cuban government, apart from the plan of prevention and control of the new COVID, approved the economic and social strategy for the stimulus of the economy and the facing of the world crisis caused by the pandemic in 16 key areas, where the main efforts are concentrated and, of course, articulated with strategic sectors of our national economic and social development plan until 2030. We've had strengths in the Cuban government in the crisis and the reduction of its impact. We have a system based on planning led by the Ministry of Economy and Planning of the country, and it's so flexible that permits to allocate resources according to the national priorities in terms of health, protection of persons, economic recovery, and to implement the plans and protocols established according to the needs of the country, and in a very efficacious way make the necessary adjustments. Among the strengths, we have a universal healthcare system which is free of cost, inclusive, and quality to help support the lives of the citizens, and with a consolidated primary care system with universities and health infrastructure. The scientific and technological national capacity at the service of the people is another strength. For years, we've been allocating resources to develop and strengthen health, education, and innovation in the country, with important values such as solidarity, have also permitted Cuba to face the current situation in better conditions. The strengthening of the national statistics system, and particularly of its system of statistical information, the Ministry of Public Health, with the support of the budget of the state for the follow-up of the epidemiological system of the country and the timely decision-making. A strength is also the allocation of the necessary budget to fund the expenses in health and social care, not only to guarantee care to the sick, but also prevention and containment, care to the suspects, and protecting the workers with furlough, as well as in the production of medications, since the human being is the center of the budget in Cuba. The national pharmaceutical industry has also been a strength, with the presence of innovative products, on which we highlight the 5 candidates to vaccines against COVID and several medications to increase the immune response in the persons who are hospitalized. We have 5 vaccine candidates. This is the country in Latin America and the Caribbean with the greatest advancement in this topic, and we're in a capacity to immunize the population before we end 2021, and we can provide this service to other nations as well. The intersectorial and multisectorial response system and the participation of everyone has been essential to guarantee the success of the healthcare protocols established. We highlight the creation of the group of science to face COVID-19, the Health Observatory for COVID-19, and the Innovation Committee. Now, the capacities of the socialist system of Cuba, the country still has suffered economically in the worldwide crisis, and the economic blockade and commercial and financial blockage imposed by the United States has become stronger. And as has been mentioned by the Cuban delegation, Cuba has given clear evidence of solidarity and multilateralism for South-South cooperation through the organization of 56 brigades that in 2020 provided their services in 40 countries, caring more than 500,000 patients and saving dozens of thousands of lives. So the blockade will, in spite of the blockade, will continue to count with the cooperation of all the actors with good practices, and we hope for international solidarity, looking for urgent solutions that may prevent us to go backward in the SDGs and to continue to rapidly advance in the implementation of the 2030 agenda. Thank you very much.
Muchas gracias a la directora del Ministerio de Economía y Planificación.
Thank you to the Minister of Planning from Cuba. Now, I would like to give the floor to Ambassador Shannon Brennan Harlock, Minister of Foreign Affairs from the Bahamas. You have the floor. 3 minutes. Thank you.
Good afternoon. Can you hear me? I'm getting some feedback. Okay, great. Thank you. Thank you very much. We congratulate ECLAC for organizing this timely and relevant discussion on the topic Health and the Economy of False Dichotomy. And we thank the panelists for their presentations. COVID-19 has touched every corner of the globe, every society, and every sector. Even though we might have had an individual initiation and varied experiences to COVID-19, our experiences are a shared one. There have been too many deferred dreams, too many have crossed over into poverty, and too many lives have been silenced prematurely. COVID-19 focused the spotlights on weaknesses of healthcare systems throughout the region. Throughout the region, we saw an inadequate bed capacity, inequities of the global supply chains, unequal access to healthcare, and non-existing or primitive technologies for epidemiological surveillance, coupled with escalating rates of health worker burnout, compounded by a moral injury phenomenon. These and other factors challenged the health response to COVID-19. As these weaknesses played out on television screens, social media platforms, and across radio waves, governments faced increasing pressure to balance their COVID-19 mitigation measures with ensuring that families could put food on their tables and keep the lights on in their homes, and at the same time have the government meet fiscal obligations. It became evident very early on that unless and until holes in the healthcare system and the public health sphere were plugged, economies could not and would not rebound. Tourism is the engine that drives the economy of many Caribbean states. It accounts for 45% of the Bahamas' GDP and employs almost 50% of the labor force. But notwithstanding the important role of tourism, it is public health that is the oil that keeps the engine purring. One is no good without the other. And as the pandemic surged with populations, it prevented people from working either because they were ill or there was reduced productivity because of a prolonged disease course, or workers had to stay home and take care of ill or vulnerable family members. People were and remain uncertain of the future. They're spending their funds judiciously, and as we're still not certain how quickly the economy will rebound. Lockdowns and curfews have provided fewer opportunities for people to spend the discretionary funds. For most countries, implementing lockdowns during COVID meant a complete shutdown of all economic activity except those deemed most essential, such as the health services and the maintenance of law and order. At the points which coincided with the flattening of the curve in our first and second waves of COVID-19 respectively, we demonstrated the success of our public health mitigation strategies and the bolstering of our healthcare system. Shortly thereafter, policy shifted, borders were reopened and tourists came. They came not because of our sun, sand, and sea, but because of a confidence that the threat of being infected with COVID-19 was low. And this is not a dichotomy, this is a synergy. I'm being brief and will send my complete comments in for the record, but I'll end by saying history is categorical. When a nation's people are well and thriving, when public health threats are at bay, the economy is well and thriving. There's no trade-off between economics and public health. There is no trade-off between saving lives and livelihoods. Thank you.
Thank you very much, Mr. Ambassador of the Bahamas. No tenemos.
We have not received any other requests for the floor from the delegations. As a result, we shall continue with inviting the panelists to remark upon the afternoon's discussion or the morning's discussion, depending on where. And of course, we are inviting you to make a few final remarks. You will each have 2 to 3 minutes to do so. So let me give the floor to Joy St. John to begin this round of comments.
Thank you very much. It is good to hear the region speak about this issue because the Americas have been hard hit by COVID-19. So it's good to hear how people have dealt with this. I think one of the important takeaway messages is this whole issue of the equality that we need to make sure is present in our societies. I think of the people who serve us, people who we have come to realize are in the at-risk group. A lot of them are not in formal structures. A lot of them are not represented by unions or don't have systems that the rest of the society have come to enjoy. Going forward in this world, are we going to leave them up to their own devices? Or are we going to make sure that we recognize that they are important parts of our society and we must provide for them or put systems in place that allow them to be captured in our usual social systems? The other thing that I think is really important about what I've been hearing is that it is time that the region of the Americas gets more capacity in certain areas. We all saw the struggle that we had with getting PPE equipment and so on. And now there's a little bit of a struggle with the vaccines. It's not as bad as for H1N1, but it's there. There needs to be more capacity within the region of the Americas with key critical items or the capacity to produce vaccines. That needs to be strengthened. And I think this is one of the things we have to work for during this period because we never know when the next pandemic will hit. And then the third take-home message that I have, and it's a message that I also had in my presentation, is that human life is critical during this pandemic. And there should never be a question about if we have economic activity or if we save lives. There should never be that question. And the fact that there is that question shows that there were things in what was normal before COVID that need to be corrected. Let us see if we can find that path to ensuring that there will never be a question about if someone has to work in a situation which threatens their lives. So that's my contribution. Thank you.
Thank you very much. Siguiendo con las intervenciones.
Let us continue with the panelists. I would like to give the floor to Alejandro Werner for some final remarks. Thank you for that, Alberto. Just let me quickly refer to some conclusions that I have drawn after hearing the variety of key messages and remarks that obviously need to be taken into consideration for the future agenda. Perhaps I would like to refer to 3 topics and then 2 comments on 2 key regions. The first topic that was made very clear after this pandemic is that it is necessary to have a more robust state apparatus, a more powerful state, specifically in the social realm and with regard to public goods. It's important to reinforce the state level capacity in health and education that has been made very clear. And in many Latin American and Caribbean nations, the state in terms of its the way it's earmarked resources, but also with regard to how it's designing public policies, has a lot more to do if we are to strengthen these two realms of state participation in society and the economy. Secondly, with regard to the comments we've heard today, I think I would like to point out the importance of multilateralism and the role of Latin America in the international discussion. I think Latin America's voice has not been heard as loud as it should be heard in these multilateral discussions. And I think that is one of the key challenges the region faces, that is to make sure the Latin American and Caribbean vision is understood louder and clearer in the multilateral world. And then the discussion will obviously become more intense with regard to health. Now, we have been talking about multilateral issues for half or more than half of this meeting, and in order for the world to be better prepared for the next crises of this nature, clearly it will be necessary to have a significant multilateral investment, and Latin America and the Caribbean need to have a very clear, loud voice in this regard. As the same applies to the climate change discussion, the Latin American voice must be made more clear. Thirdly, I would like to refer to the need to have local consensus. As we've heard today, Latin America will be moving away from this situation when we have a better wealth distribution, less poverty, etc. And so it will be necessary to have a overarching national consensus in each country to address the fiscal situations, the public policy for health and education. This will call for a robust agenda involving legislative change that will result in social consensus. It seems today as though that may be very difficult to achieve, and the Caribbean is the most affected region by this pandemic, and so the Caribbean faces another key challenge. It's the most susceptible and vulnerable region to climate change as well. So, and then Central America, of course, is also facing key deficiencies, was already facing them prior to the pandemic, and these have been exacerbated during the pandemic and will call for significant recovery periods in the region. And so these are matters that must be met. Thank you. Thank you, Alejandro, for your remarks and your participation on this panel. And of course, what you have just referred to is important. We need more robust public institutional arrangements, a more robust state apparatus as well to face the pandemic in the region. So thank you for that. Now allow me to give the floor to Blanca Margarita Ovelar de Duarte for some final remarks. You're hereby recognized. Thank you. I have been closely listening to all the previous panelists' remarks, and they all seem to be reasonable and all provide a contribution that will allow us to have a more solid discourse and thought process moving forward. Now, the Spanish panelist referred to anticipating the next crises. That's essential. Now, we have governments with unequal institutions and standing on an equal ground. And so this short-term perspective is not the best one. When you are dealing with a long-term perspective, you often have to make decisions that are not so auspicious for election results. So this needs to change. Now, I actually believe that, well, when I think about what are we going to do after this crisis, I think we need to take advantage of this crisis to build a better future, build a better world. Now, to that end, obviously, it is necessary to make some changes. Now, first of all, as a representative of the parliament and the president of the Parl Americas or organization, I am fully convinced, I think this has been made clear, that trust has been eroded, and it's essential to build up this trust again. Now, Politicians may hamper countries' recovery, unfortunately, and public policies really need to be what we want is we want to have public policies that are aimed at a quick recovery. That's what we want. And it's clear that the economies are more solid on the macroeconomic level. We need that. We need to have institutions that work better. And in those economies that are like that, the recovery will be easier. But that concept of anticipatory governance is ringing in my ear. And in terms of the challenges lying ahead with regard to reconstruction and recovery, revenue, income recovery, the country's ability to have the capacity to take on new pandemics and new crises, well, obviously, this is essential. Global recovery will be vital, and the international institutions should facilitate the arrangement and coordination of measures and data exchange for more robust value chains and supply chains. For example, we were referring to the COVAX mechanism and how it's not working, and how we need for someone to be more expressly showing their solidarity here. And then this race for vaccination, allow everyone to be involved and there be a level playing ground. Now that mechanism failed in my country. We were promised to receive vaccination the second half of February. We have not received, and by the end of that second half, we hadn't received a single dose. And so this obviously results in public policy, public controversy. So we know that we know that pathologies will not go away, and we are clearly extremely vulnerable to the power of nature. Now, some have warned us in the past of the possible arrival of pandemic, and we know that we have been warned about climate change for a while now. We cannot go backwards, but we can ensure that we have a world that is more environmentally friendly. Now, someone mentioned that the Latin American voice needs to be heard more louder and more clear with regard to climate change. I like that. Yes, we do. Our countries are hammered, if you will, by the impact of climate change, hurricanes, and etc. It's always the weakest link, not the weakest link, but it's always the weaker group that is hit the hardest. So we need to have a greener, more friendly, environmentally friendly, and a fairer world. That is what needs to be the legacy of this crisis. Thank you. Thank you, Senator Olvelar de Duarte, for sharing your thoughts with this panel. Now I would like to give the floor to Mónica Cassis. Thank you. I'm going to read the recommendations from the group that we represent in civil society with regard to the ECLAC mechanism. We believe that we need to review the commitment to official commitment to well-being, where the wealthier countries have committed to provide 0.6% of their GDP to the developing nations that are part of the OECD. Now, we also believe it's important to have flexible, soft, and accessible credits and loans for the countries in the region so that they can close the income gap, reduce the poverty rates, and rebuild the public health systems. There are a variety of measures proposed. For example, investment be earmarked for having a production system that is based on a solidary society, and for fostering dignified and decent work. To this end, it is necessary to take into consideration lifelong learning and include all of the indigenous communities, Afro-descendants, older individuals, immigrants, and those who have chronic diseases that are difficult to deal with, such as HIV/AIDS. We also believe that it's essential to maintain the COVAX initiative under the premise that the developing nations gain access to vaccines under privileged prices, special prices. This will foster equal distribution. This has already been mentioned by other stakeholders here today. That is effective equal distribution under the mechanism. That's why monitoring is important. We should also have distribution systems that are designed at the large scale and that are equitable with regard to vaccine distribution. To that end, we believe it is the proposal by ECLAC is quite pertinent, that is to having a regional COVAX mechanism. We also believe that we need to focus on having measures soon to do away with the connectivity gap. We need to ensure that most of the population has access to internet, because this is considered to be a public good more so than ever. As far as telework is concerned, this is necessary to facilitate access to employment, and so there's decent, dignified work, and to also foster the education and training of individuals in the digital tools for the entire population across the board, with more of an emphasis on youth. And also, we believe it is also critical to strengthen the non-governmental organizations at a local level within our countries, as we mentioned. These are key actors, key stakeholders that meet the needs of local communities, needs that aren't able to be met by the state apparatus today. Strengthening NGOs, that is to organized civil society, is a key step forward, and this calls for public and private investments. Often we see that these groups meet the local communities' needs, are the first to respond in these types of emergencies. There needs to be special emphasis on strengthening women's and feminist organizations in the region, given how this epidemic of violence against women and girls has had a significant impact on their well-being and health. We insist on how important it is to ensure that there's effective and valid participation of organized civil society in all of these initiatives for the benefit of the health and the well-being of all citizens across the board in Latin America and the Caribbean. To this end, since we have already mentioned the action plan that ECLAC is working on for the pandemic, we think it's essential to point out how organized civil society take part in that in Latin America and the Caribbean. Moreover, we request that we be included in all of the discussions and that our demands be heard and taken into consideration in the decision-making process, so that we can have this new normality in the region, so that no one will remain behind or left out, specifically with regard to well-being. I would also like to add that when listening to the comments of Alejandro Werner and other individuals, when we refer to having a more robust state in terms of health and well-being, that is key, and the importance of multilateralism. We agree with that. However, what we cannot allow is that you cannot have a strong state without the inclusion of civil society. That's key. We would like to be involved in a local consensus. It's important to have active participation of organized civil society, so that precisely no one is left out or left behind. Thank you.
Muchas gracias.
Thank you very much for your participation, Mrs. Yassis. I will now ask Mr. Roman Macaya to please take the floor for his final thoughts. Mr. Macaya. Thank you very much, Mr. Arenas. Once again, my gratitude to ECLAC for organizing this event and focusing all of us, not only in the current pandemic, but on the lessons learned to be better prepared for similar emergencies. Maybe ending up with a positive and optimistic note, I would say that if this pandemic has taught us something, it is that science has advanced significantly, and the capacity to develop biomedical technology, vaccines, diagnostic kits, everything dealing with identifying and diagnosing the virus and to rapidly learning how to treat the patients in little over a year is something truly historical. This is the first pandemic where the world will count with a vaccine to be protected against the pathogen which is causing the pandemic, a new unknown pathogen unknown to science before. And that is something so significant. And it will be available for mankind for the next pandemic. And as I said in my initial words, the next one might not be so far away. If we have had 3 coronaviruses plus H1N1, 4 viruses with pandemic potential in only 20 years, well, the next decade, we might have another big scare like the one we've had now as a planet. I mean, and it could have new and more worrisome characteristics in terms of infectivity, that is how contagious the virus is, as well as how lethal it is when there is contagion. So I believe that if there is something that we need to do, is the task to be ready for the next one. Understanding that the next one can be the next decade, what we have learned very painfully, that we need to be better prepared for the next one in terms of how to permit economy to continue, that the school and education to continue. There is an agenda that goes beyond the health agenda. It is a digital agenda, an agenda on connectivity, of redundancies, of a business continuity plans. Because if we go back 18 months back prior to the pandemic, many institutions or companies had business plans or business continuity plans, but no one had contemplated this on the radar. The pandemic took us all by surprise. Well, that should not happen ever again. And we know the pain that the limitations in the production of supplies, of technology, of vaccines can cause. Everything that if we have a world synchronized in pandemic with everybody trying to buy the same thing at the same time and from the same supplier. So we need to focus on that local or regional capability that will guarantee us that we will get a timelier supply of the key inputs, because I have no doubt that science will generate those supplies, that input, that technology. But what we need now is the regional or national capacities to have access to them. And that's where I think that I believe that this type of forum can illuminate the world, enlighten the world in terms of the needs to have better distribution schemes as needed for these technologies. Once again, I want to thank ECLAC. I have to go to another meeting now, so I'd like to take this opportunity to say goodbye to the rest of the panelists and organizers. Thank you very much. Thank you so much, Mr. Roman Macaya, for having participated in this panel, and we wish you the best in the Costa Rican Social Security Institute and the development of public policies in the field of social protection to face the pandemic in Costa Rica. I will finally give the floor to Mr. Daniel Inerariti for his final thoughts. Please, you're recognized, sir. By now, many things have already been said, with which I basically agree. So my participation will be very brief, just to underscore something that I think is fundamental. We are in a moment in the evolution of the pandemic that focuses us on the issue of vaccines. And I believe that we should also remember that the obtention of biological immunity is one thing, and a different thing is the crisis that will require a different type of immunity. Something different is the transformations that we need to undertake that should last longer in time. So it's three different tasks that should not overlap, although in time they will. That we should not think that because we faced one, we will face all the rest. Biological immunity, social immunity, and transformations of our society. Once we attain biological immunity, we hopefully will attain it as shortly as possible and with equity. Once having attained that immunity, as we hope we will, through the vaccines distributed by healthcare systems, it is necessary to worry about the social immunity that is working in the response that the rest of the systems, apart from the healthcare system, I mean the educational, political, economic system, they need to make sure that such serious crises do not happen. And if they do happen, that they find us better prepared and with a better capacity to solve the damage that will be produced in our society. It isn't only a biological crisis. It has a regulatory, social, political, and democratic dimension. And if I may, another idea linked to this, from my perspective, academic perspective, sciences that have been protagonic right now are immunology, virology. But let us not forget that crises of this type that put at risk so many factors require that all the sciences should cooperate. Law is necessary, philosophy is necessary, social sciences are necessary, psychology is necessary, pedagogy is necessary. Once this inevitable protagonism of one type of science has passed, we should also undertake a perspective about reality that is more global. We have to have in-depth thinking of many concepts, not just the fact that our political systems have proven to be insufficient to deal with this, and our healthcare systems have been weak, but also the context in understanding and correctly diagnosing the situation have proven to be insufficient with outdated concepts that are not at the level of the complexity of our current world. The idea that up to what point our fate is interdependent. We have a different interest in the world, but up to what point our fates depend not only within a country and with the different social levels, but also throughout the world. We depend on each other. And may I underscore this, from my perspective of philosopher, we don't still have sufficient concepts about that interrelationship, and the worst enemy that we may have at the moment of cooperation is to think that we already know what we needed to know, and I can assure you that is not the case. And I end up wishing all the countries represented here the greatest success, the best way out of this crisis possible. It is hitting us all in a very intense way. Good luck and make good decisions. Thank you very much, Mr. Inerariti, for your final thoughts. And for some final closing words of this panel, it is my honor to give the floor to Mrs. Alicia Bárcena, Executive Secretary of the Economic Commission for Latin America and the Caribbean, ECLAC. You have the floor. Thank you so much, and I have truly enjoyed this because we have truly enjoyed this panel that has been so interesting, I would say, and I wanted to share with you three thoughts. The first is that I believe that we have learned from this pandemic very important things. First of all, that there is serious global asymmetries which have been amplified throughout the pandemic or have been exposed. We saw them coming, financial asymmetry as well as climatic asymmetry, and now health and access to vaccine is a tremendous asymmetry. And that those asymmetries, I believe, what they might be generating, we don't really know what will happen. Are we going to create islands of immunity in the world? Is that where we're heading, or at least this year? Or will there be access to vaccines that is more open? Will we have a more equitable access? And I'm saying this because these serious asymmetries in financial and climatic sense are sometimes more silent, but in the pandemic, this tremendous asymmetry has been very evident. So I would like to thank, of course, Alejandro Werner. Thank you so much for participating and for being here. And Carissa Etienne, these are two multilateral institutions that I believe are facing interesting problems because there is a decision from these institutions to support multilateralism, to exercise it as international agencies. But we find a world that is highly fragmented insofar as the developed and the developing countries, that with positions that have not been able to come close on several issues, no doubt on the issue of the vaccines. As Marta Algao rightly said, there are countries that have 3 times more than what they need, while others have nothing in the issue of vaccines. But that also happens in financial terms, and I know that the IMF is doing great efforts, and I would like to recognize Alejandro, you and Kristalina Georgieva, who have made a major change in the perspective of the IMF in this pandemic. I would say by strengthening proposals such as the importance of a strong state with a strong fiscal policy in this year 2021 with urgency to support the social emergency, the most vulnerable people. And I would also say that there is room for this to be done. Yes, in the future, we will have to look at fiscal sustainability, and we will. But I believe that IMF is truly proposing very important aspects, and that the IMF should say it is so relevant for countries such as ours, where they say that public or assets are central, that we need to support social aspects. I believe that is fundamental. And I also know that in financial terms, IMF is doing major efforts to get the emission of the special drawing rights. And I believe that that will be very important to support our countries, all of them, middle income and smaller countries, everyone in general. But in view of a multilateral world which is struggling in G20, G7, G everything, what can a region such as ours do and a hemisphere like ours do? And here's my second proposal, or reflection rather. I believe the time has come for a region to think in more collective terms, because we're facing the dilemma of the prisoner. As the representative of Paraguay said, they have not received anything. There's many things we don't know. There's a bilateral component in negotiation of the vaccines and the prices, who gets where, the COVAX works or doesn't work. And if in COVAX all the vaccines go in, or only those approved by WHO, which is what is happening today. And I believe that there are very important efforts in the region that we should support, and I highlight 2. One is CELAC. I believe that the government of Mexico has made a major effort to change the conversation of the vaccines and to talk to the world from CELAC and from Mexico to the Security Council to propose a concrete UN resolution that there be equitable access, not only of vaccines, of medication, of supplies, etc. So I believe that is one step that a region must support on a regional basis, a very important position that needs to get regional support. And these initiatives, AstraZeneca, Argentina, Mexico, I believe that they must give way to a better regional integration where we may be capable of generating an industry, for example, a manufacturing industry, in health, pharmaceutical industry, whatever. And to that end, we will need more equitable multilateralism, because in the World Trade Organization, they speak of the liberation of patents, or at least that there be production agreements in those countries who have the capacity to do so. In our region, we do have several. We have quite a few. And so there we should also focus joint effort. And the second, LAC is one. And the second is the PAHO, Pan American Health Organization. PAHO is the one entrusted in our hemisphere of implementing COVAX. But we need to support PAHO, because otherwise what will happen? We are competing with Africa. All right, no one is against the fact that Africa should receive lots of vaccines, or Asia Pacific, but our region also needs it. And we must have a dialogue with the countries of the hemisphere. By now, I mean the whole hemisphere, not just Latin America and the Caribbean, the whole hemisphere. Countries of the hemisphere who will have surplus vaccine soon. And so we need to generate a mechanism, a hemispheric mechanism with the support and supporting PAHO, so that these vaccines in a certain way may be redistributed at a hemispheric level. And you said it, Alejandro, you said Caribbean and Central America have large needs, but I don't want to leave outside Paraguay, Bolivia, countries who also need support. And I would like to highlight that in a region we have seen these signs of very strong solidarity. LAC is an example. Cuba is another great example of regional solidarity. They are willing to share whatever they have. And yesterday they told us so. And so my third reflection, and I'm sorry, Mr. Moderator, I'm taking a long time, but the third is that yesterday Bertola said a sentence I would like to repeat. There is no going back to. There's no place we can turn back to. We'd rather change the present and the future, because there's no way back, nowhere to return to. The world changed. We are different. Our families, our communities, everything was transformed. What does this pandemic show us? At a national level, it shows us that those countries who have social protection systems that are more solid, primary healthcare systems that are more solid, such as Costa Rica, as was shown by your dear colleague from the Costa Rican Institute. I lived in Costa Rica. I know what he's talking about. I know how important it has been for the Costa Rican society to defend their Social Security Institute. I know it. I lived it. And I also know that countries such as Costa Rica, Uruguay, Chile itself, that has primary healthcare systems that are strong, solid since the 60s, the 70s, the 80s, those countries are the ones that are showing greater resilience in front of this pandemic, and those who have somehow favored social protection. And so I believe that what we need to do in this perspective of the future is that our society needs to go towards resiliency. Inerarity already said it. You were talking about social immunity. I talk about resilience, of a society that is capable of absorbing the changes and renew itself and create itself again and move forward. And I believe the only way out is to generate a society of care, a society that favors social protection, health, public assets such as water, that they be universally accessed, and of course the care of the planet, because any day then we will have another virus jumping in with a zoonotic origin. And so I believe that first we need to search for that solidarity, that multilateralism with the assistance of institutions such as IMF. The presence of Alejandro is so important in this forum, and the presence of PAHO at a hemispheric level, the presence of Mexico presiding CELAC, the presence of the Caribbean and the CARICOM institutions and SICA, and all our regional and sub-regional institutions. And third, at a national level, we need to create new political, social compacts, coalitions that will move towards a society of care, that will protect, that will care for, and will also assist to ensure that women do not carry the burden of care on their shoulders as it happens today in our societies. That's all I wanted to share, my dear moderator. There is no dilemma, health and economy. Without health, there is no economy, period. So we need to advance And we need to learn how to live with the virus. We've learned that. We've learned how to use a mask. We've learned to use social distancing. We're all surrounded by plastic, etc., because we have learned, and we will have to continue learning possibly this year and the next. And of course, anticipation and support. I believe that the meeting of ministers of health that will be organized by PAHO, and hopefully we can all participate there and support the ministries of health. We cannot leave them alone in view of the severe crisis that we're experiencing. Thank you very much, dear Albert. Thank you to all the panelists for their very interesting participation.
Muchas gracias, señora Alicia Bárcena.
Thank you for that, Alicia Bárcena. Thank you, because that was a very comprehensive summary. And thank you to all of the panelists, this panel and the countries who provided their valuable remarks and comments for this discussion. So COVID-19 placed structural aspects of health and economy at the heart of this discussion. Sustainable development will not be possible if we do not control the infection rate and we do not have universal access to vaccination. As mentioned so clearly today by Alicia Bárcena, without health, we have no economy. And that is why it is necessary. We talk about the need to coordinate public policies aimed at controlling the pandemic and link these to economic and monetary policies. Now, we need to have a new development strategy so that we can bring about transformative change in the region. This has all been essential. Guaranteeing the right to health and universal access to health is key. We need to strengthen the health sector to do so. And we also need to make progress with regard to comprehensive, universal, and sustainable social protection mechanisms. So after 3 extremely intense hours, we have come to an end. We will draw a close to the panel number 1, health and the economy, a false dichotomy. And once again, I would like to thank all of the various panelists for their participation in the countries. I would like to yield the floor to the Costa Rican ambassador in Chile. Thank you very much. Thank you. First of all, I would like to thank Alberto Arenas for having moderated this very important discussion. And I would also like to thank Alicia and the other colleagues and authorities from LAC who have also joined us. And thank you genuinely for their remarks and thoughts. And I would also like to thank the various panelists and countries that have joined us. Now, obviously, there is no doubt that health and social and economic well-being, as well as climate change and biodiversity, are fully interrelated. And these factors must be addressed during this new reconstruction or reinvention processes, if you will. We are reinventing the whole system, as mentioned by the parliamentarian from Paraguay. And let us make sure that the future is better than, and we do something better than what we have done in the past. We will dig our heels in to build capacity for the future. As the president of Costa Rica has mentioned, it's essential to lead forward with science. And so science will be at the service of the most needy and most vulnerable, and so that we can collectively gain access to the technology we require to combat the impact of the pandemic. And this has been mentioned, and we've referred to the sit-up with regard to the international community. So I would like to just conclude with an idea that was posed by Carissa Etienne. The future is now. And with this sense of urgency that we will convene the first morning session for some, afternoon session for others. We will have a break until 2 p.m. Costa Rica time. Prior to closing the session, I would like to invite you to join us at a new event organized by the presidency and LAC on women and nature. And we will hear about some financial solutions, green financial solutions, and the participation of women in these solutions. These are solutions that are being fostered and encouraged for this new reconstruction period. And at this event, we will be joined by our executive secretary and the vice president of Costa Rica, Ms. Campbell. And so we will reconvene here at 2 p.m. Costa Rica time, and we would like to invite you to join us at 1 p.m. Costa Rica time in the event on women. Thank you so much to all of you.
de una resolución o decreto. Otro aspecto importante es que más del 50% de las secretarías técnicas de estos mecanismos son las autoridades de planificación. Tienen el gran desafío de coordinar a los sectores, de convocar a los actores, de definir las estrategias y alianzas para el logro de los ODS y prepararse para los procesos de rendición de cuentas. Ello posiciona a la planificación como un medio de implementación de la Agenda 2030 y plantea grandes desafíos tanto para los funcionarios como para las prácticas de la administración pública. La Agenda 2030 nos desafía a planificar con una visión integrada y de largo plazo. El nuevo escenario global en tiempos de la pandemia provocada por el COVID-19 hace imperativo tomar medidas urgentes y evaluar los impactos de estas acciones. Para apoyar el seguimiento y monitoreo de avances a mediano y largo plazo, la CEPAL ha puesto en marcha el Observatorio COVID-19, un esfuerzo coordinado por la Comisión Regional con el apoyo de los coordinadores residentes de las Naciones Unidas, que presenta información actualizada sobre los anuncios de política de cada país y otros materiales de interés. El observatorio recopila y pone a disposición tanto las políticas públicas que los 33 países de la región latinoamericana y caribeña están tomando para limitar el impacto de la pandemia, como el análisis de los efectos económicos y sociales que éstas tendrán a nivel nacional y sectorial. En un mapa interactivo, los interesados podrán visualizar de manera clara las acciones realizadas por cada país. Estas están divididas en 5 grupos: medidas de contención, de salud, empleo, economía y educación. Visita el Observatorio COVID-19 de la CEPAL y accede a información actualizada de las medidas de política para enfrentar la crisis en la región. El Observatorio del Principio 10 en América Latina y el Caribe es una iniciativa de la Comisión Económica para América Latina y el Caribe, CEPAL, por contribuir a un mejor conocimiento, difusión e implementación de los derechos de acceso a la información, la participación pública y el acceso a la justicia en asuntos ambientales consagrados en el Principio 10 de la Declaración de Río sobre Medio Ambiente y Desarrollo. El observatorio ofrece referencias destacadas de los derechos de acceso en leyes, políticas, jurisprudencia y tratados relativos a los 33 países de América Latina y el Caribe. Además, proporciona acceso a publicaciones, datos, mapas y recursos relacionados y cuenta con temáticas como biodiversidad, cambio climático, género, educación ambiental, minería, pueblos indígenas o defensores ambientales. Como centro de intercambio de información, el observatorio busca hacer un aporte a la implementación del Acuerdo Regional sobre el acceso a la información, la participación pública y el acceso a la justicia en asuntos ambientales en América Latina y el Caribe, Acuerdo de Escazú. El Observatorio de Igualdad de Género de América Latina y el Caribe tiene como propósito contribuir al fortalecimiento de los mecanismos nacionales para el adelanto de las mujeres, poner a disposición pública información oficial de los gobiernos de la región y facilitar el seguimiento de los acuerdos internacionales de derechos de las mujeres. A través de este observatorio se da seguimiento a la situación de las mujeres en la región, en particular los avances relacionados con su autonomía física, económica y en la toma de decisiones y sus interrelaciones. ¿Qué información se puede encontrar en esta herramienta? Indicadores, informes y estudios, repositorio de leyes, análisis de políticas para la igualdad de género y recursos de difusión. El Observatorio de Desarrollo Social en América Latina y el Caribe es una herramienta regional de conocimiento de la CEPAL. Su creación responde a un mandato de la segunda reunión de la Conferencia Regional sobre Desarrollo Social de América Latina y el Caribe, cuando los Estados miembros le solicitaron a la CEPAL la conformación de un observatorio de desarrollo social que acompañe el diseño y la implementación de las políticas públicas y permita monitorear sus tendencias. De esta forma, el observatorio promueve el desarrollo integral de América Latina y el Caribe, con enfoque de derechos y de igualdad, a través del análisis de la situación social de la región, de las políticas públicas y de la asistencia técnica a los países que lo soliciten. El observatorio también integra un conjunto de plataformas digitales. Se destacan las bases de datos sobre inversión social, programas de protección social no contributiva, institucionalidad social en América Latina y el Caribe, juventud e inclusión social y de compromisos regionales y subregionales en materia de desarrollo social. A través de su división de desarrollo social, la CEPAL publica, actualiza y amplía estas bases que están a disposición de los gobiernos y del público en general. ¿Sabías que, con información que entregan los países, la CEPAL creó un observatorio para conocer, analizar y difundir cómo planifican en la región de América Latina y el Caribe para lograr su desarrollo? Concentra en un solo sitio información sobre los sistemas nacionales de planificación de la región. Los sistemas incluyen los planes nacionales, subnacionales, como también marcos legales, actores gubernamentales y de la sociedad civil, mecanismos de coordinación e implementación y su vinculación con la Agenda 2030 y los Objetivos de Desarrollo Sostenible. Es una plataforma abierta para quienes estén interesados en el ejercicio técnico, político y administrativo de la planificación para el desarrollo, en especial los gobiernos, parlamentarios, académicos, sector privado y la sociedad civil. Observatorio Regional de Planificación para el Desarrollo, de la mirada al análisis y conocimiento sobre la planificación del desarrollo en América Latina y el Caribe. Te invitamos a explorar el observatorio, descubrir y ser parte de la generación de conocimiento para planificar el desarrollo en observatorioplanificación.cepal.org. Como consecuencia de la mayor pandemia que ha vivido el mundo en los últimos 100 años, los gobiernos, los organismos internacionales, la academia, el sector privado y las organizaciones de la sociedad civil han estado abocados a la búsqueda de soluciones y alternativas para detener la propagación del COVID-19 y afrontar sus consecuencias económicas y sociales. Entre las medidas implementadas para frenar y controlar la propagación del virus, buena parte de los gobiernos de la región han optado por el confinamiento de las personas, decretando cuarentenas con fórmulas diversas. Esta situación ha generado no solo una contracción considerable de la actividad económica con impactos diferenciados en la población, sino también una agudización de las condiciones de vulnerabilidad que afecta y menoscaba los derechos de algunos grupos de población específicos. En este contexto, la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe organizará una serie de diálogos virtuales en el marco del Consenso de Montevideo con el fin de analizar el escenario sociodemográfico de los países de la región en el marco de la crisis del COVID-19 y reflexionar sobre sus posibles impactos en el corto, mediano y largo plazo en grupos de población en situación de mayor vulnerabilidad a la luz de las medidas prioritarias de dicho consenso y de los objetivos y metas de la Agenda 2030 para el desarrollo sostenible. El Observatorio COVID-19 en América Latina y el Caribe es una plataforma impulsada por la CEPAL a solicitud de la Comunidad de Estados Latinoamericanos y Caribeños LAC. El observatorio rastrea las políticas públicas que los países de América Latina y el Caribe están implementando para limitar el impacto de la pandemia del COVID-19 en la región. A través de informes y documentos, ofrece análisis de los impactos económicos y sociales que estas políticas tendrán a nivel nacional y sectorial, además de apoyar su revisión y seguimiento a mediano y largo plazo. En un mapa interactivo, los interesados pueden visualizar de manera clara las acciones realizadas por cada país en materia de restricciones a desplazamientos, salud, economía, empleo, protección social, educación y género. Visita el Observatorio COVID-19 de la CEPAL y accede a información actualizada de las medidas de política para enfrentar la crisis en la región. El Anuario Estadístico de América Latina y el Caribe es uno de los 6 informes anuales de la CEPAL. En él se presenta un conjunto de estadísticas básicas que caracterizan la situación económica, sociodemográfica y ambiental de la región referidas a un periodo en particular. El anuario estadístico constituye una referencia para quienes deseen contar con datos estadísticos descriptivos comparables entre países y en el tiempo. También contribuye a promover la generación y uso de información estadística internacionalmente comparable, oportuna y pertinente para la formulación, seguimiento y evaluación de políticas de desarrollo económico, social y ambiental en la región. Porque lo que no se mide no cuenta, la CEPAL insta a romper los silencios estadísticos y buscar más y mejores datos para avanzar hacia un desarrollo sostenible con igualdad.
In the very year that the United Nations launched the Decade for Action to ignite a more purposeful understanding of the part of the international community towards advancing the 2030 Agenda for Sustainable Development, the world has confronted unprecedented change in the specter of COVID-19. The multi-dimensional impact of this pandemic has served to dramatize the true scale of the vulnerability of the small, heavily indebted, undiversified economies of the Caribbean, and has forced creative exploration of every opportunity within the reach of our member states to secure urgent relief. The 2020 meetings of the Caribbean Development Roundtable and the Caribbean Development and Cooperation Committee will offer space for taking stock of the progress so far made in persuading the international community to extend this financial support needed, middle income status notwithstanding, and to dialogue on those strategies that will take you from vulnerability to resilient development, from economic peril to recovery and dynamic growth. It is an opportunity to consider how together we strengthen partnerships for action that is responsive to the unique vulnerabilities of the Caribbean and that assures tangible progress through the application of innovative problem solving in these precarious times.
Al año 2018, 21 países han creado o designado un mecanismo coordinador para la implementación y seguimiento de la Agenda 2030 a través de una resolución o decreto. Otro aspecto importante es que más del 50% de las secretarías técnicas de estos mecanismos son las autoridades de planificación. Tienen el gran desafío de coordinar a los sectores, de convocar a los actores, de definir las estrategias y alianzas para el logro de los ODS y prepararse para los procesos de rendición de cuentas. Ello posiciona a la planificación como un medio de implementación de la Agenda 2030 y plantea grandes desafíos tanto para los funcionarios como para las prácticas de la administración pública. La Agenda 2030 nos desafía a planificar con una visión integrada y de largo plazo. El nuevo escenario global en tiempos de la pandemia provocada por el COVID-19 hace imperativo tomar medidas urgentes y evaluar los impactos de estas acciones. Para apoyar el seguimiento y monitoreo de avances a mediano y largo plazo, la CEPAL ha puesto en marcha el Observatorio COVID-19, un esfuerzo coordinado por la Comisión Regional con el apoyo de los coordinadores residentes de las Naciones Unidas, que presenta información actualizada sobre los anuncios de política de cada país y otros materiales de interés. El observatorio recopila y pone a disposición tanto las políticas públicas que los 33 países de la región latinoamericana y caribeña están tomando para limitar el impacto de la pandemia, como el análisis de los efectos económicos y sociales que éstas tendrán a nivel nacional y sectorial. En un mapa interactivo, los interesados podrán visualizar de manera clara las acciones realizadas por cada país. Estas están divididas en 5 grupos: medidas de contención, de salud, empleo, economía y educación. Visita el Observatorio COVID-19 de la CEPAL y accede a información actualizada de las medidas de política para enfrentar la crisis en la región. El Observatorio del Principio 10 en América Latina y el Caribe es una iniciativa de la Comisión Económica para América Latina y el Caribe, CEPAL, por contribuir a un mejor conocimiento, difusión e implementación de los derechos de acceso a la información, la participación pública y el acceso a la justicia en asuntos ambientales consagrados en el Principio 10 de la Declaración de Río sobre Medio Ambiente y Desarrollo. El observatorio ofrece referencias destacadas de los derechos de acceso en leyes, políticas, jurisprudencia y tratados relativos a los 33 países de América Latina y el Caribe. Además, proporciona acceso a publicaciones, datos, mapas y recursos relacionados y cuenta con temáticas como biodiversidad, cambio climático, género, educación ambiental, minería, pueblos indígenas o defensores ambientales. Como centro de intercambio de información, el observatorio busca hacer un aporte a la implementación del Acuerdo Regional sobre el acceso a la información, la participación pública y el acceso a la justicia en asuntos ambientales en América Latina y el Caribe, Acuerdo de Escazú. El Observatorio de Igualdad de Género de América Latina y el Caribe tiene como propósito contribuir al fortalecimiento de los mecanismos nacionales para el adelanto de las mujeres, poner a disposición pública información oficial de los gobiernos de la región y facilitar el seguimiento de los acuerdos internacionales de derechos de las mujeres. A través de este observatorio se da seguimiento a la situación de las mujeres en la región, en particular los avances relacionados con su autonomía física, económica y en la toma de decisiones y sus interrelaciones. ¿Qué información se puede encontrar en esta herramienta? Indicadores, informes y estudios, repositorio de leyes, análisis de políticas para la igualdad de género y recursos de difusión. El Observatorio de Desarrollo Social en América Latina y el Caribe es una herramienta regional de conocimiento de la CEPAL. Su creación responde a un mandato de la segunda reunión de la Conferencia Regional sobre Desarrollo Social de América Latina y el Caribe, cuando los Estados miembros le solicitaron a la CEPAL la conformación de un observatorio de desarrollo social que acompañe el diseño y la implementación de las políticas públicas y permita monitorear sus tendencias. De esta forma, el observatorio promueve el desarrollo integral de América Latina y el Caribe, con enfoque de derechos y de igualdad a través del análisis de la situación social de la región, de las políticas públicas y de la asistencia técnica a los países que lo soliciten. El observatorio también integra un conjunto de plataformas digitales. Se destacan las bases de datos sobre inversión social, programas de protección social no contributiva, institucionalidad social en América Latina y el Caribe, juventud e inclusión social y de compromisos regionales y subregionales en materia de desarrollo social. A través de su división de desarrollo social, la CEPAL publica, actualiza y amplía estas bases que están a disposición de los gobiernos y del público en general. ¿Sabías que, con información que entregan los países, la CEPAL creó un observatorio para conocer, analizar y difundir cómo planifican en la región de América Latina y el Caribe para lograr su desarrollo? Concentra en un solo sitio información sobre los sistemas nacionales de planificación de la región. Los sistemas incluyen los planes nacionales, subnacionales, como también marcos legales, actores gubernamentales y de la sociedad civil, mecanismos de coordinación e implementación y su vinculación con la Agenda 2030 y los Objetivos de Desarrollo Sostenible. Es una plataforma abierta para quienes estén interesados en el ejercicio técnico, político y administrativo de la planificación para el desarrollo, en especial los gobiernos, parlamentarios, académicos, sector privado y la sociedad civil. Observatorio Regional de Planificación para el Desarrollo, de la mirada al análisis y conocimiento sobre la planificación del desarrollo en América Latina y el Caribe. Te invitamos a explorar el observatorio, descubrir y ser parte de la generación de conocimiento para planificar el desarrollo en observatorioplanificación.cepal.org. Como consecuencia de la mayor pandemia que ha vivido el mundo en los últimos 100 años, los gobiernos, los organismos internacionales, la academia, el sector privado y las organizaciones de la sociedad civil han estado abocados a la búsqueda de soluciones y alternativas para detener la propagación del COVID-19 y afrontar sus consecuencias económicas y sociales. Entre las medidas implementadas para frenar y controlar la propagación del virus, buena parte de los gobiernos de la región han optado por el confinamiento de las personas, decretando cuarentenas con fórmulas diversas. Esta situación ha generado no solo una contracción considerable de la actividad económica, con impactos diferenciados en la población, sino también una agudización de las condiciones de vulnerabilidad que afecta y menoscaba los derechos de algunos grupos de población específicos. En este contexto, la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe organizará una serie de diálogos virtuales en el marco del Consenso de Montevideo con el fin de analizar el escenario sociodemográfico de los países de la región en el marco de la crisis del COVID-19 y reflexionar sobre sus posibles impactos en el corto, mediano y largo plazo en grupos de población en situación de mayor vulnerabilidad a la luz de las medidas prioritarias de dicho consenso y de los objetivos y metas de la Agenda 2030 para el Desarrollo Sostenible. El Observatorio COVID-19 en América Latina y el Caribe es una plataforma impulsada por la CEPAL a solicitud de la Comunidad de Estados Latinoamericanos y Caribeños CELAC. El observatorio rastrea las políticas públicas que los países de América Latina y el Caribe están implementando para limitar el impacto de la pandemia del COVID-19 en la región. A través de informes y documentos, ofrece análisis de los impactos económicos y sociales que estas políticas tendrán a nivel nacional y sectorial, además de apoyar su revisión y seguimiento a mediano y largo plazo. En un mapa interactivo, los interesados pueden visualizar de manera clara las acciones realizadas por cada país en materia de restricciones a desplazamientos, salud, economía, empleo, protección social, educación y género. Visita el Observatorio COVID-19 de la CEPAL y accede a información actualizada de las medidas de política para enfrentar la crisis en la región. El Anuario Estadístico de América Latina y el Caribe es uno de los 6 informes anuales de la CEPAL. En él se presenta un conjunto de estadísticas básicas que caracterizan la situación económica, sociodemográfica y ambiental de la región referidas a un periodo en particular. El anuario estadístico constituye una referencia para quienes deseen contar con datos estadísticos descriptivos comparables entre países y en el tiempo. También contribuye a promover la generación y uso de información estadística internacionalmente comparable, oportuna y pertinente para la formulación, seguimiento y evaluación de políticas de desarrollo económico, social y ambiental en la región. Porque lo que no se mide no cuenta, la CEPAL insta a romper los silencios estadísticos y buscar más y mejores datos para avanzar hacia un desarrollo sostenible con igualdad.
In the very year that the United Nations launched the Decade for Action to ignite a more purposeful understanding of the part of the international community towards advancing the 2030 Agenda for Sustainable Development, the world has confronted unprecedented change in the specter of COVID-19. The multidimensional impact of this pandemic has served to dramatize the true scale of the vulnerability of the small, heavily indebted, undiversified economies of the Caribbean, and has forced creative exploration of every opportunity within the reach of our member states to secure urgent relief. The 2020 meetings of the Caribbean Development Roundtable and the Caribbean Development and Cooperation Committee will offer space for taking stock of the progress so far made in persuading the international community to extend this financial support needed. middle income status notwithstanding, and to dialogue on those strategies that will take you from vulnerability to resilient development, from economic peril to recovery and dynamic growth. It is an opportunity to consider how together we strengthen partnerships for action that is responsive to the unique vulnerabilities of the Caribbean and that assures tangible progress through the application of innovative problem solving in these precarious times.
Al año 2018, 21 países han creado o designado un mecanismo coordinador para la implementación y seguimiento de la Agenda 2030 a través de una resolución o decreto. Otro aspecto importante es que más del 50% de las secretarías técnicas de estos mecanismos son las autoridades de planificación. Tienen el gran desafío de coordinar a los sectores, de convocar a los actores, de definir las estrategias y alianzas para el logro de los ODS y prepararse para los procesos de rendición de cuentas. Ello posiciona a la planificación como un medio de implementación de la Agenda 2030 y plantea grandes desafíos tanto para los funcionarios como para las prácticas de la administración pública. La Agenda 2030 nos desafía a planificar con una visión integrada y de largo plazo. El nuevo escenario global en tiempos de la pandemia provocada por el COVID-19 hace imperativo tomar medidas urgentes y evaluar los impactos de estas acciones. Para apoyar el seguimiento y monitoreo de avances a mediano y largo plazo, la CEPAL ha puesto en marcha el Observatorio COVID-19, un esfuerzo coordinado por la Comisión Regional con el apoyo de los coordinadores residentes de las Naciones Unidas, que presenta información actualizada sobre los anuncios de política de cada país y otros materiales de interés. El observatorio recopila y pone a disposición tanto las políticas públicas que los 33 países de la región latinoamericana y caribeña están tomando para limitar el impacto de la pandemia, como el análisis de los efectos económicos y sociales que éstas tendrán a nivel nacional y sectorial. En un mapa interactivo, los interesados podrán visualizar de manera clara las acciones realizadas por cada país. Estas están divididas en 5 grupos: medidas de contención, de salud, empleo, economía y educación. Visita el Observatorio COVID-19 de la CEPAL y accede a información actualizada de las medidas de política para enfrentar la crisis en la región. El Observatorio del Principio 10 en América Latina y el Caribe es una iniciativa de la Comisión Económica para América Latina y el Caribe, CEPAL, por contribuir a un mejor conocimiento, difusión e implementación de los derechos de acceso a la información, la participación pública y el acceso a la justicia en asuntos ambientales consagrados en el Principio 10 de la Declaración de Río sobre Medio Ambiente y Desarrollo. El observatorio ofrece referencias destacadas de los derechos de acceso en leyes, políticas, jurisprudencia y tratados relativos a los 33 países de América Latina y el Caribe. Además, proporciona acceso a publicaciones, datos, mapas y recursos relacionados y cuenta con temáticas como biodiversidad, cambio climático, género, educación ambiental, minería, pueblos indígenas o defensores ambientales. Como centro de intercambio de información, el observatorio busca hacer un aporte a la implementación del Acuerdo Regional sobre el acceso a la información, la participación pública y el acceso a la justicia en asuntos ambientales en América Latina y el Caribe, Acuerdo de Escazú. El Observatorio de Igualdad de Género de América Latina y el Caribe tiene como propósito contribuir al fortalecimiento de los mecanismos nacionales para el adelanto de las mujeres, poner a disposición pública información oficial de los gobiernos de la región y facilitar el seguimiento de los acuerdos internacionales de derechos de las mujeres. A través de este observatorio se da seguimiento a la situación de las mujeres en la región, en particular los avances relacionados con su autonomía física, económica y en la toma de decisiones y sus interrelaciones. ¿Qué información se puede encontrar en esta herramienta? Indicadores, informes y estudios, repositorio de leyes, análisis de políticas para la igualdad de género y recursos de difusión. El Observatorio de Desarrollo Social en América Latina y el Caribe es una herramienta regional de conocimiento de la CEPAL. Su creación responde a un mandato de la segunda reunión de la Conferencia Regional sobre Desarrollo Social de América Latina y el Caribe, cuando los Estados miembros le solicitaron a la CEPAL la conformación de un observatorio de desarrollo social que acompañe el diseño y la implementación de las políticas públicas y permita monitorear sus tendencias. De esta forma, el observatorio promueve el desarrollo integral de América Latina y el Caribe con enfoque de derechos y de igualdad a través del análisis de la situación social de la región, de las políticas públicas y de la asistencia técnica a los países que lo soliciten. El observatorio también integra un conjunto de plataformas digitales. Se destacan las bases de datos sobre inversión social, programas de protección social no contributiva, institucionalidad social en América Latina y el Caribe, juventud e inclusión social y de compromisos regionales y subregionales en materia de desarrollo social. A través de su división de desarrollo social, la CEPAL publica, actualiza y amplía estas bases que están a disposición de los gobiernos y del público en general. ¿Sabías que, con información que entregan los países, la CEPAL creó un observatorio para conocer, analizar y difundir cómo planifican en la región de América Latina y el Caribe para lograr su desarrollo? Concentra en un solo sitio información sobre los sistemas nacionales de planificación de la región. Los sistemas incluyen los planes nacionales, subnacionales, como también marcos legales, actores gubernamentales y de la sociedad civil, mecanismos de coordinación e implementación y su vinculación con la Agenda 2030 y los Objetivos de Desarrollo Sostenible. Es una plataforma abierta para quienes estén interesados en el ejercicio técnico, político y administrativo de la planificación para el desarrollo, en especial los gobiernos, parlamentarios, académicos, sector privado y la sociedad civil. Observatorio Regional de Planificación para el Desarrollo, de la mirada al análisis y conocimiento sobre la planificación del desarrollo en América Latina y el Caribe. Te invitamos a explorar el observatorio, descubrir y ser parte de la generación de conocimiento para planificar el desarrollo en observatorioplanificación.cepal.org. Como consecuencia de la mayor pandemia que ha vivido el mundo en los últimos 100 años, los gobiernos, los organismos internacionales, la academia, el sector privado y las organizaciones de la sociedad civil han estado abocados a la búsqueda de soluciones y alternativas para detener la propagación del COVID-19 y afrontar sus consecuencias económicas y sociales. Entre las medidas implementadas para frenar y controlar la propagación del virus, buena parte de los gobiernos de la región han optado por el confinamiento de las personas, decretando cuarentenas con fórmulas diversas. Esta situación ha generado no solo una contracción considerable de la actividad económica, con impactos diferenciados en la población, sino también una agudización de las condiciones de vulnerabilidad que afecta y menoscaba los derechos de algunos grupos de población específicos. En este contexto, la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe organizará una serie de diálogos virtuales en el marco del Consenso de Montevideo con el fin de analizar el escenario sociodemográfico de los países de la región en el marco de la crisis del COVID-19 y reflexionar sobre sus posibles impactos en el corto, mediano y largo plazo en grupos de población en situación de mayor vulnerabilidad a la luz de las medidas prioritarias de dicho consenso y de los objetivos y metas de la Agenda 2030 para el desarrollo sostenible. El Observatorio COVID-19 en América Latina y el Caribe es una plataforma impulsada por la CEPAL a solicitud de la Comunidad de Estados Latinoamericanos y Caribeños LAC, El observatorio rastrea las políticas públicas que los países de América Latina y el Caribe están implementando para limitar el impacto de la pandemia del COVID-19 en la región. A través de informes y documentos, ofrece análisis de los impactos económicos y sociales que estas políticas tendrán a nivel nacional y sectorial, además de apoyar su revisión y seguimiento a mediano y largo plazo. En un mapa interactivo, los interesados pueden visualizar de manera clara las acciones realizadas por cada país en materia de restricciones a desplazamientos, salud, economía, empleo, protección social, educación y género. Visita el Observatorio COVID-19 de la CEPAL y accede a información actualizada de las medidas de política para enfrentar la crisis en la región. El Anuario Estadístico de América Latina y el Caribe es uno de los 6 informes anuales de la CEPAL. En él se presenta un conjunto de estadísticas básicas que caracterizan la situación económica, sociodemográfica y ambiental de la región referidas a un periodo en particular. El anuario estadístico constituye una referencia para quienes deseen contar con datos estadísticos descriptivos comparables entre países y en el tiempo. También contribuye a promover la generación y uso de información estadística internacionalmente comparable, oportuna y pertinente para la formulación, seguimiento y evaluación de políticas de desarrollo económico, social y ambiental en la región. Porque lo que no se mide no cuenta, la CEPAL insta a romper los silencios estadísticos y buscar más y mejores datos para avanzar hacia un desarrollo sostenible con igualdad.
In the very year that the United Nations launched the Decade for Action to ignite a more purposeful understanding of the part of the international community towards advancing the 2030 Agenda for Sustainable Development, the world has confronted unprecedented change in the specter of COVID-19. The multidimensional impact of this pandemic has served to dramatize the true scale of the vulnerability of the small, heavily indebted, undiversified economies of the Caribbean, and has forced creative exploration of every opportunity within the reach of our member states to secure urgent relief. The 2020 meetings of the Caribbean Development Roundtable and the Caribbean Development and Cooperation Committee will offer space for taking stock of the progress so far made in persuading the international community to extend this financial support needed, middle income status notwithstanding, and to dialogue on those strategies that will take you from vulnerability to resilient development, from economic peril to recovery and dynamic growth. It is an opportunity to consider how together we strengthen partnerships for action that is responsive to the unique vulnerabilities of the Caribbean and that assures tangible progress through the application of innovative problem solving in these precarious times.
Al año 2018, 21 países han creado o designado un mecanismo coordinador para la implementación y seguimiento de la Agenda 2030 a través de una resolución o decreto. Otro aspecto importante es que más del 50% de las secretarías técnicas de estos mecanismos son las autoridades de planificación. Tienen el gran desafío de coordinar a los sectores, de convocar a los actores, de definir las estrategias y alianzas para el logro de los ODS y prepararse para los procesos de rendición de cuentas. Ello posiciona a la planificación como un medio de implementación de la Agenda 2030 y plantea grandes desafíos tanto para los funcionarios como para las prácticas de la administración pública. La Agenda 2030 nos desafía a planificar con una visión integrada y de largo plazo. El nuevo escenario global en tiempos de la pandemia provocada por el COVID-19 hace imperativo tomar medidas urgentes y evaluar los impactos de estas acciones. Para apoyar el seguimiento y monitoreo de avances a mediano y largo plazo, la CEPAL ha puesto en marcha el Observatorio COVID-19, un esfuerzo coordinado por la Comisión Regional con el apoyo de los coordinadores residentes de las Naciones Unidas, que presenta información actualizada sobre los anuncios de política de cada país y otros materiales de interés. El observatorio recopila y pone a disposición tanto las políticas públicas que los 33 países de la región latinoamericana y caribeña están tomando para limitar el impacto de la pandemia, como el análisis de los efectos económicos y sociales que éstas tendrán a nivel nacional y sectorial. En un mapa interactivo, los interesados podrán visualizar de manera clara las acciones realizadas por cada país. Estas están divididas en 5 grupos: medidas de contención, de salud, empleo, economía y educación. Visita el Observatorio COVID-19 de la CEPAL y accede a información actualizada de las medidas de política para enfrentar la crisis en la región. El Observatorio del Principio 10 en América Latina y el Caribe es una iniciativa de la Comisión Económica para América Latina y el Caribe, CEPAL, por contribuir a un mejor conocimiento, difusión e implementación de los derechos de acceso a la información, la participación pública y el acceso a la justicia en asuntos ambientales consagrados en el Principio 10 de la Declaración de Río sobre Medio Ambiente y Desarrollo. El observatorio ofrece referencias destacadas de los derechos de acceso en leyes, políticas, jurisprudencia y tratados relativos a los 33 países de América Latina y el Caribe. Además, proporciona acceso a publicaciones, datos, mapas y recursos relacionados y cuenta con temáticas como biodiversidad, cambio climático, género, educación ambiental, minería, pueblos indígenas o defensores ambientales. Como centro de intercambio de información, el observatorio busca hacer un aporte a la implementación del Acuerdo Regional sobre el acceso a la información, la participación pública y el acceso a la justicia en asuntos ambientales en América Latina y el Caribe, Acuerdo de Escazú. El Observatorio de Igualdad de Género de América Latina y el Caribe tiene como propósito contribuir al fortalecimiento de los mecanismos nacionales para el adelanto de las mujeres, poner a disposición pública información oficial de los gobiernos de la región y facilitar el seguimiento de los acuerdos internacionales de derechos de las mujeres. A través de este observatorio se da seguimiento a la situación de las mujeres en la región, en particular los avances relacionados con su autonomía física, económica y en la toma de decisiones y interrelaciones. ¿Qué información se puede encontrar en esta herramienta? Indicadores, estudios, repositorio de leyes.
Muy buenas tardes. ¿Me escuchan?
Escuchamos, sí. Buenas tardes.
Buenas tardes. ¿Está conectada la señora Galach? Quería probarla.
Hola.
Hola.
Buenas tardes desde Madrid.
Buenas tardes. Estaba probando su audio y su video, por favor.
¿Nos oyen?
Sí, perfectamente.
¿Y el vídeo ahora?
Muy bien, excelente. Muchísimas gracias.
Muy bien, gracias.
El señor Andrés Lara también estaba conectado, me parece.
Sí, estoy acá.
Oh, buenas tardes. ¿Nos escucha
Buenas
bien?
tardes.
¿Nos escucha bien? Señor Lara,
Sí, estoy acá.
¿nos escucha?
Sí, escucho, muy bien.
Ah, perfecto. Nosotros también lo escuchamos y lo vemos. Muchas gracias.
Ok, gracias. Sí.
Y hasta luego.
Sí. Soy el fan. Sí. Sean serias, ¿eh?
Señora Becerra.
Ahora sí, es que no, le estaba pidiendo auxilio.
Sí, ya acá lo auxilié. ¿Nos ve bien? ¿Nos escucha?
Escucho, sí.
¿Podemos probar su cámara? Perfecto. Muy bien, muchas gracias. Hasta luego.
Sí.
¿El señor Mauricio Basicheri está conectado? Parece que no. Mr. Gonzalez, welcome. Are you there?
I am here. I'm here. Thank you very much.
Okay. Nice to see you again. Can we test you? Yeah, you can hear us well?
Hearing you fine. Thank you.
Okay, great. Thank you very much.
Thanks.
Él es el moderador.
Señor Becerri, buenas tardes.
Buenas tardes.
¿Qué tal nos escucha? ¿Nos escucha?
Sí, yo escucho perfecto.
Nosotros lo escuchamos con un poco de eco, pero lo vemos bien.
Perfecto, espero. No. Tendría que estar. Ahora. Ahora.
Sí, ahora mejor.
Perfecto.
Muchas gracias.
Ya estamos.
¿No? Entonces, sí.
Hágame un favor, póngame esta ya bien lejos y después vamos a sacar. Gracias.
Buenas tardes, les recuerdo a todos los panelistas, por favor, mantener sus micrófonos muteados para un mejor desempeño de la reunión. Muchas gracias.
Embajador Terazo, adelante, cuando usted quiera iniciamos la sesión.
Good afternoon. It is a pleasure with 189 participants. We will begin this panel 2 for discussion, the second day of the forum of the countries of Latin America and the Caribbean on sustainable development. Thanking all of you for your participation and greeting the Executive Secretary and the speakers this afternoon, and also thanking all of you for being here. I will now hand over to the Deputy Executive Secretary of ECLAC, Mr. Mario Cimoli, who will be moderating this panel on crisis, recovery, and transformation in the decade of action for the Sustainable Development Goals. And Mario will introduce the speakers, members of this panel. So the floor is yours. Very well. Thank you very much, Ambassador. It is a pleasure. We have a luxury panel, as was this morning, with a very relevant topic. I believe, well, we would like to thank you all for being here. Cristina Galash Figueira, Secretary of State for Foreign Affairs and for Iberian America and the Caribbean of Spain. Camila Gonzalez, Minister of Finance, Economic Planning, Sustainable Development and Information Technology of St. Vincent and the Grenadines. And Andre Lara Resende, Adjunct Senior Research Scholar at the School of International and Public Affairs of Columbia University. Jose Francisco Pacheco, member of the Board of Directors of the Central Bank of Costa Rica. Maurizio Bezzechetti, Director for Latin America of NL. And Laura Becerra Pozos, Deputy Focal Point of the NGO Networks, Groupings, Organizations, and Platforms Group of the Mechanism for Civil Society Participation in Sustainable Development Agenda. And having all of you in this panel, and someone such as Christina, who knows so well the international issue and the 2030 Agenda, its relevance, its role, and multilateralism. Having Camilo, who somehow represents and knows well the process of planning with technology and processes being so important. Andre Resende, a researcher who has devised a different development model, how to rethink it, and a member of the Central Bank of Costa Rica, financing and how to do it. Someone such as Maurizio Bezzechetti, who is representing a very relevant private enterprise in Latin America. This is having also a representative of the civil society. So Laura, thank you very much. This panel is one of the most complicated topics. I am here, we're accompanied by the Executive Secretary, Elisa Bárcena, and we are very attentive to what you may see, how we may reason jointly and address this issue in all the countries that we represent here. If you believe, we could have a 10-minute presentation by each speaker and then give time to countries in order to have comments by the countries, and then you can wrap up with 2 or 3 minutes each. Because all of these things are very much linked together, and this is something that we're doing in the light of what we're doing and how we can see this forward. But recovery, as you know very well, is a complex, difficult issue. It is we all like to say this, that we need to recover better than we were before. We need to recover, building a more egalitarian society, a society with less poverty, with less marginalization, more inclusion, having a society and where this development distributes far better and where the economy leads to a green transformation, different transformation, as the ECLAC says, sustainable. And all of this represents the 2030 gender, and the issue is relevant because this is represented by the gender. And in the document drafted by ECLAC and that was presented here, we see that that means meeting the goals is not easy. But this is the first topic I'm putting up for discussion. We believe that the 2030 agenda, albeit today, we will not meet all the goals. Solely, the agenda continues to be essential in order to reason and achieve that development model. But what is our concern? If we leave things as they are, we will find ourselves maybe growing a bit more, but with greater inequality, greater informality, greater poverty, less diversification of production, and with less access. And this could happen in Latin America. If you take a look at how the price of raw materials are going up, maybe we are happy because that is good, yes, but the model is clear with its existing structure. If we take a look at Central America and Mexico and the United States, well, maybe these companies will be doing better, but the structure remains unchanged. And so to discuss the structure and how to recover, we believe that this is very, very relevant, how to detonate all this, because everyone says it. We ourselves say it as ECLAC. We need to build a better model, but what can we detonate to do that? How can we get it to work? What are the variables that we would like to include? And we're concerned, as was well said in the other panel, vaccines. This continues to be very relevant. Re-establishing growth. There is greater uncertainty. If Europe is uncertain regarding the vaccines, how could we not be uncertain regarding the vaccine? Is there an issue with the vaccines? Yes. Is there a complex issue? Yes. How are we going to recover? Well, that is the topic, but yes. But then how are we going to make changes to the structure? It's going to change production. Will company produce differently? Will financing be done differently? Unemployment will be anchored to the very large informal sector. We're concerned with all this and how technology is going to erupt in all this. And we want this to be sustainable. A series of variables that we pool together and we build a model, we think it with our heads and we say, well, how can we do things? How can we get this to detonate? And so this is a panel for discussion with you, how to get this to detonate. Each one of you plays a very important role in thinking about a structure of that type. Employment, poverty, and equality will be the three things that will be with us for a very long time, and we will find this as soon as we begin to grow, we will have reducing unemployment, not very much. So how can we grow with quality employment? How do we grow using the same sectors as before, or using more sustainable sector? ECLAC has proposed this more than once. We've launched our latest policy issue regarding this, and we think it is very important how to work on this with the international community. And so therefore the panel, I apologize, but this is a very, very relevant panel, such as the one held this morning, and that must help us to think about countries, and we ourselves as ECLAC, and that you can contribute your capacity and experience. How can we get all this to detonate? Because we can say, but how do we do it? How do we achieve this? Each one of you has the capacity and the experience to say to us, how could we move the strings for this to come about? Of course, like I said this more than once, we will recognize it's a role between the state and market, public and private. But although we're concerned in the public role, sometimes we think that we give relevance to the state. State doesn't always take things. So sometimes they relegated or delegated to the private sector, and we end up being worse than before. This is of concern because it leads to more inequality and poverty. So how can we make sure that this balance may work? How can we do to have a true recovery and the model be a better model? So to each one of you, the space that you have and the role that you have, and we thank you for helping us. And we make of this event that you may provoke us as ECLAC. Help us to think, that the countries help us to think. And this morning, for example, we concluded a panel on health and economy, and we said that health is essential. Without health, we have no economy. So let's begin with health. We know very well that there is an issue related to economy, being able to keep employment, income, but it was clear that health is essential. The relevance of the vaccine and of multilateralism to support the countries of the region.
In this regard, we have to look at the social and the economic aspects, and I want to close on a final note. We all believe in the welfare state, but the one we will have in the future is not the one that we have today. Employment will be more unstable. Companies will be hiring differently. How do we think about this? And how we understand it is going to be very important, because obviously our leitmotif for the last 12 years has been equality. So this is a major topic for us at ECLAC. So let's begin the conversation, and I
I would therefore like to give the floor to Cristina Galas Caramica. You have 10 minutes. You have tremendous experience. You know this agenda better than anyone else. You know how to handle this. You represent a government that is moving forward in this regard. How do you imagine Latin America and the Caribbean in this context? And how do we place this more firmly on the agenda? Thank you very much, Mario, for these remarks. I want to send our greetings to Alicia, to all of our panelists, and all of the people who are following these discussions. I am speaking from Madrid. Is late today, but I could not conclude without joining you. I would, before delving into this topic, I think it would be very helpful to say a couple of things about Europe and Latin America and the 2030 agenda, the sustainability agenda. I believe that this agenda exists and it has been possible to really look at the major issues and discussions since both Europe and Latin America have agreed that we need to nonetheless move forward with the agenda. It is certainly it is an area where there's been a lot of work done, and it is certainly our responsibility in Latin America and in Europe to see how we can all continue to serve as a guiding light for the rest of the planet in terms of development. I think that the success in reaching an agreement on the agenda is something that we share. And let me also note that in the first years of application from 2015 on, specifically through 2017, 2018, Europe has been looking particularly at climate change and the environment, looking at the Latin American agenda in this regard and leadership. I think that the Paris Accords have had a tremendous impact, whereas in Latin America, we are seeing that we are seeing public policies and the private actions and so forth, not just in the area of climate change, not just in the environment, but also socioeconomic and inclusive development. And we can only, in Spain, we've been able to grapple with this only since 2016, 2018. We have believed in this agenda, but when the European institutions were revamped, and it was at the end of 2019, where the Green New Deal in Europe went hand in hand with a project for modernization, digitalization, and inclusive policies. For me, this was a very important change because the transformation has been one of struggle, of sustainability at the environmental level. But what has happened, we had, of course, the pandemic, and I think Europe and the Americas are the two parts of the world that have been hardest hit by this pandemic. The figures on this are very clear. And we, in the European context, are working to overcome the pandemic, particularly with public policies and resources that have been made available. So this concept of the 2030 agenda is very much in the context of the economic recovery of Europe, particularly in public resources for employability, for resources for digital transformation, and public resources for equality, particularly supporting those who are lagging behind as a result of the pandemic. What I see for the future is that in Europe, we need to make all of our best efforts to support Latin America, a region that has less in terms of economic resources. We need to be decisive in that support. There are several elements to that. First, if we're talking about the economy, and I'm sure the people who will be speaking in a moment will address the financial aspects of that more specifically, but there needs to be a policy approach to development with or inclusion and so forth in all of the fora where we present. In Europe and Latin America, unfortunately, we don't interact much. There aren't that many forums for this. We have an Inter-American Forum and others, but for the last 5 years, we really have not been meeting much, and it is, of course, important for us to engage in that dialogue and to find common ground. And let me give you 3 names that I'm sure you would be in line with. An agreement, a Mercosur agreement, a broader Chile-EU agreement, and a broader EU-Mexico agreement. These are not commercial texts. They're not trade agreements, but they are very broad commitments, environmental, human rights, and of other natures, obviously, that include trade and investment, but that Europe at this time we've not yet really made the final effort to get them signed and applied. So the message that I would send to Latin America is if we can speed up and implement these agreements, that would be of the utmost importance, along with the Ibero-American Forum. The presence of the private sector is also important. And let me speak from the Spanish perspective. We've seen in recent months, and again, associated with a variety of circumstances, insecurity, legal insecurity, specifically tumultuous political processes, the problem of the pandemic as a crisis. And in this regard, we've seen a rolling back of European entrepreneurs and businesses in Latin America. And this space is being occupied by China, a very important international player. And my perspective is that the Chinese vision of investment is not one of sustainable development, of inclusion, of environmental protection. And so therefore, I think there are some points there that are important to address. We would like to see our business community to return or to remain, to take root in the countries in Latin America and be part of this socioeconomic development for the development, industrial development, specifically of countries that are again seeing backsliding in terms of GDP. And we are deeply, of course, concerned about the impact of that. Another element that I believe we need to work on is the different aspects that have to do with our societies, our European societies, in Spain specifically, Portugal, but also the other countries on the European continent have progressively disengaged. And that is something we certainly need to work on if we work more effectively in academia, in business communities, and even the policy and political ties through our legislatures. I believe it is of the utmost importance that we regenerate the social and political fabric, at least from our perspective in Spain. And lastly, let me conclude with a specific reference that Mario has referred to. And this is this relationship, and in some cases even a dichotomy between health and the economy. And your reference was the vaccination process. The signal that we are sending from Europe vis-a-vis vaccines obviously leaves a lot to be desired. We have a lack of supply in Europe, but we're in a situation in which there's a bit of an opportunist approach, and we need to take better stock of that and handle it better. The COVAX mechanisms and others are interesting and attractive, but we certainly need to manage them better at the global scale. Let me also highlight the financial and economic components of this. Again, the following panelists are much more knowledgeable than I, but allow me to share a few broad brushstrokes on this. The ability that the countries of Latin America have, their capacity to access funding for policies that I think we agree need to be done: development, industrial development, social policies, educational policies, policies looking at ecological and energy transition, policies that involve profound changes which mark the 2030 agenda. If we don't have access to these resources, it will be extremely difficult, if not impossible, to succeed. Spain has given due consideration to this topic and is working hand in hand with the major financial institutions at the world level to allow for new perspectives and the entitlement in terms of rights to withdrawals and so forth, and access to these funds should be determined in different fashion. Quite clearly, the so-called middle income countries have been mislabeled because the pandemic has led many of them to really fall into conditions that are much more like those of a developing country, because when we speak of middle income, there's no income to speak of at present. So We clearly need a planning instrument for public planning that works hand in hand with the private sector, as well as increased accountability. Cognizant that the goals that we've all agreed upon over this long and complex process, many of them, of course, will not be reached in the fashion that we had envisioned. But we certainly, I believe, could have an interesting discussion about perhaps adapting the goals themselves. Obviously, that conversation would have to take place within the heart of the UN. We don't want to fall into the melancholy of failing to attain these goals or to be bogged down in frustrations. But this path of the 2030 agenda as a framework for development is certainly a path, and that Latin America should engage in together. It is an agenda that we have shared, and from the policy perspective, I think this is important, and I look forward to the following speakers on the financial and economic side. On behalf of the government of Spain, let me note that we will do everything possible to bring this to fruition and to ensure that the EU does so as well. Mario, to thank you so much also to our panelists, and I will stay with you for a little while, although it is very late here, and I would beg you to forgive me if I sign off before the panel is over. Thank you very much.
Tina, como siempre. Thank you, Christina. So, planning, and I liked accountability, because accountability in the 2030 agenda for equality and sustainability, I like it. And debt, that's relevant. After you, the Minister of the Caribbean will speak. And when you think of debt, you immediately think of the Caribbean, and you say, well, the debt is an issue there. And so unaddressable with regard to globalization. We've not yet done anything, so it terrifies me. We've not done anything. So let me ask you, my dear Camilo, how can we do to manage the issue of debt when everyone says we understand it, but it's never done? So how can we plan in the region of the Caribbean with such a high level of debt in terms of technology and development, and with a hardly hit tourism? How can we get that recovery to meet the 2030? Camilo.
Thank you very much. Hello, and greetings to my fellow panelists. And Alicia, how are you? I hope you're well. I think only an economist would say when you think of the Caribbean, you think of debt, but it is probably a true statement. And the COVID pandemic is certainly not helping us in that regard. And most of our countries have found themselves in a position where we're trying to borrow our way out of the crisis in much the same way that we've had to borrow ourselves out of previous crises, be they isolated climate events, weather events, or indeed the extended period of decline after the 2008 global economic and financial crisis. So you begin with the question, where are we now? You're talking about a decade of action for the SDGs. That's one of the things we're talking about today. But where are we now? We lost a decade after the global economic and financial crisis. And after that lost decade, we're giving way to the very real possibility of another extended period of decline and difficulty in the wake of the COVID pandemic. So you're going from what was discussed as a lost decade to now a lost generation, because you're going to be talking about sort of back-to-back lost decades. And you can't be speaking at the beginning of this decade, the 2020s, which is supposed to be a decade of action for the SDGs, but instead talking about the possibility that we're approaching another lost decade, where we're going to spend the first half of it likely trying simply to tread water and get back to where we have been pre-pandemic. The challenge or the challenges that we're facing are how do we maintain the developmental targets, maintain focus on the developmental targets that we set pre-pandemic? How do we recover from the pandemic as quickly as possible and readjust to the new realities that the pandemic has wrought? And more fundamentally, after you get past the immediate challenges, how do we rethink and adapt our policies and structures? And that's not just internally, but regionally and globally. How do we adapt policy and structure to accelerate transformative development? Because unless we're going to throw our hands up in 2021 and say the SDGs are impossible, let's move on, we're going to have to talk about accelerations to transformative development and understand that the 10-year window that we gave ourselves in 2020 to talk about a decade of action is really going to be a 7-year window once we get past the realities of COVID. And the question is, can we achieve our goals in a shorter time frame? And if so, what do we have to do to get there? And of course, while we're doing all of that, we're grappling with the pre-existing conditions that were already severely challenging countries' capacity to deliver. Climate change, inequality, poverty, unemployment, and the like. And it's critical because just as in healthcare, when they say that COVID affects countries or affects people more severely who have underlying conditions, underlying health conditions, so too did the economic impacts of COVID more severely affect countries that had underlying economic ailments and conditions. And the Caribbean has been severely affected by COVID, not necessarily as severely as some on the healthcare front. We've done, I believe, reasonably well in most countries in minimizing loss of life and severe infections, but certainly economically, because even amidst all of the uncertainties that we have for COVID in 2021, one thing is assured, and that is that with the exception of Guyana, which recently discovered oil, no Caribbean country will be better off at the end of 2021 than we were at the start of 2020. Indeed, most of us will have to wait until 2022 or 2023 to regain the ground that we lost to COVID-related contractions. So already in this decade of action on the SDGs, you're into 2023 before you're back at 2019 levels. Most Caribbean countries experienced double-digit economic decline in 2020. And among the smallest Caribbean countries, the countries of the Organization of Eastern Caribbean States, contractions exceeded 20% in some cases. They as high as 25% in one particular case, a particularly tourism-dependent small island developing state. And if anything, the contractions that LAC has reported on and that central banks are reporting on in 2020, if anything, those contractions have been exacerbated and have intensified in the first 3 months of 2021. And the reason for that is simple. Tourism is cyclical. People travel from Europe and the United States in the winter, and the tourism season ends essentially when winter ends, in February, March. Last year, all Caribbean countries experienced a pretty normal tourism season at the beginning of the year. So last year's January and February were fine for most Caribbean countries. And tourism didn't take a hit until COVID arrived in the region and until the pandemic was declared in March. So the tourism season had ended, essentially, in the Caribbean before COVID arrived, and yet we experienced double-digit economic declines. This year, we do not have the cushion that we had last year, which was the cushion of a regular tourist season. So we went through the entirety of last year, and now we're into, you know, December, January, February, March, with no planes flying, no tourists arriving, and borders closed in many countries. So imagine experiencing a 20% decline last year with a regular tourism season. And think about what it's going to mean for the Caribbean this year if this type of activity or lack of activity continues. So even if you have a mid or late year rebound in tourism, it will at best produce very, very modest growth in 2021, and that is an optimistic best case scenario. The likelihood is that we will, having declined precipitously in 2020, we will at best be flat and reduce and you know, stop sliding. But there is very little chance, there's no chance that we will grow ourselves out of the hole in 1 year. There's absolutely no chance of that happening. And we have to face that. Our policy priorities have been focused on the urgent necessities of strengthening social protections to deal with the tremendous upheaval wrought by the lockdowns and the collapse of tourism, particularly in the informal sector, which is a very large sector in the Caribbean and very, very tourism dependent. And there are entire villages, entire towns that have made, I'm not talking about families or individuals, I'm talking about settlements of people who have made no money because there have been no tourists. And that is the reliance of certain sectors and in the informal sector in particular on the presence of tourists in the country. And so the priorities have been focused very much on trying to alleviate some of the upheaval that's been wrought by that. And those will continue. They have to continue necessarily, even though countries are finding it increasingly difficult to finance some of the interventions. We all began this in March, hoping that we'd get past COVID by the summer. I remember the then President of the United States suggesting that this thing would disappear by the summertime. And certainly we didn't anticipate spending 4% of GDP and more for the entirety of 2020, and now looking like we have to do a similar type of intervention this year. But while we do that, the absolute urgent prerequisite, the priority for us has to be a return to some semblance of normalcy, because we can't get to any of the developmental pursuits or any of the discussions that we're talking about until we return to some sense of normalcy. And that means two things. That means jabs, as in vaccines, and jobs. And without jabs and jobs, we go nowhere in the Caribbean. And so countries are forcing themselves, as poverty increases, as unemployment increases, to reopen economies and reopen countries even before vaccines are available. And one of the prime ministers in the region put it best. He said, when he was challenged by a member of the press saying, well, why are you reopening your economy before you've vaccinated your people? He said, there's no vaccine for hunger. There may be a vaccine for COVID, but there is no vaccine for hunger, and people are in desperate economic straits in the countries of the Caribbean that are tourism dependent, in the countries of the Caribbean that depend on regional trade in agriculture when borders are locked. And if you are a farmer and you're in St. Vincent and the Grenadines, and you rely on shipping root crops and vegetables to Trinidad and Tobago, but Trinidad and Tobago is closed, you have no market. And if you'd like to sell your crop to the restaurants or the tourism sector, again, you have no market. And if you're a fisherman and you normally sell your lobster and your mahi-mahi to the tourists, you have no market. And these are difficult situations. The urgency of the efforts to alleviate the worst effects of the crisis have been necessarily focused on immediate action. And sometimes they don't lend themselves optimally to calibrated long-term development policy. You're focusing on keeping people with food on their table and not necessarily thinking of long and medium-term development strategies. However, the pandemic and the necessary recovery and stimulus programs, however modest they have been, have presented a brief window for some creative interventions and have forced some thinking outside of the box that can translate post-pandemic to achievement of some of our sustainable development goals. For example, in St. Vincent and the Grenadines and in other Caribbean countries, countries have allocated grant funding to entrepreneurs and micro-enterprises. That is important in not only keeping these businesses afloat and alive, but in fostering a sense of entrepreneurial activity, of risk-taking, and ensuring that these entities continue to participate in economic activity going forward. Post-pandemic, we are going to need entrepreneurs and the energy of the entrepreneurial sector to help us recover quickly. And it's important to keep them, even if on life support, keep them alive during this period. We have been focusing on providing technical and vocational education to help displaced workers to retool. The workers who lost their job first were either the low wage workers in the tourism sector or the low skilled workers who are most easily expendable. And so while they are unemployed and while job prospects are slim, it's been important to offer them the opportunity to retool from an education and a skills perspective. Similarly, assisting small farmers and fishers, artisanal fishers, to boost their productivity helps immediately in the near term when income is low, but helps them to be more productive post-pandemic when you're hoping for a rebound. And of course, on the infrastructural side, the focus on small community infrastructure projects that can both create temporary jobs, because you hope that this pandemic is a temporary thing and you don't want to place people on the permanent payroll, but you create temporary construction jobs in community infrastructure that can help to build long-term resilience in that community. Excuse me. Necessarily as well, there's been an effort to keep a business afloat, even though the size of our economies and the strength of our economies are insufficient to offer the type of bailouts that we see businesses have been getting in some other economies. But things like bank moratoria on loan payments, giving moratoriums on payments of loans or utilities have helped some businesses keep things together. Adjusting regulations that would have them pay severance pay to dislocated employees immediately, deferring those payments so that they don't have to fire 20 staff and at the same time pay those 20 staff for their dismissal. These things help to keep businesses afloat, because it's better to keep a business, you can resuscitate a business on life support, but you cannot reincarnate a dead business. So we have to do our best to keep the businesses going on. But of course, there are sustainability challenges to all of these interventions. Our states do not have the fiscal space to sustain an annual COVID response in excess of 4% of GDP. And particularly now, when as tourism season winds down, hurricane season begins. And God forbid any of our countries have to deal with a hurricane immediately after trying to deal with the economic fallout of the pandemic. So the message is that the crisis has heightened creativity and responsiveness in some sense, but it has not solved the underlying developmental challenges that we face of high debt, of limited fiscal and policy space, and the iniquitous trade environment that we traditionally have had to grapple with. Nothing that we do, neither the COVID recovery nor transformative sustainable development is possible, is implementable without additional fiscal and policy space. That is the fundamental cornerstone. I could speak about vaccines, but I know vaccines have been discussed in previous panels today. All I will say on that is that it is criminal that there are countries in the world right now that have vaccines in excess of their population, while other countries in the world don't have any vaccines, or certainly not enough to vaccinate all but the most vulnerable populations. It's criminal that some countries are choosing between, well, we want this brand of vaccine and not that brand of vaccine, and I'm a Pfizer vaccine person, and I'm a Moderna person, and I'm an AstraZeneca person, when there are countries that have none at all, and we'd be happy with any one of them at that point. But that's not my panel, Alicia. So I'll discuss that. I'll leave it to the discussions that have taken place already. Fiscal and policy space is critical. And acquiring that fiscal and policy space is impossible in the Caribbean without debt relief. It just has to be said. Most Caribbean debt pre-pandemic had been accumulated in response to climate change or natural disaster response. In the immediate aftermath of disasters, countries have had to borrow to rebuild and build back better. Now, again, we are borrowing ourselves out of a catastrophe that is not of our making. There are countries that 1 year ago had a debt to GDP ratio of 60%, and now today have a debt to GDP ratio approaching 90%. In 1 year, debt to GDP ratios are increasing by 50%. And will continue so to do this year. And that is a developmental shackle on the countries of the Caribbean. It renders us stagnant. We know what we need to do, but we can't do it because we're waiting for the next crisis or disaster to happen, and we have no space in between. We need to discuss debt for climate swaps. We need to discuss debt relief. We need to discuss the long promised but very difficult to access climate finance that will help us address some of the challenges we thought we would be addressing with climate financing money, but we've had to address with money out of our regular tax revenues. These are critical issues. And if we can address the issues of policy and fiscal space, stripping away everything else, then we can have a proper discussion about achieving the sustainable development goals in an accelerated time frame. I think that's the key message I'd like to leave you with before we go to the panel, that we know what has to be done in the Caribbean, but we cannot do it unless we have greater fiscal and policy space. And in the midst of this pandemic, we are borrowing ourselves to a standstill, keeping people alive, but mortgaging our future ability to achieve the sustainable development goals. And we've been talking for a long time about debt for climate swaps. We've been talking a long time about debt relief. We have to do it, because if we don't do it this year, the lost decade will most certainly become a lost generation in the Caribbean and likely elsewhere in the developing world. So I thank you very much for the time and your attention.
Gracias.
you very much, Camilo. I think that was perfectly clear. That fiscal space, the impact, of course, is a question of tourism, of reconstructing tourism. It's entire cities and countries that depend on tourism, but there's also a tremendous opportunity to build on this. Everyone wants to engage in sustainable tourism everywhere. And so I think the loss of work, fiscal space, less informality are all important topics. Andre Lara Resende, adjunct senior research fellow at Columbia University, who's proposed some heterodox proposals lately. We've seen a lot of proposals in Latin America and the Caribbean, but everyone seems to get very happy because raw materials are seeing price hikes, and as a result there is a reduction in foreign pressures, and one says we might almost be returning to the old world. So the question is that the policy approach, or do we need to think about a fiscal environment that is different? What's happening in places like Brazil? Brazil obviously is putting tremendous pressure on the rest of the region. Andres?
Well, thank you very much. Thank you very much for the invitation to participate in this panel. And I think the question is extremely interesting. I think it's the main question we face today in Brazil and in most countries. Well, it's a question about fiscal space. Do we have fiscal space to react to the drama of the pandemic, and also to invest, to get out of the pandemic and to prepare for a future or a sustainable economy? Well, let me focus briefly and schematically on what's going on in Brazil. Of course, you all know that Brazil is facing, on top of the pandemic, a very difficult political situation, and Brazil has interrupted a long tradition, internationalistic diplomatic tradition, and has cut most of its ties, and it's denying the urgency of the sustainable agenda. Well, I'm not going to address that. This will take too long, but I will focus most on the macroeconomic policy and debate in Brazil. I'll say basically that macroeconomic policy today in Brazil is based on the concept of expansionist austerity. I think it was created after the great financial crisis of 2008. Mainly, I think the theoretical underpinning was done by Alberto Alessina, and at the time Olivier Blanchard, chief economist of the IMF, saying basically that says that, well, balancing the fiscal budget is not only a necessary condition, but also a sufficient condition for the recovery of investment and growth. This is the old British Treasury view that was criticized by Keynes in the first half of the 20th century. It has returned. It has returned after 2008, mainly for peripheral countries, and with the case of Greece and others in mind. It's no longer defended either by the IMF or by most of the economists in the United States and in Europe. Even orthodox economists have changed their view. Basically, even Olivier Blanchard, and in a seminar that was happened in the 1st of December in Washington, with commenting a paper by of Jason Furman and Larry Summers, and the table was composed by Olivier Blanchard, Ben Bernanke, and Ken Rogoff. Okay? I say it's the cream of the academic and policy making in the United States. And they have all agreed that there was a paradigm shift in terms of what is fiscal possible. And basically, they were criticizing the idea that the debt to the GDP, the limit of debt to GDP is really, there is a very fixed or given a magical number of debt to GDP after what there would be a fiscal cliff. Well, this, as you all know, the idea that 90% of debt to GDP, after that, countries would go down the drain, was the basic message of Cameron Reinhart and Kenneth Rogoff book on This Time is Different. It has been consistently denied by the facts and by reality, but there is a very strong message in that continues to resonate politically everywhere in the world. And specifically in Brazil, the fact is that not only the government and economic team today in Brazil, but most of the analysts and those who show off in the media and big media and are those who influence public opinion are still totally based on this fiscal space and what I call the fiscalist dogma. So what is going on? Brazil, there is a big confusion in when people don't understand there's a big difference between public domestic debt and public external debt. The case public external debt to be serviced requires the transfers of real resources abroad, either now, in the future, the near future, or the long future. This was the problem that Keynes once again analyzed as the problem. So this really, if you have external debt, denominated not in your own money, in your own currency, you have to pay to service the debt, you have to transfer resources abroad. That's a problem. So you depend on credit from abroad, and you depend on the goodwill and on the expectations of foreign investors about what you're doing. Okay? This is the reason that we had crises like we had in the last centuries, like Brazil had several of that we had several of these crises of, which is in the economic literature is called as the original sin, getting that in a foreign currency, and then you can expect to have like sudden stop when expectations change. Totally, your credit dry off suddenly, and you have a major crisis. That's completely different from the situation of countries. I'm not talking about countries that have whose currency are international reserves. The US has a very special situation. Europe, in a certain way, also. Let's talk about the case of those whose domestic currency are not external reserve. That's the case of Brazil, for example. But Brazil, when analyzed by foreign analysts, and they don't know very much about what's going on specifically in terms of Brazil, people don't know that the Brazilian public debt today that went from 80% to almost 90% of GDP today. So it grew by 10% of GDP after last year with the pandemic. That this debt is 100% denominated in reais, in the Brazilian currency, and it's held by Brazilians. So this is a debt from the Brazilian state to Brazilians. It's the Brazilian state that owns to the Brazilian private sector. From the point of view of Brazil's wealth, public debt doesn't change anything. It can, and it normally has distributional effects. But it doesn't make any sense of saying that we are compromising the future of the country and next generations. This is simply not true, logically not true, which is true when you do have a foreign debt and you do have to make foreign real transfers to pay and to service for this debt. Well, the case of Brazil now is Brazil has 100% domestic public debt, but Brazil has 35% of GDP in foreign reserves. Okay? So if you deduct from Brazilian public debt 35% of GDP that it has on foreign reserves, Brazil net debt is 55% of GDP. Well, second, Brazil is probably going to have this year, 2021, a current account surplus. Brazil has had in the last 20 years, a huge trade surplus. As was mentioned here in part of the question that we are addressing, the fact that the price of commodities are going back up for Brazil is extremely positive. Okay? So Brazil has a very productive, extremely competitive, with high productivity agribusiness sector. And so there is no reason whatsoever to expect to say that Brazil faces an external constraint. So Brazil has no external constraint. I don't know about the case of the Caribbean. I think that the Caribbean most is foreign debt, and then they face indeed a foreign constraint. That's not the case of Brazil. Well, but because of these what I call this mental constraint, this mental straitjacket that has been put on Brazil, and who try to handcuff the response of the Brazilian public sector to the drama of the pandemic, catastrophic drama of the pandemic. Yesterday in Brazil, 2,800 people died, more than 900 only in the state of São Paulo. So we are reaching 300,000 people dead since the beginning of the pandemic. Okay. Well, and Brazil has the last decade, not only for the Caribbeans, and Brazil has lost in the last decade. Brazil per capita income was reduced by almost 1%. So it was another lost decade. The fact is that Brazil doesn't have this external restriction, has more than 50% open unemployment, and real unemployment is above 20%, if you count those who have given up looking for a job. There's a major problem of people that lost completely all kind of income, as was mentioned here by Camilo Gonçalves in the Caribbean. And so we need now a combination of assistential transfers, which is absolutely imperative. And we need to program for long-term investments. We know that fiscal policy and long-term investment in infrastructure, in basic sanitation, sewage, clear water, and adaptation of the energy matrix, this requires long-term planning. We cannot take it and do it in 1, 2, or 3 months. So it requires a program, and it has to be well executed. Well, but with this straitjacket, mental straitjacket, fiscal straitjacket that we have in Brazil right now, this is not even discussed. The only theme, macroeconomic theme in Brazil is balance the budget. Where does the money come from? When the fact is that domestic money financially to finance the project is not a problem, as long as you don't have an external restriction. The problem is how to do the right thing. Fiscal responsibility is not to guarantee that in the short term, and in any circumstances, the fiscal budget is balanced, but that you do the right thing, that you invest well to increase productivity, to prepare the economy for the future, and to reduce social inequality, and especially in the case of a pandemic like that. Well, with that, I finish my first intervention. Thank you.
Gracias.
Thank you very much, Andres. I think that the topic of transfer to different parts of the population and having a long-term policy on infrastructure with domestic funding is one way to respond. It's clear and it's obvious as well in the Caribbean and many other countries in the region. Foreign debt is a completely different context. But that is certainly one of the paths. We also take note of the question of productivity. This is something that LAC has always focused on. Diversification in productivity is important, particularly if it is of domestic origin. Let's now turn to Jose Francisco Pacheco, Director of the Board of Directors of the Central Bank of Costa Rica, because, well, money is important, as we all know. We also know that if there's a country that's made a global effort to fund and looked at the debt, it is the Costa Rican plan. It's really fabulous to see these types of things coming from an economy in the South. So, Jose Francisco, how do you handle this in an economy that obviously in the coming months will need the support for the productive mechanisms and the symmetry with, obviously, with Europe or the US? Obviously, central banks in those places are just a completely different thing. It's like trying to play in the Premier League when you're really just a starter team. So, Jose Francisco, how do you handle that? And tell us what the interest is in terms of the debt, especially in the area of Costa Rica. Jose.
Well, I thank the organizers for the invitation. Although I am a member of the bank, I have been for the last 3 years at the Ministry of Finance. And many of these things that we're discussing here is everyday talk. The constant struggle of countries that we have, constant issues with financing, and some issues. Mr. Pacheco, unfortunately, your volume of your audio is too low. Could you please move closer to the microphone? You're still very low, the volume. Can you hear me better? Yes, now yes. Thank you. It's the technology that is playing against us. Well, I was saying that I have 2 seats, one at the Ministry of Finance and now part of the Board of Directors of the Central Bank. But the issue of financing is always on the table. However, I would like to give this an opportunity approach. In the midst of these discussions in this regard, what's of concern is 2 things. First, of course, the pandemic or naked, many of the issues that we thought had been brushed under the carpet, but suddenly the carpet has been taken away and the issue is seen in its true dimension. Access by students to digital connections to be able to connect from home to school is something that affects us in all areas of the country. And so, aside from this series of issues, there are other challenges that I believe have not been sufficiently addressed and that are part of the stock of challenges that generations over the next 50 years will have to face. And I'm speaking of changes in the labor market, for example, in terms of the automation of employment. And this is something that we cannot yet visualize properly, whether in fact working from home will settle as a prevalent, but well, at least very attractive way of organizing work. And we do not know if this could have a repercussion on the way that we are hired and consequent repercussions on financing of Social Security. So maybe we can change our status and are no longer wage workers, but now we begin to be self-employed workers that provide work to particular enterprises, and self-employed workers are more changing than waged workers. And so also we need to implement the decarbonization agenda, and Costa Rica has a very important banner here. We've already started to mold and shape things, and we discovered that it's not just a matter of cost and asset changes, so to speak, but also this is a great opportunity to create future jobs. And I think that this is part of our change and new vision. And then also the social protection system. This has placed us all against the wall. We're all vulnerable to risk. And so it would seem relevant to begin thinking, quite aside from policies to fight against poverty, thinking of a welfare state where at least the entire population has access to health and food. It is a change in ways of seeing this social policy, because for many, social policies are a synonym of a fight against poverty. So maybe we should change that way of seeing things. However, this will not happen in thin air, and this does not happen spontaneously. It is necessary to change the paradigm with which we are furthering these policies. And here there is an essential issue that has to do with the way that we are focusing on the state. The concept, the discussion, the debate regarding a small state, large scale, I believe, is today outdated. In societies that democratize and mature, it is impossible to maintain an appropriate social compact and saying to certain groups, you have no right to be protected by the public sector. I think that aside from saying whether the state should be small or large, the essential concept is whether the state should be simple. It must facilitate life for citizens and provide them with things. That is a first step, a change in how we are seeing the state. Then specifically, I would say that
del rol del Estado alrededor de estos
opening up the role of the state and in relation to, say, social protection, climate change, in terms of modifying the way we structure the models, the concept of public infrastructure, and seeing the way that our labor markets are working. And at the heart of all this
figura del financiamiento.
is financing. This is like a sort of story that has several levels. We know that financing is important. Those of us who've gone through finance, that we know that every day we receive different groups all asking for a budget. And that is something that we decide sitting at our desks. But I believe that we must see financing with a feature that I would say has two branches. On the left, we must promote financing that is the result of outcome-based planning. Money is not relevant of itself. No, it's important to be able to do something, and that something must have a new way of how we're planning future development. For example, as a rule, we see this in the way we devise our budgets. This is more focused on microeconomy. We see this as a way of how we're focusing on our budgets. And usually we say the budget, this entity receives money because of this or that. And so we need to change these paradigms and redirect it towards concrete outcomes. and then receive the necessary financing. But there is another part to this equation that really strikes me because it's not much discussed. And this is where the criticism of the public sector is more acid. And that has to do with the capacity of governments to execute that financing. So the discussion about financing is relevant in the measure that the money is there. But if we do not pay attention to the budget execution mechanisms, the way that we're spending, and our ability to transform that money into goods and services for society, I think we're leaving things halfway. For example, in our countries and where discussions about budgets and capital expenditure could be, 30–40% of the initial allocations, not even to speak of the social sector, 30–40% of
de las pensiones con cargo al presupuesto nacional.
Pensions are paid for publicly and with certain subsidies to people living in poverty and that never reach the right people.
Para que ejecute bien. No solamente para que
So we need to discuss how to ensure that the state is able to execute things properly, and not necessarily how they're going to get more money. And this is a change to the way that things are normally approached. And so based on these two concepts, to the left, as I said, outcome-based financing, and on the right, the need to strengthen execution mechanisms. In the middle, there are cross-cutting aspects, and that have to do with the change in paradigm with regard to the public sector. First, we must get used to the fact that financing today, it has multiple faces. That it is only via international loans from international agencies as the only sources of funding. This means that we are losing tremendous opportunities to finance our projects. And here we have blended financing or impact investment, just to mention two models, and of which Costa Rica has already started thinking of some of these. So there is even a bank, a state bank, that issued green bonds. And Colombia has also done something like that. These are examples near to home. And we've had many opportunities to design social bonds as a sort of pilot way of seeing, of using these different ways of obtaining financing and how we're executing all this. Another thing I would like to mention is that in the change in paradigm, the private sector does have a special role to play in development.
Y la discusión ideológica que hemos tenido sobre hasta dónde debe llegar el sector.
The ideological discussions that we've had, how far should private sector go and how far should the public sector go, the two begin to merge, and we've discovered very interesting alternatives for financing, very interesting alternatives. And where the private sector executes development programs, development projects that have very good outcomes for the population, without this necessarily implying an exaggerated profit. It's sometimes not easy to digest because the way that we've conceived the public sector has shaped things differently. But I think that now that there's a call for a change in paradigm, and it's essential that we should discuss this as a society. And from that viewpoint, I believe it is essential that our discussions with regard to the transformation of the state should take into account not only this novel role that we've assigned to the private sector, but also I believe it is essential that we have a better understanding of how the private sector works and how businessmen think. There's a tremendous criticism with regard to the public sector, and on many occasions we are considered as islands that separate from the reality and lead to red tape processes and conditions and mechanisms that really means that investment takes a distance. So I think that we should consider diversified financing, a novel alternative, and financing linked to other practices in terms of resource execution, and financing whereby we respond to the main needs of the country. Another chapter is the fiscal space. There's tremendous concern, and at least in the case of Costa Rica, and I know that many countries are doing the same thing. What fiscal space? When we have a tremendous number of needs that all accumulate and a state capacity that of needs that are lagging behind, and even far more difficult being able to generate resources internally. And in the midst of this, our discussion about fiscal space must be as innovative as the one about financing that I've just outlined. And here there is an essential aspect, and that is the ability to set priorities. Let's recall, for example, that in one case, such as Social Security in Costa Rica, and this is something that I can visualize here, we are at a time when Social Security is needing a discussion about this reconsideration of financing, and that the government of the Republic is discussing this in terms of the fiscal nature. This it's a way of putting sectors to compete. The space is limited. So what sector is going to take this percentage of financing that maybe the people are prepared to give? And so it's here that politics prevail over the technical approach, and we need to find a way to get financing turned into a tool for doing things, and that the commitment by the public sector, I say, has to do with promising that the funds that they do get are effective. And these are part and that they result in the goods and services for which they were devised. Thank you. Well, thank you very much, Jose. Wow, well, we've really got into the discussion. We will continue with this fiscal space and how the competition for that fiscal space is very relevant. Assessing spending, how to assess spending and how to manage it to make it more effective with a political and technical government program. And the role of the private sector is lack of understanding that sometimes exists between the public and private sectors. And this discussion about who's the bad guy in the film. And at LAC, we always say that there is a way of reading this and space to discuss it. I think that the topics are on the table, and this will allow us to move on to the next presentation by Maurizio Bezzeccheri, that surely has a great experience and is a director of a private sector company, energy. So how do you read this? How do you, as private sector, imagine that this compact should work? How do you see the private sector of having a driver so for development to be sustainable, for inclusion to have a place? Mauricio, how do you see it? The floor is yours. Well, first of all, thank you very much, Mario. My greetings to Alicia Bárcena and all the speakers and participants. Greetings. Unfortunately, the audio is of very poor quality. I will try to do my best. A few considerations first of all, regarding COVID. COVID has led to much suffering, but also it has other aspects. As was said earlier, COVID has exposed the fragility of systems. And it does have certain psychological aptitudes. Some people are trying to return to the situation prior to COVID. And as has been said here by previous speakers, unfortunately, it is incomprehensible what the speaker is saying. But this has opened up our understanding of our weaknesses and also our resilience. Jose spoke of the change in the way of working, and we are reflecting on this, and we've had the experience. Unfortunately, it is impossible to understand what the speaker is saying. I am sorry.
De consultoría, ma que tendremos una forma y por qué ir a la oficina, pero no creo que va a cambiar la forma de las empresas. Se hablaba prácticamente de financiación y de green bond. En realidad nosotros nos estamos moviendo mucho más en las direcciones de bond sustainability bond, es decir, posibilidad de recoger dinero más relacionado a objetivos de sostenibilidad de la empresa. Porque el Green Bond, como sabemos, es relacionado a un proyecto.
Again, from the interpreters, the sound at origin is very much wanting. It is simply not possible for the team of interpreters to understand the speaker enough to provide you with even a summary of what is being said.
De estos objetivos. Y como sabemos, estos sustainability bond tienen la presunción de hacer un de-risking de las actividades y esto le permite de conseguir dinero a un taso de interés más bajo de los bonds tradicionales, incluido de los green bonds. Hecho esta premisa, los números para describir qué nos... Enel, como per chi che non la conosce, è decimos, el player privado más grande del sector eléctrico en Latinoamérica. Hoy nosotros estamos en Centroamérica, incluido Costa Rica, estamos en Colombia, estamos en Brasil, estamos en Argentina, Perú y estamos en Chile. Nosotros vamos a invertir en los próximos 3 años, independientemente del tema del COVID, porque se demostró en este periodo de COVID la fuerte necesidad de la energía como habilitador de muchas otras actividades. Nosotros vamos a invertir en los próximos 3 años, al desarrollo de infraestructura de distribuciones y al desarrollo de energías renovables. Cambiando evidentemente la matriz energética donde
Endeavor to change the matrix.
Porque a paridad de costo de CAPEX, a paridad de costo.
Given the CAPEX for cost and maintenance, the costs in Latin America are 2 to 3 times more than they are elsewhere.
Por lo tanto, esos son los que nosotros haremos en los próximos 3 años. Don José habló también de...
Again, from the interpreters, we are simply not able to make sense or to comprehend an entire sentence.
Otra cosa. Ha sido no solo, ha tenido la capacidad de poner en evidencia las debilidades y los puntos de resiliencia de las instituciones y de los negocios, pero también esta forma de acelerar nuevas formas de negocio con espacio de la relación. En pocos minutos el tema de la transición energética. En el comparte las visiones que han expresado todos los panelistas que expresa CEPAL que el impulso a la sostenibilidad es un factor clave para un desarrollo que cierre brechas económicas, sociales y ambientales y soporte las recuperaciones. Cuando la CEPAL habla de recuperación transformadoras, nosotros estamos totalmente...
When ECLAC refers to transformational capabilities, we concur seeking short-term interventions that can strengthen capabilities to create long-term sustainable growth. The pandemic has worsened conditions and demands a new approach. Our participation in infrastructure is very much committed to sustainability. How do we express that? The history of our investment shows throughout our territory and are aligned with the SDGs. The digital transformation and other transformations, energy transformation, goes hand in hand with our suppliers, workers, and so forth. This has changed our supply chains, the logistics that we work with. So our strategy in Latin America is for companies to contribute more effectively. Again, from the interpreters, we are unfortunately not able to continue.
El primero es una educación de calidad. En toda la discusión anterior no se ha hablado mucho de cuánto puede ser importante el rol de las educaciones para la recuperación. Porque como hemos dicho, el COVID aceleró procesos ya preexistentes y irá profundamente a cambiar la forma de trabajos, las experiencias, las necesidades de expertise que son necesarias para el desarrollo futuro de la... Lo otro es, no solo tiene un impacto con la salud, por como lo hemos dicho, energías renovables para Latinoamérica significa energía mucho más barata y que tiene una indicación y una proyección de precios de largo plazo, porque no depende de la variabilidad de un combustible. Después tenemos la contribución.
We have the contributions to socioeconomic development. Again, from the interpreters, we may get a sentence, but we cannot put together a paragraph.
Y allí hemos mantenido los protocolos de seguridad sanitaria, pero al mismo tiempo hemos permitido que millares de personas han podido seguir trabajando y por tanto tener una fuente de renta. Y además se han promovido proyectos que han mejorado la calidad de la vida de las comunidades. Hasta ahora he querido pensar de volver a lo que era antes del COVID. La aceleración del COVID nos pone enfrente con un nuevo modelo de business, como hemos dicho, pero también con una profunda innovación.
COVID has led to innovation.
Distribuir. Por tanto, responsables de la creación de infraestructuras. Después, como también en los estudios de la CEPAL siempre se subraya, nosotros tenemos en Latinoamérica el 80% de la población que vive concentrada en ciudades. Y esto porcentaje
that in Latin America, 80% of the population lives in cities, and that level is growing. By 50-50, it's expected to be 70%.
Está profundamente marcada da una tipicidad de Latinoamérica. Que probablemente
And this is a feature in Latin America, as well as in Asia. So we have the impact as well of greenhouse gases. We are committed to fighting climate change, as have noted the previous speakers.
Y a su vez de la economía entera, no solo evidentemente conscientes del riesgo que están asociados.
We are cognizant of the risks and how they affect models for sustainable development. The ML Group Sustainable Development Approach seeks to build synergy throughout the company, looking to the SDGs in 5 business areas. including power generation. We can see that in Chile, there are some 900 electrically powered buses on the streets today. And we have participated in a bid for 400 buses of that same nature in Colombia and in a bid for similar vehicles in Sao Paulo. Obviously, this business line goes hand in hand with the policies that ECLAC itself has referenced: energy transition, electrification of final use, such as electromobility, and the circular city. One of the aspects that Christina mentioned in her remarks is that we cannot do this alone. If everyone thinks they can, they are profoundly mistaken. The possibilities are certainly there for a win-win situation. If we look at the communications processes,
Soy prácticamente padres me hablaban de cómo la televisión en su introducción.
We've seen how many habits have changed throughout the pandemic, including
y por lo tanto, en este queremos y colaboramos de hecho con los gobiernos y con los otros stakeholders. Evidentemente, en hacer que tenemos que detectar cada uno en su propia competencia, evidentemente, las políticas y las acciones que promueven la transición energética y la transformación sustentable. El rol de la energía, de la transición energética nos pone mucha responsabilidad. Nuestro trabajo se articula en muchos ejes de las sostenibilidades con, como hemos dicho antes, clientes, como por ejemplo, piensa de operar de sistema, mejorar el sistema mismo. Y
includes a vast number of effort in energy transition, and we are seeking to design a roadmap for energy transition. Not only are we seeking to open up economic opportunities for everyone, but also to
evidentemente, la hoja de rutas que estamos diseñando benefician de las principales
environmental roadmap that we are seeking to do in development and renewables seek to ensure energy efficiency.
Finalmente la hoja de ruta, beneficios económicos netos. Y hasta el 2050 se ve que prácticamente puede generarse para Perú un flujo de más de 100.000 millones de dólares solo en Perú, doblando el beneficio neto de esta inversión. Por lo tanto, también se habló antes del empleo. Esta transición estos desarrollos sostenibles y las descarbonizaciones pueden generar 15 millones de empleos estables, sin considerar prácticamente todo lo que se genera en las construcciones. Y para concluir, evidentemente,
Obviously, the energy tradition and transition will increment hand in hand with the coordination with other countries. LAC
todos los esfuerzos y las fuerzas disponibles para conseguir estos
to make all possible efforts to ensure the best possible results. Thank you, Mauricio. I believe that the topic of change in the energy model, behavior of companies, productive processes, and the role of public-private partnership is important, of course, one that dominates the discussion. Everyone has focused on that as a point of dialogue. And that is why our last speaker is from civil society. This is a fundamental component for a welfare policy. If we don't understand the role that civil society plays in the public-private discussion for the companies and so forth, it is extremely important. Again, that civil society has an analysis, proposal, a vision, and in this context, Laura Becerra will be sharing with us her perceptions. And this is not just a final speaker for the panel, but also it looks at a panel where we're seeking to reduce poverty and to ensure more effective work. Laura?
Thank you and good evening. Of course, I would like to thank Alisa Bárcena and the entire team at LAC because throughout this process, since the adoption of the 2030 agenda, this has opened up the possibility to not only present our diagnosis, but been able to interact and dialogue, which is very relevant to us. When I was invited, and Mario, as moderator, you sent us a conceptual note, which was my guide for my intervention. Nevertheless, I would like to say that being part of a mechanism that you know is of civil society organizations, jointly, we have put together a diagnosis and proposals that today I will present. Mario, in the conceptual note, suggested that we kick off with where we're seen at a world and global level, and that is why we'll have a brief presentation of some consideration in terms of what the planet is facing, of course, and then getting into Latin America and continuing with that same development model. So 5 years after the launching of the 2030 Agenda for Sustainable Development today, millions of people are living in extreme poverty and also many people living in poverty. Inequality, as we know, has reached unprecedented level with a very large share of the world population living in very poor conditions. So income and wealth continues to be focused in the wealthier 1% of the population. We are also facing what has been repeated here, climate change, that disproportionately affects the most disfavored groups and people living in developing countries. Or not necessarily developing, but countries that are very poor or excluded on account of the lack of sufficient resources. And the worsening of the climate runs the risk of increasing the vulnerability of people. From January to June 2019, millions of people have been displaced on account of hurricanes and cyclones. So we reivindicate this idea of a fair transition with regard to climate change worldwide. And of course, we reiterate what we have said, several organizations regarding ratifying the Escazú Agreement, which the LAC Technical Secretariat has, and that we believe that the countries that have not ratified it should join in. And so we believe that this is an essential agreement in order to face the situation that we have today. Now, we must refer to what is happening with economists. I'm an anthropologist, not an economist, but the World Bank reminds us, in fact, that we are living through a critical situation. In their report just presented in 2021, consider that this year the world economy will in fact recover and grow at about 4%, supposing the initial distribution of COVID-19 vaccines should continue throughout the year. However, the World Bank itself says that achieving a recovery of the world economy would imply controlling the pandemic, and that those responsible for the formulation of policies should apply reforms that increase investment. And here, a footnote, the prognosis is that the investments will not occur because of an expression of the critical situation. There is a remarkable drop, as has been said, and for Latin America as well as for the European Union. I don't know if Cristina is still there, but the drop, or the 5 point something in EU, and for Latin America 6.9. So identifying challenges in terms of economic policy, the bank insists that in the long term, structural reforms are needed. And this is the matter of this forum and this panel, that we must recognize this. But what do structural reforms mean? That is the question. Mario said we want a discussion. Yes, we do want discussion, because any structural reform, it has to do with in-depth changes that have to do with the model and the economic policy and the social policy. So what we need is to reach an agreement on what are the implications of these structural reforms. And we've said it elsewhere, that this pandemic was not the one that created such the critical situation of the economy. We must say firmly that the pandemic showed that the model that has been applied, at least in Latin America, is not working. So we would like to call your attention, as we've also said elsewhere, on cooperation for development. This is essential. And also, Cristina mentioned the agreements, trade and cooperation agreements of the EU with the countries of Latin America. Well, unfortunately, they're more focused on the trade side. And cooperation, for example, the Mexico-EU agreement, did not substantively change. And so therefore, this cooperation for us, well, since Mario is asking for suggestions, continues to be essential for Latin America. We do not have international cooperation and official aid, which has dwindled and declined over the years. This is also documented. And so then, cooperation should be recognized as essential and indispensable. At the G7 meeting, they recognized that international cooperation was absent in facing COVID. And And that was said at the G7 meeting. In Latin America, this has already been said. Well, a number of things have been said, and also the diagnosis and the ECLAC documents are showing clearly to issues vaccination, the insufficient pace of vaccination that reflects the major differences among our countries. So we need to set right this and move ahead, as was said by Alicia, towards regional integration, which is the other thing that is on the table. The region, as was said here, has weak health systems, and we're referring to what Mauricio said in that in Latin America, 81% of the population lives in urban areas. And so we must pay attention to cities. And there, unfortunately, that is where contagion increases. So we must pay attention to that. Regarding the 2030 agenda, Christina also highlighted what it means. The agenda, from our viewpoint, is an alternative development model. It is a roadmap. And although not binding, does for us, civil organizations that understand that also for ECLAC and many countries, is our guide. If we're speaking of a new paradigm for development, we must include the agenda as the scenario that we want to reach. We believe it is an instrument for global, regional, and national governance tool, and that recognizes these various dimensions of development, but also mentions the democratic pillar. It's not merely an agenda that calls on us to understand the 3D dimensions, the economy, the social and environmental aspects, but also recognizing that government players will have to pay attention to democracy within the framework of the agenda. And so we believe that this is an instrument for piloting. And at the high-level forum in New York, these are the multilateral spaces that we have so that governments may say how they are meeting the agenda. Nevertheless, our concern is that the governments of the region have not changed the economic model. It's not within the framework of the new paradigm. And so therefore, when many governments say what they have advanced in terms of SDGs, we discover that often there's a long list of social programs implemented and that do not necessarily have this holistic, multidimensional approach, cross-cutting gender and rights. And so this does not necessarily mean that countries are meeting the agenda from that viewpoint and that truly have a new development model. And so also we pick up on what ECLAC has said in that partnerships, well, we do agree with partnerships among all players, but they say that we're hoping for a change in behavior by the state players, the players of cooperation and the private sector, that this be properly regulated, as also the civil society. So to speak of partnerships and articulations, this means that we should modify our behaviors and should survey the behaviors of the various stakeholders. And so, well, also we make a long reference that hopefully this document may be shared regarding the international framework referring to the societal rights to participation. And we recall the words of the UN Charter that clearly says the United Nations is not the exclusive domain of states, but us people. And so, aside from referring to the UN Charter and what it says, we also recall the call for action in Belgrade, requiring that the voice of people be defended for a fair and sustainable world. Because for several years now, we've identified and reported the increasing closure of space for the civil society organization. This is unfortunately is a world phenomenon and not merely particular to one another country. And so we must make efforts so that this come to an end and that the true civil society be recognized as the drivers of development. This is something we gained in Busan in 2011, and where there was a mention of the global partnership and recognition of organizations as the drivers of development. So we'll say no to the closure of civic space. We must be not only consulted and invited to multilateral space, we believe that we also have the obligation of being a true party of these reforms, of which there's such talk in the United Nations, or the reforms, and we believe that we have a lot to say and we should truly be included in these discussions and reflections. Another very important thing, the means for the implementation of the 2030 agenda is not just the money, which is essential, but we're saying that cooperation must be reviewed and amended, but also this must include civil society organizations, and they must be supported in order to meet the 2030 agenda in our countries. I have a very long paragraph here asking for ratification of all the conventions and agreements that I will not read, but let me say the rights of the elderly, of people with disability. So there in our declaration, we've included all population groups and international agreements that our governments have signed or not, and in order to modify the situation of these population groups. And we end by saying that we agree with LAC when we say that national and regional compacts should include democracy, that is not always considered as a horizon for the 2030 agenda. And we reiterate that we wish to be part of this plan of action that is being devised. And we agree in the compacts, articulations, partnerships, and we say that we too want to interact and be heard and to be part of the decision making. As Alicia said yesterday, virtuous interaction. So that is what we would like, interaction that entails the possibility of this being binding, and that we organizations may contribute with our experience and with our right to do so. So thank you very much for this possibility, and hopefully we will have an opportunity to say a few words later. I'm at your service. Well, thank you very much, Laura. And I believe that it could not have been a better way of closing these presentations, with a decisive intervention that ensuring that the agenda should be very much toward equality and participation. Well, we'll open up 3 minutes per delegation for the statements by the delegations. And the first delegation that will be taking the floor is from the Republic of Cuba. Please, Cuba is recognized. Thank you, moderator. First of all, the Cuban delegation wishes to greet Alicia Bárcena and the entire team at LAC for organizing this very important forum for the countries of Latin America and the Caribbean. And also, I would like to greet all the panelists that have taken the floor this afternoon, and thank for their very interesting presentations, focusing on the needs of developing countries in relation to issues such as climate change, sustainable development, among others, and the need to have solutions to these challenges. Moderator and chairman, the COVID-19 pandemic has led to a health, economic, and social crisis. It has affected the democracy on account of the implementation of a heartless neoliberalism. The pandemic has endangered what has been achieved in recent years, especially in terms of the reduction of poverty and inequality. We are facing the greatest contraction since 1946 as a result of a widespread fall in developed as well as emerging economies. In the case of Latin America and the Caribbean, LAC has shared the figures affecting the economy as a result of the pandemic. And also the drop in the demand for imports. A setback similar to those recorded in the midst of the 2000s. COVID-19 pandemic aggravated in recent months with far more contagious strains have sharpened the need for international cooperation so that everyone may face this in better conditions. In addition to the pandemic, in the case of Cuba, we suffer the trade, economy, and financial blockade implemented against this country for recent years, and that seriously affects the economic and social development of our country. The more than 240 measures implemented during the government of Donald Trump, with more than 50 also added in 2020, this is a clear policy against the people of Cuba. And so also the campaign against Taiwan and other people. These are, under any circumstances, would be unacceptable, but in the current conditions, even worse. Chairman, for Cuba, the 2030 Agenda is a state commitment, a national priority, which is sustained on the 17 Sustainable Development Goals and the strategic pillars of our national plan for social economic development. Our country has strength and progress in many areas, such as access to health, education, social protection, and gender equality. It is thanks to the political will of our government, the development of science, and the work of our scientists. Today, we have 5 possible candidates for a vaccine against COVID-19 that will give security to Cuba and the world.
Mr. Chair, the goals for the 2030 agenda, the topics of solidarity and shared effort are core to ensuring our success. Thank you very much. Let me now recognize St. Kitts and Nevis. Deputy Prime Minister, the floor is yours.
It is there.
Thank you very much, Chair and delegates, distinguished ambassadors. St. Kitts and Nevis would like to indicate that, we have listened to the discussions over the past 2 days, and especially as it relates to the small developing states of which St. Kitts and Nevis is part. And we are aware that as the smallest state in the Western Hemisphere, we have certainly, we are at a disadvantage in terms of our size, but I do believe that we have, by this COVID pandemic, has taught us some lessons which we have utilized to make adjustments to the way we look at life internationally, and especially as we want to ensure that St. Kitts and Nevis survives and is able to have recovery going forward. We want at the outset to thank the government of India for its generosity in terms of providing us with 20,000 in vaccines, doses of vaccine, which will help us to get our country on the path to a high level of immunization so that we can have our countries opened up again. We have recognized that the COVID pandemic has created significant dislocation for our economy and has caused us to seek to do things differently, find new ways of doing things, making adjustments in the way we function as a government and as the private sector doing business. We have to make adjustments knowing that the tourism industry is all but decimated and closed to us at this time. The panel this afternoon, the second panel, has identified the issues which we have to deal with if we have to make a recovery for the people of our countries and the people of the region. I think this is important. So we've had that diagnosis which deals with the effects of climate change, the effects of the pandemic, the threats which small developing states face from ongoing natural disasters, and the high debt at high interest rates, which puts us at a disadvantage. We listen to the case of Brazil, which, although it does have debt, its debt is internal, which makes it easier to manage. Whereas small developing states like St. Kitts and Nevis, our debt in the Caribbean is external debt, which sees higher rates of interest, but also sees the foreign exchange and the ability to repay those debts within reasonable times, causing us serious challenges. Now, there's also the issue of how do we deal with our young people who go through school, go to universities, and then have difficulty when they enter the age to enter the world of work, have difficulty finding jobs. We have to look at that. That is a critical aspect for us here in St. Kitts and Nevis. We are looking at ways of doing two things: getting the debt relief, getting concessional financing for ongoing development, which is important, which tells us that there is a role for the international funding agencies, in IMF, the World Bank, the IDB, to play in helping small developing states like St. Kitts and Nevis to be able to establish that fiscal space about which we speak, to engage in ongoing provision of services and to service its debt. But more importantly for us, the desire to ensure that our people are able to work, it means that we have to look and identify new areas of growth for creation of jobs. We have to look at those new areas, whether it's in the digital economy or the green economy or the blue economy. We have to look at those areas. And it is to the international funding agencies that we have to look to assist us to deal with the development of those new areas of growth for employment. Employment of our young people is a critical aspect, I think, for the ECLAC countries. It's a critical area, because if our young people are not employed, then they're the distractions they have, and which creates juvenile delinquency or engage in different activity which are antisocial and creates stress for the economy, then imposes a different pressure on the small economy of like St. Kitts and Nevis. So we have to look at those areas. We have to look at partnerships with our private sector, public and private partnerships, to ensure that we are able to get the private sector to grow, to become creative, to expand, so that they can create the kind of jobs to provide decent work for people. There is also the challenge, I feel, of finding ways of reducing managing the costs, the need for reinvestment to expand their businesses. think this is important for St. Kitts and Nevis. As a small island, our space is limited, our resources are limited, so we have to find new ways of creating employment opportunities. We have to look at energy efficiency. How do we engage in the development of renewable energy? In a small country with limited investment resources, we have to either partner with the private sector or get funding through concessional terms to engage in development of renewable energy production. We have to look also at ways of prioritizing internally now, and this is the public sector. How do we prioritize our investment in public infrastructure, knowing that public infrastructure is necessary for any expansion in the economic development, whether it's tourism or other avenues of development to create jobs. Now, it is imperative for us as well to find ways of education for transformation. We have to find that new paradigm. We have also to look at education to ensure people become creative thinkers, looking at becoming entrepreneurs, using the technology, skills development with the technology. And I think if we are able to look at those areas as a small developing country, we can then see the 2030 SDGs being accomplished. There will be challenges because with this COVID pandemic, we have now to lift ourselves out of the depths into which COVID has plunged us. And it's going to be a big challenge. And I think the international funding agencies should be looking for these opportunities to help develop small developing states with limited resources to get out of the abyss into which COVID-19 has plunged us. But we do have the ideas, but we will need the assistance and the concessional funding and the partnerships about which I spoke, and the new thinking to ensure that we get ourselves into ensuring that we eradicate poverty, we have employment, that we have health issues under control, and we don't wait to react, but that we are proactive in preparing for any future pandemics which might come and affect us. And I hear the 5-year cycle being raised. Now it means that in 2026, we should be looking for another pandemic. Now I hope to God that does not happen. But if we do need to be able to provide the infrastructure, the health infrastructure, the education infrastructure, the employment possibilities for our people, so that we do not again become decimated in a way which we have been decimated because we did not anticipate the COVID pandemic. Thank you very much, Chair, and thank you very much, delegates, for listening.
Thank you. Let me recognize Camila Saepeda, General Director for Global Issues of Mexico Ministry of Foreign Affairs. Camila, the floor is yours. Thank you very much, and cordial greetings to all of the panelists, Executive Secretary Alicia Bárcena. It's always good to see and hear you. Let me go back to what Laura was saying on behalf of civil society, because it is important to return to these spaces as we've seen throughout 2020. The importance of civil society has been one of the victims and has slipped behind, as have so many others as a result of the pandemic. So the question is, how do we ensure that that voice is heard? So I just wanted to echo this call. We're very pleased to see in this regional forum that this request has been honored and that spaces have been made available for civil society to participate. We know that the agendas have been very full. It's been hard to acknowledge and to have space for everyone, but it is very good to hear the comments from Laura here today. Also, within the context of Escazú, Mexico and Argentina have worked together And on April 22nd, we have an agreement which will take force, and we hope that the region will join us in celebrating. In terms of this panel and listening to my colleagues and panelists, I should note that we are engaging in a preparatory meeting that will be taking place in the context of ECOSOC on the topic specifically of financial planning. And we've called this the Group of Friends of Monterey. And of course, the conversations are under Chatham House rules, but I can say that we have over 100 representatives of countries from around the globe, from ministries of finance, that are working on these topics, as well as representatives of the World Bank and the IMF. This is something that we've been highlighting in Mexico, is that we have all of these recovery plans, but they must include all of the risks that are mentioned here: the fiscal disequilibrium, the challenges, the gender perspective, climate change, even cooperation plans for multilateral development banks, that from the planning perspective must include the financial risks of all of these aspects. So that is why we are also seeking new and innovative solutions. And perhaps I could share one success story from Mexico. And that is, in September last year, we issued our first SDG sovereign bond. I believe this is a clear example of how progress can be made on this agenda, and provides an opportunity for the private sector as well to support the efforts of government. We've looked specifically at SDG 2 on hunger, on education, employment, and industry, SDG 9. And throughout the process, we have worked, of course, hand in hand with UNDP to ensure transparency and effectiveness, looking at these efforts overall. So these innovative mechanisms are possible, and they are needed now more than ever. And resources are needed from all possible sources. We should not just depend on the multilateral institutions, but our own authorities and officials are poised to create these types of attractive instruments. So congratulations on the conversation. It's been a pleasure to be here and to share this particular sovereign bond experience as well. Thank you very much, the Director of Social Affairs of Popular Planning for Venezuela. Mari, you are recognized.
Okay. Si no procedemos.
If Mari is not available, we are running a bit late, but if Mari returns, we can give them the floor, but perhaps we could take a couple of more moments before turning to Alicia Barcena. For Camilo, did you have something you wanted to add or to comment? I know it is late, especially for our friends in Europe. Camilo, if you are with us, we can give you the floor for a minute or two, or perhaps three. Is Camilo here? Camilo's also not with us.
I'm with you. Sorry, I was waiting to hear
Camilo.
Here, you have to stay and speak.
I thought we were waiting for comrades from Venezuela, but I'm happy to speak. I think that there's not much that I'd like to add. I think it's been a very rich conversation, and I thank ECLAC for the opportunity to participate in the dialogue. The point made by His Excellency from St. Kitts and Nevis really took what I would have added as closing remarks. I just want to stress again that the issue of fiscal space is not an academic issue for the countries of the Caribbean. And I know sometimes there's a discussion that, well, and I take the point, certainly from my brother from the central bank, that there are always going to be competing challenges for your fiscal space. But the very fact that you have the ability to assess these competing challenges means that you have policy space. And if you're in a situation where your debt to GDP, through no fault of your own, your debt to GDP is a number approaching 100%, it means that at the interest rates at which Caribbean countries borrow, that sometimes 50, 60 cents out of every dollar is just to service debt. And so that means that most of the money that you're raising, there is no option, there is no policy space, there is no possibility that the money can be spent otherwise. Now add to that mix a natural disaster and a pandemic, and you realize that you're in a country that simply has no ability to address the type of transformative work that we've been discussing here. So the first thing we have to do as an ECLAC, which is the most important think tank, the most important driver of policy in the region, the first thing that we have to do if we're discussing the context of Caribbean countries is how are we going to free up these Caribbean countries to do the type of things that we know they must do if we're going to have transformative development. And stripping away all of the debates that you may have about the optimal set of policies that have to be applied, what you have to do with the size of your public sector, your private sector, how can you get your private sector more involved, how can you create jobs, all of it. Before you get to any of those conversations, you have to discuss the elephant in the room, which is debt, and the way that it stifles fiscal and policy options in the context of the Caribbean and places them. The former, a long time ago, the former Prime Minister of Jamaica called it trying to walk up the down escalator, and it's not even that easy anymore as walking up the down escalator. It's a desperate situation, and again, when people think debt, they sometimes there's a mindset that comes that this is a result of profligacy, this is a result of bad economic planning, this is a result of poor choices made. It's not the case. It's simply not the case. You're talking about countries that are hit by hurricanes, and when people have no houses to live in and no roads to drive on and no bridges to get from point A to point B, countries have to borrow in emergencies. And when you're talking about something like COVID, it's fine to have theoretical arguments, but the fact of the matter is that countries of this size, having lost their primary income earner, have to borrow. And we're in a position now where you're trying to achieve the Sustainable Development Goals with 7-8 years to go, and the countries of the Caribbean are shackled more than ever by debt. And so the first step that we have to tackle as a region, and that ECLAC has to help us tackle, is how do we get these countries more able to do the things that we know they need to do. And that first step is debt relief. And that first step is debt for climate swaps. And that first step is concessional financing. And let us get past these arguments about who is middle income and who is high income and who is low income. Let's get past the arguments as to what the IMF says you should divest yourself of and what conditionalities apply. Nothing starts in the achievement of the Sustainable Development Goals until and unless the countries of the Caribbean are more able to deal with the individual specificities of their existence, and that requires us to address the issue of debt. And so those would be my final words on it. It's very important, very happy. Alicia and her team have been doing excellent work in this regard in conceptualizing what needs to be done. But we're at the point now where we have to do what we think needs to be done by whatever means necessary. And if this is going to be a decade of action for the Caribbean, it also has to be a decade of increased fiscal and policy space as an urgent priority, dealing with this crisis and the crises to come. Thank you.
Very kind. And before handing over to Jose Francisco and Laura Becerra, let's recognize Vilmara Lugo, Vice President for Social Institutional Planning in Venezuela. Vilmara, the floor is yours. Can you hear me? Yes, perfectly. Well, thank you very much for recognizing me and the ability to address you all. The government of the Bolivarian Republic of Venezuela since 2014, when it took up the collective construction of the 2030 Agenda in 2015, this was adopted as a roadmap for the inclusive development. Over time, began implement national, regional, and cross-cutting plans and initiatives to improve the living conditions of the people in domestic conditions and externalities that affect the ability for the government to carry out this sustainable development. Nevertheless, the political commitment taken on at the highest level has been accompanied by many measures to implement the 2030 Agenda for Sustainable Development together with a social development plan, the Plan for the Homeland 2019. In fact, our entire national development plan, as well as public policies, are based on the Sustainable Development Goals. The issue of financing of SDGs have an aspect that our country has had to face. That is the blockade and the blocking of the country's economic resources. This is not just a matter of expropriation of our own funds, but also curtailing our possibilities to implement the measures. The SDGs require action by the UN system to modify the situation. Thank you. And now we will recognize Jose Francisco Pacheco, member of the Board of Directors of the Central Bank of Costa Rica. Jose, thank you for staying with us. What would you say after this provocative intervention that you had before? What would you have to add? Well, yes, thank you very much once again. I understand that there is a great difficulty in carrying out the political agendas when you're in the Ministry of Finance, and this is in response to what the Minister of Finance was saying. But based on the experience in Costa Rica, we had an added complication, that is that society in general began saying that the creation of this fiscal space that we needed, especially in a country that since 1994 had no fiscal reforms, would be in exchange of a reform of the state. That is, the creation of a fiscal space is not a free ticket in terms of for those who are policy makers, but it will require creating some sort of a commitment with society regarding the use of those funds. And so I believe that it is not merely an academic matter. This is a claim by society. If the public sector is not doing its job, it must provide goods and services for which these programs were devised. And so this is an interesting debate as to which should be that signal, that commitment that the public sector is seeking fiscal space is proposing to society in this dialogue that we were talking about earlier. It is based on that to have a much broader and renewed social compact. Well, thank you very much. And now, Laura, how can we close? Well, thank you. Three things. Once again, speaking of the option to change the economic model or paradigm and reiterate what was said by the economists, that it's not just a technical matter. Changing the model is also a political matter. It depends on the political will, the will to have a dialogue and establish consensus, to do away with dogmas, to deconstruct the neoliberal model and build something new. A second thing refers to our participation in civil society organizations that we see essential. And that is the various players, stakeholders, unions, indigenous groups, women's groups, youth groups, the environmental groups. We've all contributed to SDGs in many ways. However, although that is a milestone and unheard of, and has to do with our vocation, it also means that what we need is that these movements should work in a more articulated manner with the governments. Otherwise, the situation with the pandemic has become each day more complicated. So we're reiterating our call for the protection of people who are active in this way. We, journalists, defenders of human rights, what we do is not something fluid in a favorable condition and an enabling environment. On the contrary, it's an adverse environment. And in Latin America, it has been documented this is the most lethal environment for those who are defending the land and the human rights and the environment. And this was mentioned yesterday because in our countries, as legality and illegality, as a colleague was saying, this is something that we need to put an end to, because this is a private investment or private capital that is not responding to any ethical principle or any rule so far. And once again, we reiterate that as civil society organization, through this participation mechanism, we're continuing to demand this horizontal and transparent dialogue in this privileged space. But this space must expand, must include more organizations and movements. And as we have said to ECLAC and Alicia Bárcena, our partner, what we need is to improve our dialogue with our government. That is, we have now this privileged space at ECLAC, but this space is a sort of liaison. Maybe the possibility that some things could be improved in terms of dialogue among society and national governments. That would be what we aim for and what we have to say in closing. Well, thank you very much, Laura. To close, I will ask our Executive Secretary, Alicia Bárcena. I believe this has been a very interesting panel, a very sincere panel, honest. People said what they had to say. And that is what we most like at ECLAC. So, Alicia, the floor is yours. Well, it is so difficult to close a panel with so many ideas, so novel and so interesting. But very quickly, a few thoughts. I believe that the most important thing is to determine what the panelists are indicating, that, as was well said in the first session, there's no turning back. And so therefore, since there is no turning back and we must always move forwards toward the different future, what we must see is what are the risks that we have today in this return, between inverted commas, not to normality, because there is no normal that we would like to return to, but something new. But there are risks. One, the development model so anchored to a structure. Mario, you said it. And so therefore, one of the risks that we run today is, on the one hand, reprimarization. And why are we giving so much relevance to primarization? Let me say it very clearly, because, and I'm going to paraphrase Mariana Mazzucato, because it's not the same to build waves that extract wealth. And what our societies are not doing today is creating wealth, creating with that employment. And what is being done today by so many is extracting wealth without the creation of value. So creating value is something that we must do today, because this difference between creating wealth or extracting wealth has been made unclear. And that is a tremendous source of inequality, because primary activities are extractive by their nature. And so therefore, that value that is extracted, a resource that is extracted, involves no creation of wealth, nor employment, nor chains. And that is why we are concerned with reprimarization. We're also concerned with the inefficiency of unsustainability, environmental and sustainability. The difference between the two is not that clear, but it's the inefficiency, and the inefficiency of inequality, which we have put on the table. The fact that today that there is no full access to health, to education, to nutrition as public goods, that means that this is very inefficient in the long run from the economic viewpoint. And the truth is that this, we must see it very clearly. The world has changed, yes, but what has sharpened have been the asymmetries, global, regional, national. And I would like to say that one of the discussions that we've had here in the previous panel is precisely the geopolitics of the vaccines, which I believe has shown so clearly these asymmetries in a brutal fashion, I must add, because what is happening? The USA self-supplies. Europe struggles to acquire the vaccines to be vaccinated. China exports, yes, but exports vaccines with certain conditions that are of concern to Europe, of course. And we see China and Russia there supporting India and the Caribbean, and Russia, there they go. And I would say that, well, we have economies under quarantine. And one thing that I thought very relevant, posed by our dear Camila Gonzalez, and that is the seasonality of the crisis. How tourism, for example, in the Caribbean last year was not so dramatic, but this year it will be, on account of the confinement and what is happening. But I would like to return for a moment to the asymmetries, because the truth is that this is hurting. And I would say, analyzing what was presented to us by Cristina Galash, and I regret that she is not here, because I would like to know, what is Europe prepared to do for Latin America and the Caribbean, quite aside from the trade agreements? Is Europe prepared to open its market? Is Europe prepared to share patents, especially with regard to the environment, the pharmaceuticals? Is Europe prepared to share other things? That's something we need to address. If Europe wants to relate to Latin America and the Caribbean, well, we do, but this must be more symmetric, not so asymmetric. Europe and its investments are very welcome in Latin America and the Caribbean, because they bring a greater transfer of technology, employment, plants, proposals that are very relevant. And we saw this clearly with Enel, with Mauricio, who mentioned very relevant things, because Enel regardless of the pandemic, Enel will continue to invest in renewable energy in Latin America. It's investing $11.9 billion in Latin America. And this is very relevant, and they're investing in the electrification, decentralization, centralization. And so I would say welcome European investment. But of course, we also need technology in Latin America and the Caribbean. What we need is that the value chains be real value chains, that these are chains that create wealth and employment and so on. And the rise in the price of commodities, of course, this is good news for some countries such as Argentina and Brazil, as long as those additional gains for greater terms of trade or better terms of trade should be invested in productive capacities and skills that may truly lead to the transformation that we're looking for. I really like the intervention by our dear, well, of course, Andres spoke very clearly and said that the dilemmas of Brazil cannot be compared to the dilemmas of the Caribbean. Well, Brazil has so much more fiscal space, although the interest rate a moment ago went up, and this will have a major impact, yes, but it's not the same to have a domestic debt that will allow you to invest. If you invest correctly, this might allow you to promote or strengthen your productive sector. And Brazil has not done that, and they should, I believe. And so now, in the case of the Caribbean, I believe that the call made by the Caribbean is very relevant, because what the Caribbean is saying is debt relief today. Camilo Gonzalez says, debt relief now. And that is imperative. We have said it at all fora, and I do hope, dear Camila, representative of Mexico, now that you will have the Monterrey group meeting, please discuss relief of the Caribbean debt, because that is unsustainable. And also, the only way for the Caribbean to move ahead is via investments in adaptation. And so that debt relief that we have said is a sort of swap or possibilities of opening up space for investment, for adaptation. Yesterday, we presented how many people in the Caribbean live below 5 meters above sea level. So, and that is a tremendous asymmetry. It is a climate asymmetry that there's no way of giving a name to this. And that is why I return to what the delegate from Cuba said. We must take up the principle of common responsibilities in terms of the climate, finance, and also the vaccine. This is very, very important.
So I believe we also need to show our solidarity, Latin America, with the Caribbean, and also with these discussions that we will have on March 29th, the discussions of the Monterrey group, and the 5 proposals that we have set forth about how redistributing liquidity, it exists. We just need to redistribute it. And one way to do that is with the special withdrawal rights, because obviously if these drawing rights are reviewed and revised, a significant amount could be made available to the Caribbean, and hopefully the G20 will make that decision, and hopefully the states will push for that. Another aspect has to do with the relief fund for COVID that has been proposed by Costa Rica, which is also very important because it is a special purpose fund independent of the level of income that would allow for a fund to be made available that is not completely concessionary, but it would be concessionary in terms of the exchange rate or the interest rate and so forth. We need to look closely at this. That relief, once again, it is a huge topic in Latin America and the Caribbean. We know that some 57% of what we receive in exports are then dedicated and allocated to debt service. And that is the average. And that's no problem, because obviously in the Caribbean, it's much higher. Countries like Jamaica end up attributing 70% of their foreign revenue to debt relief. Jose Francisco Pacheco, of course, he shared with us his thoughts on financing. And these two components are tremendously interesting, how we can link result-based with financing. But the problem is that the planning ministers have not been involved in the emergency planning processes in many cases. So therefore, the evolution of expenditure, transparency, and the role of civil society, of course, can be very important, given that some of the reforms that are being proposed by the state's civil society or society in general is rejecting some of these proposals because they need to better understand what is in fact being proposed. And there's definitely room for progress there. The topic of bonds is certainly an interesting one. I think there's an opportunity there as well, innovative mechanisms for financing, including sovereign bonds, which is, again, green bonds or the sustainable development bonds, such as the case of Mexico, which has already been placed. I believe Costa Rica and Colombia have as well sustainable development bonds. And it's very interesting that the private sector is saying that these are important because they reduce risk and they are positive and favorable also in terms of the interest rate. So these are, again, attractive opportunities. What is behind all of this discussion is what will the future look like? What will the future look like from the perspective of the recomposition of sectors? Where do we start? And Mel is saying, of course, that energy is a key catalyst for this digital inclusion. Jose Pacheco has told us, we would agree. Resilience, of course, for the Caribbean is the quintessential and most important, perhaps, value, as well as the investment in health, education, the core values that are of such overarching importance. What will employment look like in the future? Will we prioritize inclusion because the world increasingly is digitalized? If that's the case, what is the role then of the major companies that are concentrating these values today? And the idea of creating value and extracting value is key. Is online, we're no longer the consumers, we are the product. And the major corporations are using our information to create value. But that's not redistributed. That wealth is not being redistributed or distributed. And there's also a very attractive debate here. I think topics we've gotten started talking about, but we haven't finished them. How do we get a virtuous cycle between government, civil society, and the private markets, or a more inclusive market, to have a more cooperative, collaborative economy? I think that's where we are headed, but the conversation is really just getting started. And Mariana also referred about how we can go from a predatory capitalism to a productive capitalism. And the question then is, what do we do with a series of goods, including the vaccines, that have been created collectively with public funds, but that don't necessarily have the public dynamic in practice that they should? There is much still to be done and much to be said. But another takeaway is the following. Let me give you an example about this question of creating and withdrawing wealth. The pharmaceutical companies just asked for a tax reduction. And what do you mean? Why would they do that? They have these patents for the next 20 years. One says, well, why would that be? And so therefore, how do we make a distinction between the value of appropriation versus true value created as a result of productivity or the creation of new goods and services? And thank you, Laura and Camila, for mentioning Escazú, because the Escazú agreement, in addition to being a product, the result of what can be done when you have access to justice, access to information, and citizen participation. It was also a process in which civil society and government negotiated together. It wasn't that governments negotiated and then civil society tried to affect change. No, they negotiated together. Was it difficult? Extremely difficult. And sometimes the conversations were very harsh. But it is a new generation agreement, is the participation of civil society in the creation of a new society. And that is why this forum, and I thank Luis Yanez, Luis Flores, and the entire team from the Secretariat here, and Jimena, and of course, my assistant, my deputy executive secretaries who are present with me here today, because we are all convinced that civil society must be a part, an integral part of all intergovernmental discussions. And we invite government to join us in this process because we know that what we need in the future is a new compact, a new pact that will lead us to work collaboratively and to build a society to which we all aspire. My dear friend Laura, thank you for your support. We want no more monologues or a set of monologues. We want a dialogue, and that is what we are also endeavoring to do. So thank you to you all. It has been a very fruitful conversation. I know that my notes haven't reflected everything that was said, but there are certainly calls to action. One of those concrete calls to action is funding for development that hopefully will be addressed. Liquidity, debt are the two hot topics that we have before us today. Thank you, Mario. Let me turn the floor back over to you as moderator. Thank you, Alicia. Very well. Without further ado, we would like to thank our speakers and the people who have commented on these conversations. It has been a tremendous pleasure for us here at ECLAC to host and to participate in these disruptive conversations. That is for us the raison d'etre. And so we thank you. Let me give the floor back to our good friend, the ambassador, the true host. It is late, of course, but the floor is yours. It is never too late when things are happy, as we say in my country. It has been a pleasure to hear you all and to hear civil society, how productive it is to hear from them as well, not just Camila and Laura, who have also participated, but also those who participated through the chat, a number of women. Of course, we're clearly making progress in that regard as well in terms of participation. This is where we get quality. And we can see this is the population, of course, that is suffering the most from COVID. And we've seen this from the early days of March of last year, the impact that has been generated in terms of poverty, unemployment, particularly among women. We know because of all of these structural aspects have led to a crisis and to collapse. So I would like to go back to what Camilo Gonçalves has said, that Camilo said, indebt ourselves to death, and to indebt, to continue to go into greater and greater debt despite the debt credit rating services and the clarity of the issues that are involved. And we've heard the calls from ECLAC and from others from the beginning that there is this tremendous crisis and devastating crisis again, in the middle income countries. Now, why has Costa Rica presented FACE? And thank you, Alicia, for this introduction to this system that we have presented. And we still have 150 people who are connected to the call, but it is ECLAC and Alicia who has picked up on this from the very beginning and supported Costa Rica in all of our efforts to move this program forward. A program, as Alicia was saying yesterday, is a modest program in terms of the amounts. It's very limited, small scale in that regard. This is a process that can be used counter-cyclically. The resources made available from the UN last year to help satisfy specific needs to help us overcome poverty. As we've seen, poverty has increased or would have increased at least 10% in Costa Rica alone if we had not provided additional resources. And of course, this is certainly even more the case in other countries, as we've seen in the recent Outlook report from ECLAC. But in any case, we can see that there is this discrepancy between the countries that are generating the wealth. As Alicia has just said, it's a question of liquidity and monies that need to move from the north to the south. We are talking about 0.7% of global GDP for those wealthy countries, and that nonetheless would provide an injection of funds that would be tremendously important to the countries that need it. Now, what will we use these funds for? Those funds, as Francisco has said, it would have to be controlled by society, but not through external conditions. Camilo was referring to those shackles in that regard, that is shackling, chaining the countries to the existing systems, and therefore a paradigm shift is required. FACE is that program. It is supported, of course, by ECLAC, with all of the work that has been done. The executive secretary this week has seen the work that has been done and the efforts that have been made and the technical studies that have been effected on FACE in conjunction with other proposals that can work hand in hand to provide a program that will be effective, subject to no conditions other than the condition that funds must be used in grappling with the challenges that we have set forward for the 2030 agenda and the SDGs, in containing poverty, hunger, in improving healthcare conditions, education, and in generating those investments that have a multiplier effect, as we have noted. So again, thank you, Alicia. Thank you, ECLAC, for joining us and for supporting this program. There is still much work to be done. And in this context, we call for all countries to join us and to propose improvements so that we can move forward. And as the pro tempore chair of LAC. Costa Rica, of course, is very pleased and proud to have been the host of this round table. So thank you. And on this note, we will wrap up our second day of sessions of this fourth Sustainable Development Forum. And we invite you to join us tomorrow for our third and final day of the forum with the activities that are scheduled. Thank you, Mario, for leading us in our conversation. And thank you to all of our speakers. Thank you for your participation and civil society. Also, our gratitude and an invitation to continue to join us. The doors are very much open and we look forward to your participation. Thank you very much. Good evening.
Había que dar un payaso de salida. Se declara terminada la sesión. Muchas gracias y buenas noches.
Voy a ver con la Jimena que se puede hacer ya.
Chao. Se supone que tú con más de una licencia podés levantar 2 reuniones porque es como que tomarais la licencia y la podés ocupar en otra.